Yes, thanks. Every human being is the author of his own health or disease. Disease is the result of disobedience to the immutable laws of health that governs life. In this passage, Gautam Buddha is talking about the role of karma in health. Good morning, everyone. On behalf of Adacom Health and Wellness Community, an emerging community in the healthcare sector, I, Chandan Anand, founder, CEO, and group editor of Adacom Media Group, welcome our eminent speakers representing the healthcare fraternity. I welcome all the delegates and attendees who managed to block your time to be a part of this virtual forum. I welcome each and everyone on day two of India's first and biggest new normal Healthcare Leadership Summit and Awards 2022, powered by Kinoff Sealing Solutions. Just let me give you a glimpse of the yesterday's session that is on day one. On day one virtual symposium, we witnessed some meaningful and interesting deliberation. We had diversity from government to corporate to core healthcare and wellness hospitals, representation from Ayush, pharma, and academia. Session opened with the keynote address of two dynamic IS officers, Dr. Hiralal, IS, the former district magistrate of Banda and additional mission director to National Health Mission, and Dr. Rajkamal Yadavji, IS, the district magistrate of Bhagpat district, government of UP, and special secretary of Ayush. We were fascinated by understanding their efforts, proactive approach, and implementation of various projects and policies demonstrating good governance. In Ayush session, we were amused to see how passionately the speakers explained the importance of 7 Indian traditional systems of healthcare representing Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy. We were glad to witness the humble presence of Yog Guru, Dr. Surakshit Goswami. He preached some motivating life lessons and serious health guidelines. Pharma session was equally interesting, and we saw a blend of industry and academia. Speakers from renowned brands like Cadila, Lupin Pharma, Orbindo Pharma, Sun Pharma, Dr. Reddy's, they spoke about the latest technology advancement and digital transformation in pharmaceutical industries. And Professor Ranjit Singh, the Vice Chancellor representing Shobhit University from a small town Gango, Saharanpur, a pharma PhD holder with 25 rich years of industry expertise in teaching, research, and administration, he passionately advocated the importance of R&D, clinical trials in pharma education. So that was a blend of academia and industry in that pharma session. This will definitely open the doors of the collaboration and networking opportunities. This is yet another beautiful day, and we are again about to witness august presence of our eminent speakers and experts and stalwarts of the healthcare and wellness industry, and also appreciate the participation of the attendees and viewers who are representing the healthcare community at large. We welcome our partners, powered by partner Kenoff Solutions, associate partner Ecurex, university partner Shobhit University Meerut, and DY Patil University Ambi Campus Pune. I also thank our 5 community partners: education, human resource, governance, media, entertainment, and art, who supported our mission by spreading the ideas of socio-digital transformation and innovation. We feel really privileged and glad to host this event. Before going ahead, let me just drive your attention towards the introduction of Adacom Media. Adacom Media is a growing media company enabling communities of education, HR, healthcare and wellness, governance, media, entertainment, and art to effectively advance their businesses and strategic interests by becoming their collaboration and growth catalyst. Our passion is to co-create, co-learn, and collaborate for innovation and socio-digital transformation. A short view on how we started this media venture. When the overall industry was sailing across the VUCA phase of existence and survival during the second phase of COVID-19, where the companies were in a cost-cutting situation or shutting down their operations, loss of jobs and uncertainty could be witnessed by many, our foundation team dared to start this media venture. We got incorporated just a couple of months back as a media startup and named it Adacom. where ADA means passion, zeal, and COM stands for communication and community. Our five core values are aspiration, reimagination, digitalization, opportunity, and readiness, abbreviated as ADOR. We were able to extend employment opportunity to the deserving young candidates having strong will, zeal, and skill to work and to outperform. With this, the journey started as a social entrepreneur. Our media team is passionate about putting an effort in co-creating the positive change in the society by inviting community leaders like you and having this deliberation in such knowledge sharing platforms. We aim to become India's leading and most desirable media voice by enriching community with the ecosystem of knowledge sharing platforms, information, and news. And I strongly believe that health and education, these two are fundamental rights of each individual, and we must look for the options and opportunities as how we can contribute for the betterment of the society. Going ahead to introduce and give you brief about the today's session, that we'll be discussing the socio-digital transformation in the healthcare industry. Ardacom Media is hosting India's first and biggest 2 days virtual symposium named as New Normal Healthcare Leadership Summit and Award. It acts as a host and a platform where eminent personalities, thought leaders, and industry experts will e-meet to deliberate on next and best practices, innovation, investment opportunities, and roadblocks to the sector's progress. We have dedicated sessions on healthcare, leadership, CIOs, CTOs, wellness, Ayush, pharma, medical colleges. Please stay tuned to join and witness the inspiring leadership dialogue, a fireside chat round with the celebrity actor and entrepreneur Kunal Kapoor today at 1:45 p.m. Prestigious award ceremony of leadership, healthcare leadership awards and felicitation. We will recognize and honor those individuals, hospitals, and organizations who have demonstrated a significant contribution to healthcare, wellness, pharma, Ayush, health tech, and medical education. We got decent participation and nomination response for the Ardacom Healthcare Awards. The awardee names will be declared live at the valedictory and the award ceremony session today evening. So don't miss to attend that. So we are now going to witness some very interesting and powerful deliberation on the very latest and engaging topics which are related to your interest area. The session is live on our LinkedIn page. We will also be tweeting the content on Adacom Twitter handles. The links will be shared right now in the chat box shortly. Kindly like and subscribe our social media handles and pages to stay tuned and be updated. I request all the attendees and viewers to make the event more engaging and lively by your contribution and participating by appreciating the speaker's dialogue and asking Q&As in the chat box. Thank you so much. So with this, now let me have the honors to introduce our special guest of the day, Kuvar Shekhar Vijendraji. He doesn't need an introduction, but as a formality, let me have this honor to introduce him. Kuvar Shekhar Vijendraji, he is the co-founder and chancellor of Shobit University and a prominent social entrepreneur based in New Delhi, who carries leadership roles in many organizations. He is a persistent advocate of initiatives for education and healthcare for all secular values, crisis management through diplomatic and peaceful ways, and globalized systems of learning and peaceful coexistence. He has been instrumental in the development of number of higher education institutions, research centers, and hospitals in northern India. He is very actively involved with number of social organizations also. Some of his major social affiliation are advisor to Sri J.P. Mathur Charitable Trust, New Delhi, chairman of Livelihood Development Research Foundation, founder of KSV Ayurveda Medical College, Hospital and Research Center, founder Center for Naturopathy and Yogic Sciences, and various others. Acknowledging his contribution to the society in his area of education and other concern, he has been copiously honored and awarded. Recently, SOCHM conferred him as the Lifetime Achievement Awards in 2018. He has traveled widely in India and across many countries around the world. It is an honor and privilege, Kuvar Shekhar sir, to have you as our special guest on the day. What better start can we have with your opening speech. With open hearted, sir, may I please welcome you for your opening remarks. Kumar Shikhar, sir. Sir, please unmute.
Okay. So thank you very much, Chandan. It is indeed a pleasure to be here with you, a very dynamic leader in your domain. I was really happy when you were talking about the inception of this organization. One thing which you missed, that you gave job opportunity to all those who were asked to leave from well-established organizations otherwise during the pandemic. And this is one of the most important social cause what anybody can do. So kudos to you, compliments to you. Healthcare Leadership Summit in New Normal. This is exactly what we all need to understand and talk about. I'm happy that first time, 2 days, very rigorous with a very prominent panels, you are discussing on this issue. And I'm sure that all deliberation, debates, discussions will get converted into a white paper. Because I feel that in this new normal, even the nation needs a new healthcare policy. And your contribution can be there with the policymakers to see that how a new policy can come as new education policy came, new healthcare policy for the new normal can come. So yesterday it was a wonderful session. I was able to see the glimpses and hear some of the speakers. Today, as you mentioned, that social digital transformation has to be discussed. I think we need to discuss some more points, like World Health Organization has a lot of international policies. But in last 2 years, during this pandemic time, we have seen somewhere that those policies need to be revised and reviewed. And many times what happens that policies, those who are made by WHO, they may not fit in very well in our Indian context, because we do not have only one pathy. We have a holistic health system in our nation, be it allopathy, Ayurveda, naturopathy, yoga, even homeopathy we are using, Siddha we are using. There are so many things. We need to integrate them with today's need. So we have today, I'm sure that we will discuss socio-digital transformation in Indian health community and how it is going to help create awareness, role of Indian government, local bodies, healthcare companies, and other institutions. It is very important topic. And definitely it has to be discussed, and we will be discussing. I will like to share some of my thoughts on that. The most important thing, what was there, that the healthcare fraternity, the health sector completely, if we look at, they were not very savvy with the new technologies. But in last 2 years, what happens, the tech shy health sector has become tech savvy health sector. Because everybody was sitting at home, nobody was there, patients were not able to come, so, but delivery had to be made. So everything right from telemedicine and many other things had been used. Artificial intelligence had been used, many other things. We need to discuss them, and we need to see that how we can start ensuring that they are used throughout the country, throughout the nation. If I look at the healthcare sector globally, it has enjoyed a very stable cadre of leadership in recent years, because demand was more, competition was less. A cutthroat competition, generally what we call, it was not much visible, and especially these 2 years have given a boost to everybody in healthcare sector. If I look at the Indian government also, in last few decades, we have seen that adaptability of the technology has come, expansion of employment, revenue has come, government is taking a lot of initiatives, new schemes are coming to ensure that digital health and otherwise also health sector should contribute in economic growth also by expansion. So a lot of positive things have come, and COVID has accelerated the speed of innovation. Like in education sector, we have seen edtech companies coming. In health sector, we have seen health tech companies coming. Now we have to see that how they become very inclusive with every part of the nation, not only in the big cities with big hospitals, but with small hospitals also, that we have to see. If we look at March 2020, before March 2020, we were working in a very spaced manner. We were working in the same manner, what everybody was doing, and it was limited to hospitals, it was limited to certain facility. But the major part of the healthcare leaders, they were working in isolation. They were limited to their hospitals, they were limited to their clinics. Even if I look at educational institutions, they were limited to their course curriculum. But post March 2020, a new thing has come because uncertainty came, disruption happened. We were not knowing what is the problem, how to find a solution. We were not knowing where to read, which book we have to refer for that. And it started creation of new things. Creation of new knowledge started in educational institution. Integration of different pathies started. More innovative practices started. Experimentation started, which was missing otherwise. And it has given a very fair use of technology in health sector. One more thing very interesting came, and I'm sure that everybody will appreciate that our government started talking about telemedicine. I remember my meeting with one of the minister of Uttarakhand. And when he said that in Uttarakhand, I think the solution to give healthcare to everybody in the remotest area is having telemedicine. Now, how the telemedicine will come, again, all stakeholders of health sector, they have to come together. Because when we talk about social-digital transformation will never happen when one way we will do it. First, we have to make the society aware, because in telemedicine also I am seeing that awareness is not there. Even if facilities are there, people are not aware about that, oh, will it help? But it has to be increased, and we all have to work in that direction. And like for health care leaders, I wish them to focus on some emerging areas. What are emerging themes I feel personally? One is that they have to challenge traditional role definitions. I want that health care leaders, they have to become tech healthcare leaders also. They had been social healthcare leaders. They have to shift to remote and at-home care delivery mode also. It is not like that I have to come to the hospital, I will visit your clinic, then only I will be in position to get it. Now we have to make people understand, and we have to work in that direction, even in the institutions, that everybody should be in position that in remotest area, using technology, how we can make a supply chain, how we can, using telemedicine or other modes, how we can do it. And decision making and execution. What does I mean by that? Actually, what is happening that if there is, for example, a radiologist, in small towns and villages, there are no radiologists. So what is happening that a person has to move somewhere else to get an X-ray done. But now technology is there. The global radiology forums can be made, and I know many companies, those who are doing it. That in a smallest village, if X-ray machine is there, the moment X-ray is taken, it is sent somewhere else, and within few minutes or few hours, a report is there. So we have to see that thing also, that decision making and diagnostic abilities, they have to be fast, and we have to incorporate technology more and more in that, so that it becomes more inclusive. Now, otherwise we say data is money, data is gold, data is everything. Data sharing is not happening actually in healthcare sector. I want and request everybody in healthcare sector that if we really wish to empower and make it more strong, data sharing systems have to be developed in this country. Because what happened even in COVID-19, we have seen that nobody was having any information or data. And digitally integrated patient journey we have to ensure. Like again, I am using technology here. I am telling that every patient, what is happening if a patient moves out of the city, then a lot of things he has to carry with him. If we can make such portals, and if Indian government, I am happy they are trying to make such portals where the complete biography and patient history will be there, it is going to help a lot. And the most important thing, that we have to focus on holistic drivers of health. Again, in last 2 years, in new normal, we have seen it is not only the physical health, it is mental health also. There are many other factors and drivers of health which need to be taken care, and we have to integrate our systems. Time has gone when we will say, okay, no, if you are using allopathy, you can use that. If you are Ayurveda, you can use that. In a country like India, where demographically we are so rich, population and everything, and we have a lot of challenges and opportunities. So our ancient science has to be used in that. We have to have very inclusive approach. I know what I am talking, many people will not agree with me, especially the professionals will not like to agree with me. But time has come when we have to incorporate everything together. Unofficially, yoga has been incorporated by all. If we talk to the doctors, they say, no, I'm not taking my medicines. I am working on naturopathy. I'm using yoga. I'm taking Ayurveda medicines. But officially and socially, now we have to accept and start working in that direction. Then only the things will start happening more and more in that direction. One thing in this complex world, and with all these certainties, we all have to understand and appreciate our healthcare leaders. Again, I compliment Chandan and the team. Why I'm telling you that the whole humanity is now dependent on you. More creativity has to be. Whatever you have, share it. Let us come together. We have one Ayurvedic medical college. We have one naturopathy and yoga college where we are offering a program called BNYS. The AMS program we are offering from last 8 years. We are trying to work on creating global Ayurvedas, global yoga teachers, global naturopaths. And what we are trying to do in that direction, that we are trying to incorporate all technologies, all knowledge, and instead of just informing or delivering information available with us, we are initiating, encouraging everybody in the ecosystem to create new knowledge. Because if we create new knowledge in this area, and definitely when new knowledge is created, challenges are there, acceptance challenges are there, many other issues will come initially. But once they are created, then application of that knowledge will also start. And that is what exactly is required. So my appeal to all healthcare leaders today on this platform and otherwise is, let us join hands together in a very holistic manner and see we not only become a healthy country physically, economically, but mentally stress-free, a country where we all contribute. And to the government also, I will appeal that after this summit, Mr. Chandan is going to submit a white paper and with some suggestions, recommendations which will be made by the experts. And we should start thinking about a new health care policy also in the nation in this new normal circumstances. Thank you very much for having me today morning. Chandan, it was indeed a pleasure for me to join you. Looking forward to listen to all speakers and experts. Thank you very much.
Thank you so much, sir. What a powerful deliberation and an opening remark on day 2, sir. इससे better हम लोग कुछ expect ही नहीं कर सकते थे, sir. And I'm always, and I'm always happy and I'm always blessed that I see you as one of a very supporting pillar whenever I look back or whenever I'm in a trouble of organizing forums or platforms like this, Kumar sir. Thank you so much for giving me so much of strength mentally and emotionally also. So it is always great honor, sir, to have you. And we always we follow you on your social handles, and we see how socially responsible you are, sir. Let it be a small plantation drive, your active contribution during being standing shoulder to shoulder with the COVID warriors, and no, helping all possible best out the way Shobit University as a brand can do.
Very quickly, I would like to mention, I know time constant may be there. As
Is
you mentioned, just one thing you wanted me to speak, that what as an organization we are doing or we did during this COVID time. So actually, like when this COVID issue started, we realized there are very small issues which need to be addressed, right from the availability of the mask to the quarantine centers. We made an appeal initially to our students in our universities that if everybody can make 10 masks and distribute that. And suddenly we saw the chain going on, and that ripple effect was there, and more than 1 lakh masks within no time were distributed pan India by our students. Then we requested the same way Scouts, and throughout the nation, Scouts did wonderful job. The second was quarantine. So we decided that our hospital, our international hostels of the university, they should become quarantine centers. And we requested the administration for the same. It was not the administration who asked us. Then we realized immunity boosters are required. So our immunity booster, I'm happy to mention that it is used not only by the people around, but it is used by the policymakers of this country, including it is used in the President House today, Vice President House, Prime Minister House, and many other places around the country. And for all these minor contributions and many other initiatives, AICT last year awarded us with the National Vishwakarma Award for the services during COVID time. So thank you very much for giving me opportunity to boost the organization also and share what we were doing. So thank you again, Chandan. Thank you.
great, sir. Thank you so much. And even I complimented on the post where I saw you along with your managing trustee, Dr. Shobit Kumarji, when you visited Rashtrapati Bhavan and met President of India. And I feel that I was meeting him, sir. I started imagining in that way. And your personality and simplicity is such that, sir, you easily mix with all class and age group of people, making everyone feel so special. Your uniqueness reflects in your leadership,
Chandan,
sir.
Chandan, I think we should move on. And there are many other
I can take a time, sir, because my second
we will discuss otherwise. Okay.
No. Let me conclude that, sir. I know that your uniqueness reflects your leadership, sir, and you are having such a humble personality, and we seek your continued blessings and patronage in days to come, sir. Thank you so much for joining in. Yeah.
Thank you. Namaskar.
Thank you. So with this, Itisha, may I invite you to introduce the next panel speaker. I may take an excuse to introduce the second special guest because with his busy schedule, he might be joining anytime in between the session. So with this, we start ahead with the panel one now. Itisha, may I please invite you for that?
Thank you, sir. Thank you so much. Now I would like to introduce our first panel of the day. So let's start with Dr. D.K. Gupta, Chairman and Managing Director, Felix Hospital, Noida. Dr. Alok Rai, Chairman and MD, Medica Group of Hospitals. Namit Soni, sir, CEO, Soni Hospitals, Thane. Dr. Wundawali Suri Raju, Managing Director, Regal Hospitals. Adarsh Somashekar, sir, Chairman and Managing Director, Ovam Hospital. Ms. Neha Lal, Senior GM, Operation and HR, GCS Medical College Hospital and Research Center. And Ms. Lal is also the session moderator. So over to you, Ms. Lal.
Welcome, everyone.
So very good morning to all the eminent speaker. I feel so privileged to be here on this platform among very big giant of the healthcare industry. And today's session is going to be very, very interesting. So with a little bit of background on healthcare industry is that, as you know, that healthcare has become one of India's largest sector, both in terms of revenue and employment. Healthcare comprises all hospital, medical device, pharma companies, CROs, and outsourcing, and telemedicine, and medical tourism, insurance, clean medical equipment companies. So these are all growing at the brisk pace due to its strengthening coverages, services, and the increasing expenditure by public as well as the private. I'll just throw some data which we have, which has just happened post-COVID as far as healthcare market is concerned. That is, the healthcare market already has increased threefold to rupees 8.6 trillion by 2022. In the budget 2021, India's public expenditure on the healthcare stood 1.2% of GDP, which is remarkable. There are few government initiatives. I'll just take the reference, and this has been taken for the healthcare industry in the recent years. That is, in September 2021, Prime Minister Narendra Modi launched the Ayushman Bharat Digital Yojana. That is mission. This mission will connect all the digital health solutions of hospital across the country with each other, by which every citizen will now get a digital ID, and their health record will be digitally protected. That is the biggest move. According to the other spokesperson, the Indian government is planning to introduce a credit incentive program worth rupees 500 billion to boost the country's health infrastructure. And the program will also allow firms to leverage the fund to expand health facility or medical supplies, with the government acting a guarantor and strengthen COVID-19 related health infrastructure in a smaller towns. In June 2021, Union Ministry of Health and Family Welfare, in the partnership with the UNICEF, had a capacity building workshop of media professionals and health correspondents in the northern eastern states of India on the COVID-19 situation and the need to beat a myth regarding COVID-19 vaccine and vaccinations, and to reinforce the importance of the COVID-19. So we have a lot of data which is available, what all initiatives government has taken for both the players, public as well as private, and many new initiatives and the schemes and missions have been launched by the government. So the road ahead is India is full of opportunities for the players in the medical devices industry. The country is also one of the biggest, leading destination for the high-end diagnostic services, with a tremendous capital investment for Making India project. India medical devices for consumers have become more conscious toward their healthcare backup. With that data, I just opened today's session, which has the background of healthcare system needs to have a balanced infrastructure with the technology and to the human touch to provide the satisfactory services to the customer. The current healthcare Indian structure is undergoing the revamping and whole new environment for all the people, all the community, let's say post-COVID. So we would just like to interact with all these distinguished speaker here on the healthcare infrastructure, on the initiatives taken, and what is a roadmap for the further development. So we'll start with that. My first point to Dr. D.K. Gupta, sir, from the Felix Hospital. Sir, what are your views when, healthcare cost is rising, increasing, as we know that how can Indian healthcare, system to ensure the top-notch healthcare services is made available to the people, to the community who are coming in the rural background where, the access of the healthcare is always issue. There is an issue of affordability, there is an issue of accessibility. So what are your thoughts to address this particular point? Sir, you'll have to unmute yourself, please. Yeah.
Thank you so much for inviting me, and I'm really thankful to the team. I would like to tell you that we all know that about 70% of our population is residing in the rural area, and only 30% is residing in this urban area or tier 1 or tier 2 cities.
Sure.
However, paradox is 70% of healthcare infra is consistently is confined to this tier 1 and tier 2 cities only, and primary healthcare, even secondary and tertiary healthcare, they are not being accessible properly to these residents who are in rural area, around 70% of population.
Sure.
We talk about the expenditure, budget allocation to the healthcare sector. Indian government for last 70 years, they were investing around 1 to 1.2% of their GDP, as you already told us. And it is among the lowest in the world. Even WHO says it should be 5%. BRICS country, excluding India, they invest around 5%. And if we talk about the developed countries like US, Canada, Italy, and European countries, they invest between 10 to 15% of their GDP.
Oh,
And if we talk about the investment in the healthcare by the private and public sector, 90% of the healthcare investment in these developed countries by government only.
sure.
And most of the healthcare services are provided free of cost too. They're all insured. However, in India, it is dominated by 70% beds, doctors, nurses. They are provided by healthcare providers. These healthcare providers are come from the private healthcare providers only. Means healthcare industry, that is around $3 billion industry in India. It is dominated by purely by healthcare providers, those who are come from private sector. It means we have to somehow strengthen the private sector also, and we have to expand we have to increase our GDP allocation to the healthcare sector also.
Sure.
Normally, this government already has been done that healthcare spend has been increased from 1.2 to 2.5%, and government has vision to increase it to up to 5% by 2025. That is on the way, but still we need something more than that in from government side to improve the allocation of budget to the healthcare sector. Number two, if we talk about the private healthcare providers, as I have already told you, that 70% of services are being into OPD services, indoor services, diagnosis services, pharma. They are all provided by the private healthcare providers. And the problem for us is that we have very poor recovery from these government panels, being it CGHS
Yeah.
or ESI or ECHS, any government panel, any government PSU, they are very slow in like providing our bills, clearing our bills. So I think that has to be strengthened. Second, if we have talked about the rates of these, CGHS rates has not been revised for last more than 7 years. Ayushman rates are not viable. We cannot work on Ayushman rates if we want to provide quality healthcare services to our rural area. If these they have made only on variable cost, they thought that infra doesn't cost to hospitals, human manpower, doctor don't cost to the healthcare providers. Only based on the medical consumables or only on variable cost, these packages has been designed.
Yeah.
So there should be a revision of these packages from Ayushman, revision of rates of CGHS rates. Can you believe that doctor fees is 150 rupees for DIM or MCH or MS or MD doctor who's
Yeah,
having
sure.
over 10 or 15 years experience? So I think there are so many flaws in the rate list of this CHS, CGHS, and also Ayushman. Also capping, there are cappings has been done for best most of the
Pharmas and yeah.
packaging has been done, but the packaging is not rational. It should be rational. It should be intelligent price capping. We are in favoring of packaging and of price capping, but it should be intelligent. It should not be based on only on variable cost. It should also incorporate some part of fixed cost also, like fixed cost, infra cost, light cost, nursing cost, human resources cost. I think these things has to be worked on. If we talk about strengthening our providing good healthcare services to rural area, definitely preventive, primary and secondary care has to be strengthened. And for that, we have to go physical, means physical presence should be there through primary healthcare services, and digital also through telemedicines or even incorporation of artificial intelligence, AI should be there, especially for skin diseases, diabetic retinopathy, for radiology, as our like speaker has already told us regarding radiology services, because radiologists are very less and we cannot go to tier 2 and tier 3 cities to provide radiological services. So AI should be incorporated, digital transformation should be there, so that we can provide primary healthcare services at their doorstep, and secondary healthcare services should be strengthened in tier 2 and tier 3 cities. Medical colleges should be open, land allocation for private sector should be easy, funding should be easy, financing should be easy, rate of interest should be there, subsidies should be there, even the licenses, you should know that we require around 28, 29 licenses to run a hospital in different parts of this country, and there is a huge time required, licensing is required, money is required. I think this should be one window platform. Even wherever there is a one window platform, still there is a manual intervention, and then we have to go physically and we have to please them. So that's why I'm telling you, it's basically all licenses to run a primary, secondary or tertiary healthcare services, they should be from single window with a fixed stat turnaround time, so that we should ensure that as early as we can get these insurances. Insurance penetration is quite poor. We knew that in COVID, we know whosoever were not having insurance, they were not able to get treatment also. Even in India right now, 62% of Indians are spending out of pocket to get their treatment. For that, they have to take loan from relatives and friends. They have to sell their lands. Even they have to sell their jewelries also. So for that, insurance penetration, including private and government, both should be increased in tier 2, tier 3, even in rural area. I think these are all main points. Even infra should be well developed in tier 2, tier 3, so that nurses, doctors should be ready to go in these cities to provide their services. I think if we all allocate all these points and we like do work on these points and improve these points, definitely we will be able to provide good quality healthcare services to all, especially for rural area.
Yeah, sure. So, sir, you have actually touched upon very important agenda. I would say the challenges of the healthcare per se and what the government should look after. One important point about the Ayushman Bharat, because that's a big boon, but I think the affordability of that packages, and I would say the rationalization of the packages is very much required. It is actually now the agenda of the nation, because most of the state government, of course, the health is a state agenda, but all the states, BJP states have taken PMJY, and that is like whole India, and all the community and citizen is involved in PMJY. And a hospital like us, medical college, teaching hospital, trust hospital, I mean, they have to have the PMJY, because all the mid-size, medium income group, I mean, they have the PMJY card, and the BPL have the PMJY card. That was the vision of the Prime Minister, and that is how it is running. But yes, I totally agree that the payment coming from the insurance, payment coming from the government or state government or PMJY, that is too huge. And I think up till now, even the private hospitals are suffering for the payment of COVID. That's a lot of corporations have taken, initiative to support the COVID expenditure. Still, there are crores and crores are pending for the payment. So we totally agree with that. With that, the best message is to increase the contribution from 1.5 to 5% for the India, and that is indeed a need for the nation like us. So thank you so much for giving a lot of good insights which can be taken. I request Mr. Chandan to please note all these agenda and take it up to best and fullest manner. So moving on, sir, I request Dr. Alok Roy, sir. Sir, one point Dr. Gupta has suggested about the packages. So in that particular line, what are your suggestions? How can we build a kind of a treatment packages which is equitable distribution for all the community, let's say, based on the customer demand post-COVID? So we have got the capping on the packages. We have the CGHS packages which have not been revised. PMJY are totally packages which cannot be afforded by any of the hospitals. I'm talking on my hospital. We also cannot afford, compare about the private and corporate hospitals where the margin is there. And as we know, the cost of doctor, cost of nurses, as such, they are, I would say, underempowered. So thinking of all qualified healthcare professionals around us, how do we address this issue? And what are your suggestions to build up packages in such a way which can be considered by the government?
Namaskar. Thank you for inviting me to order this conference. First of all, I will request others to put themselves on mute. I think the Batra group,
there is a lot of noise
Batra
coming.
group, the CIO is he should put him in. Thank you very much. That's very kind of you. So, Ms. Lal,
Yes,
I
sir.
agree that the packages have never been in favor of private healthcare providers traditionally.
Yeah.
If you see last 20, 25 years, since I've been practicing healthcare and running it, some of the big hospitals, there was always something missing when they came to calculate the right value to a package. They had their logic was that we are providing you numbers. And we had our logic that it doesn't fulfill the basic criteria. And over a period of time, the gap has widened, as Dr. Gupta has said, that 150 rupees doctor's fees. Fine, we agree. But our struggle with the government is ongoing. That struggle will not stop. We will have to constantly, and if my sources are correct, NHA has been given a mandate where they have got one of the senior person who's sitting in PGI Chandigarh, who's trying to calculate the health economics and how much packages will cost. And probably end of this month, by 31st March, they have to submit. And once they submit the report, there would be upward revision of many rates which are very, very unviable for private sector. So that would give us some kind of breathing space. And once that comes up, then we can also go back to the government and talk to them about CGHS rate revision, upward revision, because there are some 2014 or some 2008 rates are still prevailing. Fine, that's something which needs to be done. But now the more and more third-party payments have stepped in. The very fact that PMJ, all rates are not bad. A lot of rates are very good. Yeah, medical rates are bad. So sweeping them with one broom, saying that all rates are bad, may not be a very fair statement to the government. But the fair thing would be to say that some of them are good, some of them are bad. So they need to really look at it and bring it to a level where it's a viable option. Because private sector also, we use this government scheme as a filler, as a fuel rod. Whenever we have a low on the TPA and cash, we use them to service them, and that way we survive this. It's a win-win for both. Having said that, I would like to put in some thought. There are a lot of leaders here sitting here in their mind, if I succeed in just planting the seed, that you need to come up with an answer where you have to build affordability in the masses by using some unique, innovative methods. A lot of funding, like to give an example, a lot of finance companies are available which are saying that if you have a patient who can't afford, refer them to us, we will fund them and deduct it from them. I mean, like EMI, you buy a car, you buy a cardiac surgery. So those innovative methods are coming in. Then the societies can pool money. We all can raise some funds. We need to come up with some methods where we empower people at large to access our care at a cost which is affordable to them. And it's a kind of like Impact Guru which has come up now.
Yeah.
They raise funds. I have a doctor whose mother is admitted, and we have contacted Impact Guru to raise funds for it. So various methods of mopping up funds will have to be found out.
Okay.
See, the cost has only gone south in last 30, 40 years. Keeps on going south, keeps on going up and up and up. No cost goes down eventually. Doctor's price goes up. We were, when we started our career, we were given 25,000 rupees. We thought we are rich. Today you give 2.5 lakh rupees and still may not join you. So lives have changed dramatically and will keep on changing. We need to find new ways and methods. Just drubbing government that they are not able to give it, telling people they're not, like to DPS have not revised their rates in the last 2 years. They may not revise because there was a COVID, then they will wait probably for some more time. So I think we all need to, like we have found out the ways, innovative ways of surviving in this COVID, we must find innovative ways of surviving financially. And at the end of the day, we are here to serve the larger population of the country. Whatever it takes to serve them, we should come together and do that. That's what I like to say, Ms. Lal.
Sure, sir. I think your views were actually thought-provoking. When we are talking about one side, you have actually shown some ways as to how to balance the government expectation versus community. And the three main points which I have noted is about having the innovative ways to manage the healthcare cost we take. Of course, we can utilize the AI-based solutions. We can reach out to the market. There are a lot of funding agencies available. There are a lot of investment companies out there they would like to invest. I think those paths will have to be clear and explored upon. And the third important is to empower major community, major group of people where they can understand the sensibility of the healthcare requirements, healthcare needs for the community, and they can do something about hospitals, healthcare facilities in rural area, in urban area, wherever it is. So I think I request Mr. CEO, Mr. Chandan also to keep on noting such important points, which are actually the takeaways from this particular session, and making a note as a concise note out of this session. Thank you so very much, sir, for sharing your thoughts. Moving ahead, as we talk about issues as well as some innovative solution from the thoughts, and then the one which point attract to my mind is about the AI enabled solution. So we have Mr. Namit Soni, CEO from Jaipur Soni Hospitals. Sir, what are your views? How can technologies like AI, because as we see, the healthcare has become hybrid. I would not say it's totally, telemedicine, it's totally virtual. But actually, few of the patients still would like to see doctors in the hospital. We have to run hospital as well. So few of the services are available online, few of the services are available at the base hospital. We would also like to see our patients, physically. Doctors would like to see the patients physically. So I would say it's a kind of a hybrid model, which is kind of prevailing in this particular year. And we never know when the fourth wave of COVID would come, and that is expected, as I heard, in month of July or so. So having all these challenges besides, and you heading Sony Hospital, what are your thoughts? How can we leverage on the AI benefit solutions in such a higher expectation of the consumer and customers? Sir, over to you.
Hi, good morning to all, especially my August panelists here. It's a pleasure to be on this platform. So it's quite appropriate that you asked me this question, because 2 months back we have just installed India's first AI-based MRI machine in our city of Jaipur.
Oh, wow.
It's a first for us nationally. We're just in the process of inaugurating that center. We've done it in PPP project with the government of Rajasthan in Sony SMS Medical College. So I like to take two parts of it. First, try to share with everyone the view on how technology really makes an impact in healthcare, because definitely there are some generic benefits. But if you look at in terms of specific to healthcare, where and this COVID pandemic has given us an acceleration into technology adoption. Where it is making major impact is in helping us lowering our costs, whether it is in terms of operations, whether it is in terms of in terms of the care that we give, or whether is in terms of the reach to our patients. Technology has really helped us to bring our costs down. Then through digital, our reach has increased, where our patients, even with our patients, if they're even 200 kilometers away, they can actually follow up on their treatment and be more, you can say, resilient in the treatment. Otherwise, because of the costs associated, and we being a slightly on the poor side of with most of the patients, it was difficult for the patient to travel again and again to the hospital, and there used to be a lot of dropout. So that
Yeah.
reach and that digital dispensation is really playing a very important role in shaping how healthcare is changing going forward. And last but not the last most important thing is the patient-doctor communication. Today, if you see how the doctors are communicating with the patient, the biggest challenge for us is how we can smoothly communicate our complete treatment to the patient, and we can share that treatment. Today, with WhatsApp coming into picture, we can share everything, the prescription, the booking. The fact is self-registration. Today, a patient doesn't need to wait at your reception counter. He can register himself and walk in directly to the chamber. So the kind of patient-doctor relationship is going through a major change. So, and taking all that into perspective, AI part is going to play a major role. I shared with you right now how we have installed an MRI machine.
Yeah.
Now, where that will make a difference is the image acquisition. Today, we plan to do an MRI in less than 7 minutes. And I don't mean just the sequences. I mean the complete scan with patient moving in, moving out, thanks to this technology, because the machine is so advanced that it will slow down the scan if it finds that there is any abnormality, and it will speed up the scan if it finds that the scan is normal while the scan is happening. I mean, that is only possible thanks to AI. So we are moving in an era where computation, data analytics will really help us to move and provide care at a more affordable level and to more people. Whether you look at our own centers, I'm sure there are very respected administrators and MDs and founders here on this panel. They'll agree with me that the kind of patient data that we have, the 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 details in the patient data, if we start studying that data and helping them better in giving, whether it is designing packages for them, designing follow-up clinics for them, that has changed the way we give our treatment. So data and AI, the power to analyze that data is changing how we deliver healthcare to, and it is making it better for the patient and for the doctor. So it's a win-win for everybody. So, and one last point I want to share here for everyone is that AI seems like a very big black box to all of us, because we talk AI, but we don't understand AI. But the biggest thing is that if we start small, I want to take the example of PMJY that people are talking of, the Ayushman scheme. So Rajasthan has implemented a similar scheme in 2016, and it has gone through 4 iterations every year. And in the last 6 years, it has gone through 4 iterations. And right now, it is called Mukhyamantri Chiranjeevi Yojana scheme. And
Yeah. So earlier it was Bhamasha, I believe.
it was Bhamasha, then it became Ayushman, then
Yeah.
it became Mahatma Gandhi Ayushman, and became a Mukhyamantri Chiranjeevi Yojana. Why I'm sharing this fact with everyone here is that overall the schemes, rates, tariffs have changed. Definitely there is a disparity, there are gaps, and as Alok sir and Dr. D.K. Gupta mentioned, there are areas where there are highly unviable, in fact unreasonable, I won't say unviable, unreasonable, because till the time you can't ascertain a cost to the treatment and you have a package, you can't deliver treatment. So
Sure.
and that's where I think medical management creates an issue. But the point I want to stress is that they have, over the last 6 years, treated so many lakhs of patients, and that data they're using to ensure that the packages for certain departments, especially surgical ones, are now attuned for a practical workup. And secondly, the kind of care they want to give and the issues that the patients are facing, they're eliminating that. So they are even thinking of coming up with an OPD plan today. The
That's
only
nice.
thought here is that they are trying to improve the adoption and the fact that people should go for treatment. So it is basically expanding our pool of patients. The
Sure.
biggest success for this scheme, I feel, is it is increasing our patient base, because many times, because of affordability, patients would not be able to even take the treatment. And today that is changing. Even in villages, we are present, we have a corporate 100-bed hospital in a rural town, literally a rural town with a population of 1 lakh, called Balaji Soni Hospital. There, 90% of our patients are from this scheme because affordability is an issue. But the biggest point is that the patient comes with confidence now to the hospital. So if and a doctor, if he prescribes a treatment, the adoption is very high. The dropout or the bounce rate is not there. So there are many advantages to this scheme. Definitely there are challenges. We should listen to our, you can say, the customers, the patients, the insurers, the general public, and we should improve on this. There was a small study, that definitely the politics of things will come into picture, but it will give benefit to the public at large if healthcare services is made available to more people. And that's my parting thought for everyone.
Sure, sure. I really thank you. I think you have touched based upon 3 major things, which of course you have shared your own experience of utilizing AI technology and MRI, and I think the follow-ups and the gap between the patient and doctors have been reduced, and you personally have witnessed the less dropouts, and good patient satisfaction. That is very interesting to know.
I just want to share, Neha ma'am, that we are doing more than 300 MRIs per day because of this technology.
Per day.
300
I mean,
per
that's
day.
really per day.
Yeah.
So
Yeah.
I mean, really, it's a notable, seriously. So yeah, so this is the best example which Mr. Soni has just shared, and thank you so very much. Government scheme, you have talked about the state yojana, which has been revised every year, keeping the mind the whatever the patient's requirement, hospitals expectation, and giving them the finest experience, having the feedback into consideration, especially the consumers. And that's how the OPD has been covered by the Yojana. I think the PMJY also should actually add up such a thing, and our all problem can be resolved then from the Rajasthan government. I think that is the way ahead where we can suggest to PMJY. PMJY cell to look into when we have a huge hue and cry on the packages and the clusters what they have. And I totally agree. Even just Dr. Gupta has mentioned that doctors are not ready to even take the PMJY. In my particular hospital, we have like 60 to 70% occupancy is consisting of PMJY. And I would say that DM and MCH surgeons and all such physicians are not even ready to look into the patients, just because of the cost factor, because they hardly get any money left from the package. Because what we settle is we settle our pharmacy, we settle our diagnostic, and whatever is remaining is there for hospital to eat and doctors to eat. So hardly anything is left from that cluster, and hardly any payment goes to the professional. So this is really a very big agenda. I hope this agenda across states is discussed with the PMJY cell, and some concrete solution should come. I think that is what we hope as of now. Moving to Dr. Gundavali. Sir, very good morning. We had discussed AI, we had discussed the challenges, we have discussed about the innovative ways how to reach the public. So when we talk about AIs and all that, what are your experiences when, what are the, your hospital or your group is taking some step in order to maintain the patient expectations, especially the post-COVID, be it infra, be it services, be it facilities, be it telemedicine or digital use of services. So how is your experience and how you are addressing those challenges? So can you just throw some light on it? Yeah, thank you.
Morning. Thank you for giving me this opportunity. Today, healthcare industry has totally changed. People's expectations have grown up. Once upon a time, hospital was just giving the treatment. Today, hospitality, to reduce the overall, the time spent by the patient in the hospital. They don't want to, waste their valuable time. This is what the things are happening. So some of the actions to elevate the patient experience, what we have noted is, one is elevate patient consent and personalized messages. All outreach should proactively and in personalized fashion address the key causes of friction in a patient's experience and their concerns about health and safety, such as protections, protocols in place to protect against pre-person transmission. Meet them at the front door. Health systems can address unique patient needs and ease. There is a fear till now about COVID. Many patients are not turning out to the hospitals because there is some concern among the patients. So we need to put strict protocols, and we need to create awareness. So they should feel confident. I'm coming to this hospital. They are taking all the precautionary measures. I can go to the hospital confidently and see the doctor. That kind of awareness we need to create. Enhance virtual care options. COVID-19 accelerated the need for virtual care, but many patients were looking for it before and will look for it after the pandemic. Now, health system can develop new care models that meet patient demands for easier, more accessible virtual care. Optimizing the capacity to care for virtual patient and enhancing the experience of virtual care delivery. Listen through social channels. Continuous listening across the social channels in a health system's local market and nationally will enhance gathering real-time insight into patient perceptions and community sentiment. In response, healthcare organizations can quickly pivot their operations to address shifting consumer mindset and realities and measure progress along the way. And people's expectations have gone up. We need to meet the expectations. We need to exceed their expectations. Post treatment follow, immediately calling them and asking whether they are doing well or not. At the same time, they should also feel confident. Now the hospital treatment is slowly shifting to home care services. If you see, around 30 to 40% of the treatment can be done at home care services. This is what the patients feel. Probably in the future, hospitals may have to increase the home care services. That is there. And definitely COVID-19 has created inflection point. Patient experience has always mattered, but now the stakes have escalated, and health system that don't respond to new consumer demands are at greater risk of losing patients to competitors. As you all aware, competition is also growing up. If you don't give the proper facilities and if you don't respond to the patient's demands, then you are gone. This is the right of the position. Now it is the time to transform and grow market share by exceeding patient experience expectations. So give the home care services and reduce the waiting time and give more what they're expecting. Regular follow-up, since the data is available with us, close follow-up is very, very important. They should feel confident about the doctors and hospitals. These are all my views.
Yeah. Dr. Vundavali, I would just conclude. Thank you, first of all, for showing us one example. While I was listening to you, one example came to my mind. As we are moving on, I think, look at around all the apps what we use on day-to-day function. One is our Zomato or Swiggy for our small, home core needs. And I have noticed that, when you order a pizza from the Zomato, immediately after deliver, that is a notification come that how did you like it? And when you click on that, there are a lot of parameters from the delivery boy to that quality of the food or whether the food was hot or not, and a lot of other factors which they have addressed. And that is so interesting. I mean, unlike healthcare, you have talked about the home healthcare, you have talked about all, patient satisfaction, expectation. I think these expectations are still there in the mind of patient. Though it is related to health, we often forget to ask them that how are they doing post-discharge? How are they doing after having the diagnostic test done in the hospital or elsewhere? We just take the money, provide the service and forget. So this is our whole customer base, and we are not able to maintain that, particular with the AI based, I would say, or any kind of feedback system which hospital and healthcare organization can prepare and launch. So I think healthcare is actually lagging behind in adopting the technology, I would say, and lagging more behind in changing their perception. I think all of us, I request all the seniors are here. They can, take this up, and I think we can change the healthcare, because the healthcare is a services like hospitality, as doctor just mentioned, that when we go to the hotel, I think all your front office staff to the, whenever your stay is done, everyone will have the smile on their face. They'll wish you, they'll ask you, how are you today, kind of thing. But when you come to the hospital, our nurses and staff often forget to smile, isn't it? I mean, all of us who are working in the hospital, because they are so much into that work and they forget the soft skill, I would say, rather than we do not smile, we do not ask patient that how are they doing today. Even many of the times, the doctor doesn't know the patient name and patient doesn't know the doctor's name. They just talk, communicate, provide the treatment and gone. So, that personal touch, I think you have showed that personalized care, personalized approach should be built up to exceed the patient expectation and to maintain our customer database. I think that is what I have gathered from your talk. Thank you so much for showing this, doing this approach of the healthcare. Moving on to Mr. Adarsh from Ovam Hospital. Sir, very good morning to you.
Good morning, Mrs. Lal.
Thank you. Sir, we have talked a lot. You were there and patiently listening all our discussion and interaction. Considering your kind of organization where women, pediatrics, the children are taken care of. Recently, we have celebrated Women's Day across India. And this time I have seen first time that Women's Day is actually being celebrated at all the organization very high pace. I think gradually that particular movement is building up. So how are your thoughts when we talk about the healthcare infrastructure post-COVID? What should be the ideal infrastructure, let's say, for men, women, and the children and neonates, which is, kind of need of an hour. Woman needs kind of a services and facilities different. Children would need different kind of, facilities. So coming from that background, we would like to know about, your experiences and what are your thoughts?
So I'll talk about women and children as main.
Yeah.
India used to have a lot of high maternity mortality rate, where a lot of women used to die at childbirth. But government has taken a lot of steps. If you see, maternal mortality is decreasing at the fastest rate in India as compared to the global average. Almost 75% reduction is there year on year as compared to the global average of 40s. So we are doing fantastically well there. Coming to deaths at newborns. So in 1990s, 50 babies used to die for every 1,000. After 30 years, we have come to 20 babies per 1,000. So where are we in developed countries? Developed countries, 5 babies die for every 1,000. Again, government, to improve this, started putting special care baby units where they realized for every 10 births, there will be 1 or 2 high-risk babies. They need some sort of a neonatal ICU.
Yeah.
But they don't have that much manpower. So purely nurse-led units. See, corporate hospitals, they are doing well, urban areas. Rural areas, wherever there is a big hospital in a big town, they are doing well, medical college attached. But there are many talukas where the special care baby unit has 6 to 8 babies, but nurse-led. They can't have a neonatologist in every taluk. Government is only allowing medical colleges to adopt them, not allowing private sector. Look at the irony. They want to reduce neonatal deaths. All the corporate hospitals, you go, Neha, Delhi, Mumbai, Bangalore, we are only running our NICUs at 50% occupancy. Every person here knows if they have a 10-bedded ICU, they have 5 patients. There is easily 5 empty beds, but they are not allowing corporate hospitals to take. They feel that corporate hospitals will take away those babies and charge them and whatever. And somebody had raised the insurance point. Even if a corporate hospital takes it, only 2,000 or something they are giving for a baby per day, which is practically impossible. Almost any NICU, 10 to 15,000 per day will be the cost. That also should go up. But what I'm saying is, if we were allowed to adopt this with the promise that if at all a baby requires a transport, it will go to that particular hospital because those hospital doctors are taking care of the other babies. Otherwise, you know what's the scenario now? If some baby can't be managed there, it goes into an ambulance. That whims and fancy of that baby's birth, alive or death depends on that ambulance driver. He can go to any nursing home, any hospital. That baby can die on the way. There is no regulation on this. You just need to call 108. Somebody will come and pick up the baby. Then the baby and the baby's parents are on their own. If they get a government hospital or a medical college, NICU slot, good for them. If not, they're waiting hours together in front of somewhere where either the baby dies or it goes into somebody. This can easily be regulated to such a beautiful extent, such that these deaths easily can come down from 20 to 10. We have that infrastructure.
Sure.
Third was that, so tying up with corporates, slightly increasing that Ayushman Bharat rates to at least make the NICUs in private viable if they carry these babies. Third was that point, AI. AI, if they adopt, beautiful. I can show you systems now. The AI, if you're going to connect to the ventilator, the baby's vitals, the baby's blood tests, some can automatically take, some could be that you have to manually integrate. Seeing the heart rate, respiratory rate, BP, saturation, glucose, blood parameters that AI is throwing up to you, there is a 10% chance of this baby collapsing in the next 6 to 12 hours. There is an 80% chance that this baby will collapse. The AI is
okay.
You don't have to do anything. This is not like the doctor has to come after the collapse and said, look, हम बहुत कोशिश किए, लेकिन हम कामयाब नहीं हुए, I'm sorry. No, AI is telling you, in this condition, this baby is collapsing in 6 hours.
Yes.
Make them know that time. Poor nurses, they don't know. But the beauty is that machine is calculating everything. It is seeing the heart rate, it is seeing the vitals.
Sure.
So that is the time you shift it. See, you, me, everybody want to reduce this 20 per 1,000 live birth mortality to 5. 5 is where developed countries like England, America, or Japan has reached 4. And 20 to 10, little tying up the government neonatal SNCUs and the corporate, easily they can come off to 10. Of course, with that CGHS rates, with that use of AI, Many private hospitals can have this AI. So these are my thoughts in improving or reducing the neonatal mortality. And that is what I keenly care about.
Thanks, sir. I think first important point which you have just shared, and that is a very commendable thing, that maternity rate has actually in India is the lowest. And I think the contribution made by the corporate hospital who are
Out of the
addressing
development.
yeah. So the contribution which has been done by the private sector in this particular achievement, that is commendable. And interesting topic you have just shared about the right use of AI, where you have a shortage of nurses. I would say the skilled and talented nurses to handle the neonates, which is there in a country like us. To address that particular gap, if we use artificial intelligence, which is throwing up you with the talented and all the balanced data for clinicians to take a decision, that is something very much marvelous. And I think what I look forward in this next decade, the healthcare is going to be AI. I mean, the main agenda to how to use the AI and what are the new concepts can be built and can be utilized for not only the satisfaction, I would say the better treatment approach, better outcome, the clinical outcome, as doctor has just mentioned. I think that is going to, bring in significant differences in the patient life, all as a community as a whole. So yes, the AI is the word which can come up in next decade. So that is what we have concluded. So yes, we are mostly touch based upon all the important points, whether it's a healthcare IT infrastructure, physical infrastructure, reaching out to the rural, the various challenges in the government scheme, be it PMJY. We have discussed on various state government scheme and how the state government is looking into the schemes and government clusters and all that. So putting together, I think I'll just quickly see whether we have any questions coming up from the audience. No, I think what we can conclude is I would just like to request all the eminent speakers here. You can just share the one-line message for Mr. Chandan and Adorcom Media to take it forward out of this interaction. So we'll start with Dr. Roy. He's available. Dr. Gupta. I request Adorcom to just quickly connect with them because I think they are occupied somewhere. Meanwhile, I'll just ask Mr. Nimit Choni just to share your one-line message for the group.
I think after hearing such a powerful talk, especially from Adarsh sir, how passionate he is about neonatal care, I just want to share a message for everybody that we should focus on increasing our reach towards the patients, going more to rural to provide healthcare services. I mean, the better and the more we can reach the patients. And I think technology, government support, and our will as a private sector would really take us closer to that goal there. And I think we should all work towards that. That's my only thought. If we get more, we can cover more healthy population. We can have a healthier population. I think we can really.
Thank you. Got this.
So from my side.
Yeah, from Mr. Adarsh, yes.
Sir, tie up with the government special care baby units and the corporate hospitals in the nearest 10-20 kilometers range, such that more and more babies can be easily managed and saved.
Thank you. Thank you, sir. Dr. Gupta, please.
Yeah, I think spending a lot on GDP on the healthcare part, basically, we should increase at least 2.5 to 5% within 2 to 3 years only. And after that, cumulative expenditure should be increased on this healthcare industry and healthcare sector. Second, insurance penetration should be increased, being it government or private. Rates should be revised for CGHS and Ayushman, especially for packages, and also strengthening preventive and primary healthcare services at rural area and tier 3 and tier 2 cities. And that is, I think, this part.
Sure, sir. Very clearly you said. And I think increasing GDP and budget, healthcare budget would, I think, able to provide all the solutions for all of our expectation, be it a rural healthcare, be it the CapEx or infrastructure, or we talk about the AI tools. I think, yes, the market has to go up. Dr. Vrundavali, please.
Now change is inevitable. We have to accept the change, adopt a new technology, and accept it. We doctors should improve our overall understanding the technology. Still, many doctors are not
Sure. Yeah.
accepting the technology. So some, discussion in the discussion, they don't like it, but we have to accept it. The future is artificial intelligence.
Yeah.
Probably in the future, we don't know what is the role of the doctors and healthcare workers. Artificial intelligence may take over most of the things what
Most
we
of
are
functions. Yeah.
today. We have to accept the change, and at the same time, public-private, partnership is very, very important to improve the rural services. So, government should provide basic infrastructure. They should, give tax exemptions if suppose hospitals are coming up in the rural areas. So, this is my suggestion.
Very rightly said, sir. The when we talk about the mindset, yes, we do face a lot of difficulties because the senior doctors have their own mindset to treat the patient, and that is how the resistance is built up when we even simply talk about implementation of EMR in the hospital. So when they don't want to be, like to operate the computer or pad or mobile app, I would say, and they have their own approach to deal with that. So that is how the things are. But I'm sure that, in a coming time, people will have to embrace these change. People will have to adapt and accept the way COVID has taught us a lot of things. So I think looking forward to that. With that, we end this particular session. If any question from anybody, they can just raise from the audience, or otherwise I'll just hand over to Mr. Chandan. Thank you so much.
So yeah, as of now, I cannot see any question, but definitely what wonderful output and outcome has come from this particular session. It was just a small topic, right? Healthcare infrastructure, and see when the expertise meet and when they share their experiences and few case studies, the outcome of an event or a topic becomes something else. So thank you, Dr. G.K. Gupta ji, for joining us over here. Dr. Alok Roy, Mr. Namit Soni, Dr. Vrindavali, Mr. Adarsh, and Nehalal. A wonderful moderation. Right justice to this panel, I must say, you have done that, because they must have a good expertise and knowledge, but putting right questions and getting the right content from them is a task of a moderator. Starting on time and starting and ending on time is an equal discipline which we need to understand in these virtual forums, because once the mic is given, we try to explore and say everything which we have experienced, but in limited time, right words, and so that it should connect with the audience as well. What we are saying is actually right. I was impressed about the passion, with what passion Namit was saying, that the new MRI machine, which he has just implemented in his hospital, and the way and the fruitful result with that, which we were expecting before purchasing that machine, and the result the satisfaction level is altogether different. Because when you invest in something, it's not only a money, it's about your time, it's about your the energy, and in fact the training which you give to the person who is operating that particular system. So if it becomes a user friendly, with this, a quick question from Namit I would ask you. Agar किसी को इस तरह का कोई technology purchase करना है, आप ही purchase करना है, so what may be 2-3 factors or points he should keep in mind before going for that health tech purchase? Any comment on that?
So the biggest thing of any health tech purchase is what do we want to achieve, and we can have a razor focus with whatever technology. Today, I mean, to just share a small example, there is a app available for security guards. You can have an app available where all your security guard can be on that. I know most of the people must have put their car and their ambulances on GPS tracking and all that. But today, imagine your security person is also on an app which is dedicated for security, and every round he takes, he has to do the checklist and put the photo there. You don't need to create your own system. You don't need to create your own Google Sheets and all. You just need to buy that app on subscription basis. So, that is where technology, you need to know what you need and search for it. And today you can get it in the market. There are so many startups and so many people already investing in that you don't need to reinvent the wheel anymore.
Okay,
In
great.
that case, Mr. Chandan, you'll have to throw the physical, new normal conference where all the AI solutions is available for us to review and experiment. I mean,
Absolutely. Neha, in fact, what would be your answer to it? अगर किसी को इस तरह का technology purchase करना है अपने hospital में, so what maybe 1 or 2 points one should
sir,
keep in mind?
actually, as Mr. Soni has just mentioned, I would rather, if we talk about the patient per se or making a difference in the people life, I would rather seek the feedback of the end user. So as he rightly pointed out, the security guard. So what I do when I head operations here, if I have to bring in any change, let's say any issue or system is interrupting, I always discussed at the guy sitting on the counter at the reception, because they are the user and they know better than us. If you ask the staff nurse, how is this patient, she will give you exact feedback. Khana acha tha ya nahi tha? Patient was unhappy with the doctor. Patient has this difficulty in the washroom. Patient has this difficulty in the linen. So all putting together, I think interacting with the user will give you the best idea that which are the exact issues and which are the app or startup available to address those issues. So I think, and then you can have the marriage of these two things. I think then you can make a difference rather than having startup or any other app just for the sake of it and making it no value in your system. So first format, you have to do your gap analysis, having incorporated all your users. When I say users, you involve the patient itself. When we are talking about the stakeholders, all the stakeholders are involved, from doctor to the patient, and then come out with a solution. This is our exact requirement, this is our exact need, and which kind of solution is then available in the market to explore. I think if that approach is taken care of, we can only make a difference. I hope our speakers also would agree to that when it comes to the practicality world.
Correct, correct. In fact, I was also very much, inclined and attached to what Dr. Vrundavali also said, that in a very easy and a very, straight away language, he said that ki user demand ko address karna bahut zaruri hai. You need to address, because or else maybe you'll be losing that particular customer. जो पता नहीं maybe सालों से आपके पास में आता होगा, but one new entrant in the market, एक नया infrastructure, अच्छा, if he gives a good service to you, in terms of after sale service, agar usko naye hospital se ya clinic se acha mil gaya, that entire energy of engaging with that customer of 10 years long will go in seconds.
Sure.
So uske liye any app, Dr. Vrundavali ji, which you have implemented in your hospital, or what advice will be for the other players who are listening you?
Yes, sir. We are working on one application where the patient's data, using the patient's data, patient will be like, I am aware about that patient and what was the previous diagnosis, and that the same information will be received by the doctors. And at the same time, when the patient comes in front of the doctor, he is aware about the patient. And at the same time, patients, once the treatment is taken, it is followed up regularly using the artificial intelligence. We are working on that. It takes some more time. So for the patient satisfaction, it is very important. Suppose we go to the marriage hall, we expect someone talking to us, receiving us, taking on to the stage. Whether you like food or not, that is different. If someone is not, talking to you, then you will definitely don't like that event. At the same like that, today what has happened, there are some hospitals who are filled with the patients. There are some hospitals, no patients. What is the reason? Gap we need to understand. So customer satisfaction, if you don't handle that, then definitely that healthcare system fail miserably. So we have to adapt the change, and using the technology, we need to continuously follow the patient. Patient should feel I am taken care by Regal Hospital. They take care about me. My health is in safer hands. So that kind of satisfaction they should use.
Right. Okay. So I've asked everybody. Dr. Gupta ji, your remark to it.
I think patient experience is the most important thing, as already told by the speakers and other panelists. If we map patient experience from where they are starting, means from lead generation, if we go on the website, if they come to our parking area, if they come to our entrance, all 5 senses should be measured, like smell, taste, hearing, vision. of that. And the assistant should be everywhere, from whenever patient walked in to the end of the patient cycles. If patient is coming in the OPD, like if from the parking area to guard, reception, even hand holding at the billing area, from billing to counter, like vital charting to doctor, there should not be gap. He should not feel alone. And after that, whenever he comes out, it will definitely, he will be having some radiological test, pharmacy, or cross consultation, surgery. If somebody walks in and help you out, definitely it will improve the patient experience, and definitely it will improve your revenue also. There will not be leakage out. There will leakage will be minimized. And after that, you can take out the testimonial, the feedbacks also. You can improve your operations, your system and processes also. I think patient should be the focus, and patient should be the center point. Everything should be patient centric in the hospital. And if we make happy or make their experience wow or super wow, definitely you can grow anywhere, whatever you want.
Great, great. Thank you so much. Nehaji, there is one question in the chat box. Would you like to?
Yeah, let
take
me
that?
just check. Yes, there is a question coming from one of the listener, that is, how about the efficiency of the AI systems incorporated? I'll hand over this question to Mr. Soni.
So it's a very good question. I mean, the fact is that I'll go a little technical here, that when you implement something in IT, or you implement some new technology, there's a thing called alpha testing, beta testing, and going live. I mean, the place where people actually miss out is they rush the product or rush the service to the end user or the patient in our case. And that's where I think things go for a toss. I feel that we should do a rigorous testing or an implementation audit for what service or what AI technology we are implementing. And if we can do that, and if we can give a nice experience, then the product or efficiency of that AI system will never be questioned. It's just the fact that through the whole process of implementation, we keep rushing the project. So that is something we should be a little careful, or we should be a little wary about that, and we should take our time to get the thing to the end user, because the patient cannot suffer. You can't test it on a patient, and in our case, it's their life at stake here.
Yeah, I think
Great.
the best
Great.
answer you have provided. I think the users the listener must have got the right point out of your report. So yeah, Mr. Anand.
Yes, so with this now we conclude to one of the very interesting and the first panel session of the day. I think this insight has given a way forward how we can progress with the other panel speakers and the topics. Thank you so much for joining. So with this now, let us do one honors. We would like to regard and we'd like to honor you for your special contribution in the field of healthcare industry by felicitating you with a certificate from Adacom Media.
Thank you so much.
World token of appreciation goes to Dr. D.K. Gupta, the chairman and MD of Felix Hospital. So it's just a motivation. Keep doing the things which you are doing, so that it keeps
Thank you so much.
motivating the healthcare community. Thank you, sir, for joining. Next. It goes to Dr. Alok Roy. Is he here? Okay, he must have left. Thank you, sir. Token of appreciation goes to Namit Soni, one of a dynamic CEO representing Sony Hospitals. Congratulations, sir.
Thank you, sir.
Next. A certificate of recognition to Dr. Vundavali Suriraju, the MD of Regal Hospital. Thank you, sir.
Thank you very much.
Mr. Adarsh Somashekhar. And lastly, to Ms. Nihalal, the Senior GM Operations and HR from, you are handling two divisions. One is the college, another part is hospital, combined with the research center. Commendable job, Nehaji, and right justice you have given to this panel session. Thank you so much for joining.
Thank you. Thank you. Thank you very much.
So with this, we move ahead with the panel 2 session. May I please invite my colleague Itisha. I was just waiting for the industry presentation to happen from Kenoff Solutions, but I guess he's traveling. He might be joining sometime, so maybe we'll be including him in any between the sessions. But with this, we progress towards the panel 2 of this session. Itisha, may I invite you to introduce this session?
Thank you, sir. Thank you so much. It was great session, and listening to you all give us an insight about how the industry actually works. What are the practical scenarios? So let's move toward the session 2 of the day. So let me invite Ms. Ekta Modi, COO, Parul Sevashram Hospital, Dr. Rupali Basu, Managing Director and CEO, Woodland Multi-Speciality Hospital Limited, Dr. R.V. Karanjekar, CEO, Kiran Multi Super Speciality Hospital, Mr. Yatesh Wahal, Executive Director, Niyati Healthcare and Research, New Delhi, Dr. Venkat Ramana Sudigali, Director and CEO of Excel Hospitals, Hyderabad, Telangana, Mr. Devanand Kethi, Regional CEO, Esther DM Healthcare, Hyderabad, and Mr. Devanand is also the moderator of the session. So we welcome you all. It's over to you, Mr. Devanand.
Hi, thank you, Shyam. Hope I am audible.
Yes, sir.
Yeah, thank you so much. Thank you so much, Dr. Com and Mr. Chandan and the team for inviting all of us. I'm really excited today to be here among all of you for two reasons. One, it's a very fantastic panel that I have to moderate, very distinguished and accomplished panelists that we have today who will be speaking on a very important subject, which is the rural-urban healthcare divide. So that's a very interesting subject. Usually you don't hear this subject being discussed much in any of the panels. So I'm really excited to be here. And are you planning to give an introduction of the other panelists, and then you want to start? How is it going to be? Yeah, Itisha. Hello. I think Chandan, you are on mute.
Sir, you can start the session and let the panelists join in between.
Okay. So I'll start myself. So I'll just introduce myself, and then I'll start with the first panelist so that they can also tell something about themselves, and then we can go with the flow. So I'm Devanand. I'm the regional CEO of Aster DM Healthcare, covering the Andhra Telangana cluster. I handle 5 hospitals in this cluster. So I'm with Aster for the last 13 years. I was in Kerala and then moved to Hyderabad subsequently in 2019. So it gives me extremely, it's a happy occasion for me to moderate the panel for two reasons I mentioned earlier. So without much delay, because we have a time constraint also here. So I go to the first panelist, who's the Chief Operating Officer of the hospital, Parul Sevashram Hospital, Ms. Ekta Modi. So who is going to probably give us her insights on the first thing, which is the first and foremost thing to start the discussion, which is what, according to you, Ms. Ekta, is there a health divide? First of all, that's what we want to know, right? From before we start into this very interesting topic. So is there a healthcare divide among the rural-urban class, and what are the factors do you think are creating this real healthcare divide among the urban and rural class?
Good afternoon to everyone, all the senior panelists and activities here. So, telling about myself, I represent Parul Sevashram Hospital, which is a teaching hospital for Bharat Institute of Medical Sciences and Research. We are a teaching hospital for undergraduates and postgraduates now. So, yes, we are.
Sorry to interrupt. Please be a little clear or bring your mic to your near mouth so that we can listen properly. Sorry.
Sorry. Now it's better. Hello?
Yeah, it's better. We can hear properly.
Better, I think your microphone, if it is closer to your, mouth, it'll be more.
Yeah.
Yeah. Thank you.
I think I'm speaker now. So we are a teaching hospital for undergraduates and postgraduates, and we are presently in a rural area of Vadodara, that is Vadodara. So yes, the very important thing which Mr. Dave brought in was factors impacting the urban-rural healthcare divide. So yes, it's a divide because there are a lot of factors which influence and affect this, like the awareness, the health awareness, which is very important when we speak about the divide. So the rural people, and we used to think that they are not that much aware about the health benefits they should seek or health schemes they should have. But thankfully, COVID has brought up so much awareness, even in the rural sector, that now they are also aware, they are also informed. So the bridge is, the gap is bridging in some of the factors. But the awareness still needs to be more in the rural areas. The level of education is also an important factor which is impacting the urban-rural healthcare facilities. The economic status of the families or the patients coming from rural areas impact the health benefits. And most importantly, the availability of healthcare. So if the availability of healthcare is not like it's very rare, then they are not focused to the needs they have, or if we say the preventive healthcare aspect, which we find more in the more in the urban areas, it's not that prominent in the rural areas. They visit the hospital only if it's a dire emergency or if they need to. Otherwise, when we talk about the urban sector, we all know that the preventive health checkup is like booming. But now, even in rural areas, we are going in their cities. So the remote areas are now dealt very well with the available infrastructure, which I'll be talking in my next version. So yes, the outreach needs to be strengthened, and like there is less use of the certain health informatics which they have. Then there is decreased preventive health checkup, which we spoke about. Health literacy, which we are planning to a lot of sessions. We are engaging the ASHA workers and everyone who are they are the key people for the rural areas whom they look up for their health benefits. They reach out to the ASHA worker only if they have any health benefits. So educating the health are following in rural areas. We are strengthening the structural barriers, like there is a shortage of super specialist doctors in a certain rural area. So we are now developing certain e-kiosks, deliverables, which act as a boon to the rural areas. So I think even financing the health sector is a long-standing challenge, because the rural areas are not that economically. So I think we need to use all the available channels which we have to close this rural and urban gap and promote best practices, like using the holistic healthcare model, which is now a need of the hour to reach the rural population.
Thank you so much, Ms. Ekta. Very, very elaborate, and so I could understand that the awareness, the accessibility, and also the shortage of manpower. These are the few things that really came up from your point. So there, you are seeing that, yes, of course, there is a divide among the urban and rural healthcare. So and there are ways in which that can be addressed also. But with the new budget, recently unveiled by our health finance minister, we know that there is a huge impact that's going to happen on the e-health or the digital health that we see in India. Especially, there is a targeted focus towards implementing those digital things across India, which will cover the rural side also. So we have the next panelist. I would like to get his insights on this particular aspect, where India is also focusing on the digital health across the country. So that will definitely focus on the rural areas also. So how do you think, Dr. Karan Jekar, who is our next panelist, who is the CEO of Kiran Multi-Speciality Hospital, who is a veteran in healthcare. So how do you think, Dr. Karan Jekar, how can we solve this lack of e-health services in rural India, where India is a country where we are looking towards a digital health adoption. So I think you are on mute, sir. Dr. Karanchikar, I think you are on mute. Yeah, try to speak now, sir. No, your voice is very feeble. I mean, I don't know whether it's my problem.
You need to increase your sound, sir, maybe through the system. Not able to hear you. Not able to hear you, sir. You need to increase your sound. You can speak from the device speaker, sir. Kindly plug out the.
He has done that. Yeah. Hello.
Not audible, sir. By the time you check your system, Devanandi, we can.
Yeah, I'll move on to the. You can please check your system. No, you can please check your system. By the time I'll go to the next panelist and come back to you, sir. Yeah, so I think that question will come back to him again, because that's something which I wanted his inputs, because he's as a veteran, healthcare veteran. So we would like to hear from him on that particular aspect. So now we'll go to Dr. Rupali Basu, who is another very accomplished healthcare leader who has been also, covering Apollo. And I think you were covering the eastern side of India, which was, a neglected area, right? So long back, probably, yes. But then you will definitely have that kind of experience covering that area, which had huge dearth of healthcare facilities. So what do you think, what is the impact? Lot of new things have come in. We have seen the power of telehealth in terms of COVID app when the vaccination drive came up. So a lot of technology is being used in bridging the gap of urban-rural health divide. So what do you think has medical technology has impacted, whether it has impacted on the urban healthcare divide?
Thanks, Dev. And thank you, Adocom Media, Chandan, and Ayush, all of you who kept on talking to us and having us in the panel. It's not so easy to make such a big, new normal healthcare leadership summit. And of course, you've added awards to it also. So kudos to all of you. Only thing is that this, we need to get out of this online thingies and, get on into in person. And it's high time now that we need to be in person and seeing each other. That's always make a lot of difference. Coming to the discussion point, I think you of course did mention about the East. So I've been trained all over the world, traveled all over the world, but focused at work at the East, because yes, I thought that at that time, which was probably 35 years back, 3 decades back, there was the healthcare delivery systems in the East where need to be, kind of worked on. The quality journeys needed to be brought in. The bigger hospitals needed to be developed. From the background of the first open heart cardiac surgery. First open heart surgery happened in PG Hospital in Calcutta. For the whole country, you all should know, in 1957, my father-in-law, Professor Dr. Ajit Kumar Basu, did the first open heart surgery in Calcutta. And that was years back. So the first cardiothoracic surgery department happened there. And Baba, of course, was very, very renowned as a cardiac surgeon, scientist, academician, and have worked all over the country and all over the world. He still is the only Indian who wrote a chapter in our textbook of surgery called Love and Bailey's. And of course, he was an FRCS examiner on all that. But that's, he's gone from this world in 1986. That years back, we did fall out in between, and naturally we needed to be having leadership and thoughts and the right kind of work at the region. After all, it is 300 million people who resides in the eastern part of the country. And when we talk about the rural-urban divide, as you spoke to, you asked Ekta, I was just thinking that countries, we have just heard that we crossed China's population. I think we have now become the most populous country in the world, the largest democracy. Of course, if we were, I think we have touched 1.4 billion now. And 70% of that population, which is almost close to 900 million or 90 crores, lives in the rural areas. And definitely for all our good things that we have done at the private hospitals, at the levels of our corporate hospitals, we keep reaching to the best possible benchmarks in the world, the international benchmarks. And that's what we have done, we are doing. We are very, very close to whatever is the most advanced quaternary care happening in the world. We are touching there. Almost, may not be the level of research or academics which should happen at those levels, may not be at that same level. But what we do is whatever is happening in the US or Europe or anywhere good, we are picking it up very fast. So our level of care is good. But is it happening for everyone in this country? Is it available for everyone in our country? I don't think we have yet reached to every Indian of that level of care. And that brings us to technology. Technology is an enabler. I think it is a big enabler, big helping tool for us to reach that divide between an urban and rural healthcare delivery systems. And what are the things, I have, as you said, I have served Apollo for 15 long years as president and CEO. I've been, with Dr. Karanjikar, who was my colleague in Wokhad Hospitals, which has become Fortis now, for 7 long years, handling Eastern region. And of course, I've been now considered as a turnaround specialist who kind of handle turnarounds of hospitals. So I am right now working in Woodlands Hospital. It's a one hospital company of the 45,000 people involved in our PSG group. It's a very large group with 30 companies. And whatever, I think 30,000 crores top line or whatever. So we are one of those big industry groups, and this is the only hospital the group has. So, and we are bringing in new, advancements in the hospital. So I am entrusted with that job. But we see the healthcare delivery happening in the cities and in our villages, and the gap is, we started talking about technology and how it will be a bridge between the rural-urban, divide years back, because we know the gaps that have been talked about already. The difficulties were because we didn't have the right connectivity, the right kind of smart devices, and the right kind of smart devices in both in computers or phones. So the moment those things are available now, we have good connectivity to the remotest villages of our country, and we do have smartphones. Now, availability of smartphones to everyone, I don't know whether that is yet happened, but I'm sure it is going to happen. So very soon, and very large number of people actually do have smartphones. Why I'm talking about smartphones and computer systems? Because the tools that we have now, the teleradiology or the EICU or the teleconsultation, or even reading out your talking about giving the care from the specialist to at a long distance, you need to have those technological specs ready so that you are actually able to give those care at a distance. And the availability of the specialists are, what is an EICU? We have started EICU 15 years back in Apollo, but we were not been able to do that quality care at that time. That 100% of, yes, I've been able to give the quality of ICU care which I'm giving in the city of Calcutta or Delhi or Mumbai, and giving the same quality of care in any part of our networked rural areas. But that's what I think now is possible. And COVID has also shown us that you can bridge, you can do protocolized care, you can do standardized treatment guideline, you can actually reach to the remotest corners through technology. And I will close my talk here, because there are others who will listen to everyone. But I think it is time that technology is, as an enabler, is ready and is a success in many areas. We just need to do that little bit to reach everywhere. Thank you, Dev, once again.
Thank you. Thank you, Dr. Basu. So, Dr. Karanjekar, I hope your audio is now correct. So, but you can actually start from where Dr. Basu stopped, actually. So, this again comes back to the lack of e-health services in rural India. So, that's what we expected you to respond, Doctor. Over to you. Your voice is still very feeble, Doctor. I think there's some problem with your headset.
No, Dr. Kanjikar, you have to press that F3. The volume needs to be in your system. The volume needs to go up. Okay. F3 or F2, those buttons. Just press those buttons and I think it should go up. The volume has to go up. Yeah,
we can hear you.
We can hear you.
We can hear you, but your voice is very feeble. Probably try to speak a little loud, please.
Louder. Yeah.
Hello. Yeah. I think I will increase my volume. 100%. Anyway, now you can hear me?
Yes. Go on, please.
Yeah, good. Thank you, Rupali. Yeah. Had been always helpful to me. Okay. I'm with the Kiran Hospital right now. And in my healthcare for almost 40 years. The hospital.
I'm sorry, Dr. Karanjekar. Again, I think that's some loose contact. Sometimes your voice is not at all coming. I think the jack has some issue. Is what I can make out. Sorry, if you could ask somebody from the IT test come and help you. Meanwhile, I'll go to the next panelist. Sorry about that. So I'll now take a question to Mr. Yatish because we are eager to hear you, Dr. Karanjekar, because the voice is not coming. The communication may not be proper. That's why. So I'll take the next question to Mr. Yatish. Mr. Yatish, I can see you in your video, please. Yeah, thank you. Yeah, thank you.
Yeah, Dev, hi.
Hi. So, Mr. Yatish, the question is now, we all agree that technology will be a true enabler for the rural health urban divide, as both Ms. Ekta and Dr. Basu was saying. But then, as entrepreneurs or founders, there is always control on the cost. When you bring in technology, it also involves cost. So how do you think funding in healthcare technology can really help the status of healthcare in India? When you're also a director and CEO of Excel Hospitals, the Nayati Healthcare and Research, New Delhi. So how do you think when the healthcare funding is considered, what are the factors that you think, or can additional funding can really help us in improving the status of healthcare? Over to you, Mr. Satish. I think technology again playing a vital role here. I think still we have some issues in terms of bandwidth and the connectivity. I think Mr. Yatish also seems to have that problem there. Mr. Yatish, can you hear us? I think we may have to go back to him again. I think there's an issue.
He just needs to come out and join back.
Yeah, I think probably he has
got frozen there.
Yeah. So I think probably I'll take the question to the next panelist then, Dr. Venkat.
Dr. Karanjekar has joined through the phone.
Yeah, I joined through the mobile.
Yeah. Very good. Now it's perfect. Loud and clear. Yeah. So I think I'll then give it back to you again, Dr. Karanjekar.
Okay, sure.
Eager to hear you.
No, now you can hear me. Is it?
Yes.
Yeah. Okay, sure. Thank you, Devanand, Rupali, and all other colleagues. Adore communication also. I think the question posed to me regarding the e-health in rural area and its impact, or how do we do it? When I look at all 40 years going into the rural areas in Himachal Pradesh, also in Chennai, also in Gujarat, I feel 65% of the population which is staying into the rural area is still deprived of lot of health health treatment. Health treatment is also, I divided into 2 or 3 parts, because today we are talking of corona, today we are talking of so many things. But when it comes to the serious diseases, surgical work or emergencies, the telemedicine becomes little handicapped. To me, 3 major things are required when you are looking at the rural health. These are the 3 A's. One is the acceptability, another is the awareness, and third is the accessibility. Accessibility is the most important one. However great equipment or modality I have, but if I can't reach to the place, then it will be of no use for me to reach. And today, if I see, I go to the Konkan area, I go to the down south in Maharashtra, or even in Marathwada area, the moment you land in around, there is no network. Even for the simple phone, you don't have network. Carrying out the images from CTMR, carrying out the ECGs, carrying out some of the primary investigation, it is becoming difficult at various places. Second is the acceptability. Indian people, especially the rural people, want to see the face of doctor. And if they see it in the camera, still not, they have not accepted it. Because apart from meeting the doctor on camera, making online payments and seeing what has happened, and there is nobody around you, it becomes very difficult. So a medical personnel at every place is very important. If that personnel is there, coordinating between the consultant and the patient, it becomes much easier. And third is that once you have accessibility, you have then you accept the whole thing and make the people aware, because this is the modality. And very rightly Rupali said that corona has made it awareness so huge that probably, as we say that the vaccines take 10 years to develop and we developed in 1 year. Similarly, I remember our JCI days and NABH days, we were trying so hard for hand washing, and every time we are failing. Last 20% people were not washing hand at all. But with corona in background, everybody, even the person coming to the door, delivering anything, you touch it and you wash the hand. So that kind of awareness has come into the people. If the similar awareness comes for the e-health treatment, that will be better. I tell you, about 15 or 20 years back, it is nothing new. It is only the implementation of the whole thing. I had gone to a very rural area in Adivasi area in Diu Daman and near Silvassa, where small wadis are there. 100 people stay. And from there, from camera, they were picking the patient's health indicators on a camera, giving it to the civil hospital, doctor sitting there, monitoring it and advising them. Even though it was preliminary, they were helping thousands and thousands of Adivasi people. It is not difficult, but you have to reach them. And your probably internet, 4G, 5G, whatever it is, it has to reach that place. Once that is there, then people will be aware, people will accept it. This is the first step of the whole thing. The second step is that once they accept, you will have to deliver. If somebody is serious on this thing, then you will need a road, transportation, ambulances, and the nearest medical help. So probably government will have to think of hub and spoke models, where the main centers are there at taluka place or district place, from where you can go to the rural place, do it, because again, time is an important factor. So these cases, if happen, see, today we are progressing. Today we are in the middle. I can't say कि अभी खिचड़ी पक गई है, but अभी चावल भी नहीं है. It is in between stage. Same stage is also for our connectivity. Same stage is for transportation. Same stage is for our awareness. People are aware about mobile working, everything. Similarly, they will be aware of the healthcare needs and healthcare indicators. Once we get that, we will start helping them. The success is in proving to them that this can happen. Once we prove it to them, this can happen, they will be after you. So yes, it's a slow, steady progress. Earlier we do it, we should be successful in this. because we are talking of some 65 to 70% of the population. Pardon me, but today I was thinking that there will be at least one or two panelists who are from the remote rural area and who have experienced this thing. Probably their words would not have appeared hollow as our words happen, because we are all the time in the city, corporate hospital, big hospital where every facility at the beck of call, we have it. But rural, you have to see actually what it is, and their experience would have taught us something. But yes, definitely we can learn from them, visit them and do something.
Thank you, sir. Thank you so much for that wonderful, hands-on experience, the insights from the hands-on experience that you have. Thank you so much for that insights. Actually speaking, even though I represent Asta, I did not mention that I worked in a remote area for 10 years, which is the most backward district of India. It's called Wayanad in Kerala, which is basically one of the most dispersed districts also as per the Niti Aayog. So we also run a medical college there. The basic purpose of our chairman was to start something there which was totally lacking in terms of medical facility, in terms of rural divide. We worked with 18% rural population with included tribals. 18% were tribals actually. So it was very challenging, but I thought this is a forum where the panelists should say, so that's why I did not mention about it in the beginning. But towards the end, probably I can also share a bit of the experience that I had there. So I'll take the question to Mr. Yatish. I think we had made a beginning, but I think some connectivity issue he had to log out. So Mr. Yatish, now we all agree that healthcare technology has become an enabler for healthcare. No doubt about it. We all have to adopt that. So how much influence is there on the funding for this to get really getting adopted across?
Well, Dave, thank you for sort of, and Artcom to sort of having invited us over for this panel and for taking this discussion, which is need of the hour. See, the pandemic virtually forced all of us to sort of evolve and adapt to the technological advancements that were taking place. Unfortunately, with the pandemic normalized, we are back to normal times. And I think the teleconsults, as is visible in our hospital, I think the fellow panelists would also agree, though definitely the numbers have improved than what they were pre-pandemic levels, but they've reduced drastically, because as Dr. Kanjarekar was also mentioning, at the end of the day, see, adaptation takes time and people are yet to adapt to the fact that, there's no doctor physically touching them and, taking their parameters or having a face-to-face conversation. So this process at the end of the patient has to evolve. And at the other end, even from a clinician's perspective, moving on and transitioning to a totally EMR-based environment is something that, again, the present constraint of the pandemic assisted us, but still the senior doctors, those, there are exceptions everywhere, but you can't expect them to change overnight. So whilst the fresh breed, the fresh crop is adapting to it and people on the floor are the ones who are getting into EMR, some of the senior doctors are still not very, very comfortable with the EMR part. Having said so, the core question that was posed to me in terms of capital funding and how that is an influencer in terms of the adaptation, see, capital plays a very important role. And one of the reasons the urban-rural healthcare divide has also been around is because healthcare intrinsically is a very, very capitally intensive industry. And IT, unfortunately, till a few years ago, never played a very important part. And it was always supposed to be a cost center. Now, with time, it has become a strategic cost center wherein one is starting to see that if you were to digitize records, in addition to patient convenience and access, what that is also resulting into is additional revenue. E-pharmacy, if you are able to map your EMR into pharmacy, into diagnostic, if you know what your doctor has prescribed, the administrator or the front office at the end of the day or the department at the end of the day is able to check its conversions. See, till everything is linked with revenue, it really doesn't work out. So that somewhere has helped as administrators also not to get our bosses, the directors and the funders or the trustees to see value and introduce this. Having said so, again, because the number of adapters are still limited in the market, the cost of introducing this technology, the cost of introducing this hardware is huge. And for a small rural-based setup or a non-metro-based setup or a metro-based setup with just a single unit and not a chain, they may find a capital allocation to be slightly difficult. And therefore, this problem has to be assessed in totality. If you were to today again spur entrepreneurship in this, and there are solutions that have come about, and one of them being that the market knowing that money cannot be brought in overnight, and even if you were to bring in soft capital, today rate of interest is still not below 8-9% for an average borrower. For someone with a A+ rating, maybe it will be about 6.5-7%. But the repayment starts, there's not enough moratorium. Unlike some of the, for that matter, even Bangkok per se, or Thailand, wherein, you have repayment periods, or Indonesia, where you have repayment tenures going up to 20-25 years. Because healthcare, and this is one of the need that all healthcare players have stressed to the Honorable FM also, wherein we are saying give this a infrastructure status and give them a longer term funding tenure, so anywhere between 15 years to 25 years, so that there is enough cushion available for healthcare players to recoup the investment made. Now, one of the ways technologically based Indian entrepreneurs have started to solve the problem of technology adaptation is they have brought in a model of pay-per-use. Instead of and somewhere using the power of cloud computing and cloud servers. So, see, there were two constraints. One is you need to have heavy servers for backing up all your files and having a redundancy in your network. The second bit was your network issue. Fortunately, with the likes of Jio coming in and 4G and 5G being made available, this problem has been addressed, as Rupali was also mentioning, Dr. Basu, that, now with smartphones coming in, it's getting addressed, but somewhere Indian entrepreneurs had even sorted this out, wherein in India, the sort of products that offer these services are more built on a 2G based platform as opposed to a 4G, 5G, so that even where in areas, remote areas where data proves to be a challenge, there is still a probability, albeit with a longer delay, of sharing the data packets across. So with cloud computing and hosting your servers on the cloud, somewhere like a Google or a Amazon-based server farm, you are able to pay this and on an OPEX-based model and not a CAPEX model. Likewise, you have players who've now come in and they are charging on EMR on a per patient basis or a per visit basis, as opposed to just selling the entire show in one go and blocking a huge amount of capex and then going in for an EMC, CMC. So, wherever there is a constraint, history has it that, constraint leads to inventions, and Indians, all of us, are far, far ahead when it comes to the road of invention. AI, for instance, a lot of local players, tele-reporting players, and even some of us at the corporate hospitals, the teams had standardized protocols wherein just after a scan, basis the pattern that had developed in the lungs, one was able to tell whether there was a COVID case or a non-COVID case, and one really didn't have to wait for the reporting to happen. So, AI and technology definitely is here to help. Cost obviously has been a concern, but with, the metros really reaching a sort of a saturation, and local partners coming up, you have all major chains which have, at least for now, if not really gone into the rural areas, they've started opening centers at least in state capitals. So the presence has started, because this movement of going to the metro for treatment is stopping. And the core problem, again, still today that stays there is that given the very size of the country, which in itself is the opportunity, we do not have the number of healthcare practitioners to cater to that entire demand. And thus, using technology, we can get in these skill sets that are available with the metro-based setups, maybe within the corporate setups, available to the last chain, available within that corporate center.
Yes, Mr. Yatish, yes, thank
mile.
you. Thank you so much for that. I think
Thanks,
the paper use the OPEX model of technology coming in can really help us in getting it implemented across rural and where the capex or the capital investment can significantly come down. So that's a very, very valid point. I think a lot of people have already started experimenting on that. That takes me to the next question to Dr. Venkat, who's our next panelist, whom I know that he has started teleradiology at a much earlier stage than all of us started doing at our hospital. So Dr. Venkat, I think you are the one who probably were the front runners of the teleradiology mode. I know that. So how do you think can the information access play a vital role in bridging the gap between the urban and rural divide? You have been a proponent of the whole telehealth mode. Over to you.
Thank you. Thank you, Mr. Devanand, and thank you, Adarcom, Mr. Chandan, and Ekta, and the rest of the team for inviting me. Very interesting discussion so far. I've learned a lot already from the eminent panel members. So thank you, Mr. Dev. I don't call myself as any pioneer in teleradiology because probably it has been there since much longer time than when I started in India, because I was the one who actually started my radiology career with the films. And I actually saw how the transition happened from the films to the digital radiology settings. So, it has been quite significant journey for me personally as well as professionally. But saying that, things have certainly taken a very, very drastic turn for the better in general regarding healthcare technology, but specifically to teleradiology, telepathology, and to a certain extent telemedicine as well. So coming to my field of teleradiology, so we in our hospital report for patients across the world, especially UK, Ireland, and Australia. And I'm one of the clinical leads for a big organizations in the UK. And the technology which is currently available, which permits us to report a patient who is coming in acutely unwell in a remote hospital somewhere in Europe and sending the scans 4,000 miles across the ocean to India, getting reported and sending back, and clinicians taking an action, all happens within 4 or 5 minutes for patients like stroke, for example. So just amazing if you can imagine how this has been carrying on since the last few years. And the added benefits of AI, which is coming over since the last 1 or 2 years, which has been propelled by COVID times, has been even, more made this space very interesting and very fascinating. And future can be very, very bright based on what I'm seeing at the moment. So what we currently do is we have an AI algorithm which triages, just like a human triaging a patient who is very unwell versus patient being very well. So it triages and highlights to us saying that this patient has got something very abnormal on their scan. So we need to look at those scans first because a few minutes may mean a life and death matter for those patients. So once the triaging happens, it comes to us and then we get to see the reports. And I have an extension number which I can quickly call the clinicians across Europe and then get the report onto them. And we literally saw several patients being treated this way, several patients who would otherwise have a very difficult time to survive or have long-term consequences, but just getting better with all this technology in place. So in one word, it's absolutely brilliant. But let us go to the opposite side and speak from the Indian perspective. Whether this technology benefits, if so, benefits what kind of population? Are we talking about benefiting only the rich, higher class where the affordability is higher? Because certainly it adds to the cost of the healthcare system. Technology is not cheap. So we really have to take it appropriately. So not add each and every technology to what we consider as very good, but it's all a balance that we have to maintain, and to see whether the money that we pump in, the investment that we made, gives us a better quality of clinical care to the patient, B, improves patient safety, and also ultimately reduces the cost to the patient or to the insurer. I think if we don't keep all these three things as top priorities, especially the long run cost of the healthcare system, secondary to use of technology, I think things won't be so sustainable. And so that has to be always kept in mind. Thank you very much again, once again. So, yeah.
Thank you, Dr. Venkat. I think, it's look interesting, the AI algorithm that you're mentioning about triaging. We'll come back to you later with a few more queries on that. So now you have opened up a specific thing called affordability in terms of the, urban-rural healthcare divide. Affordability is a major issue, especially when the rural mass is considered. So that takes me to the next question, which I want to again go back to Ms. Ekta. See, the rural, we know that urban, the kind of healthcare that we see, the payer mix that we see in the urban healthcare is moving more towards the insured class. While you see a lot of gap in the rural areas still to adopt to that insurance, even though the Ayushman Bharat and the public health has come in to support them. But in terms of the private insurance, it's still picking up very slow. So what do you think? How can the e-health services reach this uninsured rural class? How do you think that can be achieved?
Yeah, so that is a very interesting topic when we talk. And I think I remember the saying which says that we should not cut down jungles, but the need is to irrigate the deserts. So I think this is a very untouched area wherein we never thought that how fast the internet services or the mobile data services can reach rural areas, and even rural people can get benefit on that. So even we have a question from audience also on how the small clinics can collaborate with big hospitals to serve in the specialities or super specialities which are not available in the rural areas. So nowadays many startups are coming up, and even we have collaborated with one of the startup who has developed a kiosk which we have placed in the rural clinic. The doctors who practice in the rural areas, and for any super specialist consultation, they don't have to turn here, because many times it happens that they have lost two followers. If a general physician advises for any super specialist consultation, then it's not a surety whether the patient will come over to the hospital, get the consultation, or for the illness itself. So I think this by this kiosk, which is like more over a teleconsultation. So consultation is done, medicines are prescribed, they can get a prescription there, and even few blood tests and like common blood, like blood sugar and even BP measurement and everything is also done. So the need of the hour is to reach them. So reaching the rural population is very important, and we need to reinforce them, like usually rural people, people staying in the rural areas, they don't visit the hospital saying they lost the mandates of their working. So minimizing the ALOS, the average length of stay in which the patient gets admitted, reinforcing them the need of the safety and everything, which is very important to cater in even Ayushman Bharat scheme. So a lot of this Ayushman Bharat schemes, people get admitted here, but due to the ALOS, they are very, they abscond, they don't stay, they don't follow the doctor's advice. I've been practicing in a hospital which is in a rural area, so I can relate to these very well. We have a lot of patient abscond, and the reason simply says that we cannot lose our men hour of earning. So this is what we can pitch in and how best we can get this. Of course, reinforcing the geriatric care and the Anganwadis for nutrition for pediatric population is also a very important aspect in which we should look up for when we're talking about the urban rural divide. So I think we should improve the emphasis on the surveillance. We should have the data by which we can come to and where exactly we can intervene and help the rural areas to grow up and use the urban sector too.
Thank you, Ms. Ekta. Thank you so much for that wonderful insight. So, using the public system also to support you in adopting to the technology, or or going to the masses will be a brilliant idea. Probably Ayushman Bharat will make that revolution coming in, like Jio brought the mobile revolution to India. So the government will be the starter here, and then probably private also will take off in rural. This is what I also expect to happen very soon. So I'll take the next question to Dr. Rupali. I actually handle the Andhra Telangana cluster for Aster. So Andhra was a new market to me. Recently, I was covering a portion of Andhra where I was looking at different opportunities of getting connected to the rural Andhra. Andhra has still had a lot of villages which is still doesn't have that kind of an access to healthcare. So when we were thinking of an outreach center with a telemedicine model, the major thing the team was telling me that there is a huge behavioral change in consumers that's required. People still, I think Dr. Karan Jekar mentioned about it, the human touch is missing when telehealth is considered. They still feel that a doctor has to be present physically to give the care. So how can this consumer behavior could be influenced, towards the digital adoption? It's very tough, I know, but you have been working with that, so we expect some good insights from your side. Yeah.
Thanks, Dev, for the question. Yes, as you said, behavioral changes are the most difficult part, because you are actually going inside the mindset of each individual, and we all are. We think differently, everybody is different, so we have our own thought processes, and when you want to change those thought processes, any change, and especially in the mindset changes, takes time, and it takes a lot of factors. So I think the low-hanging fruits, what we can do as healthcare, healthcare professionals at this point of time, is that COVID has taught us a lot. It has actually pushed us to the technology front a lot. Each of our phones, actually, the moment you take a call, that it is telling you that do this. From the government also, they were giving a SMS message, you are getting a caller tune. So the process has already started. What we need to do is should not slow down on that process. We should not, we should take the advantages of what has come in, what the new things have brought in for us to connect to people. What are the tools that I have? What are the messages that I can do? How we can do it? What are the ways we can? And we have to, kind of be at work and execute those at this moment. We should not miss out any time. That's one particular point. Then the other part is that how you are going to do the communication to the person. What are the tools that you have? You have primarily, the newspapers are gone from our lives now. It's nobody reads lately. Even now, the newspapers do come into our homes too. We are very traditional newspaper readers, but it is the value of a newspaper is going down. What is we have? We have a phone in our hand, and we have the TVs, or maybe probably the laptops and the computers for some people. In the rural areas, I think TV is a tool which we have, a connect, and also the mobile phone. So we have to use maximally what we can. We have to do in SMS format. We have to do caller tune format. If I look at the phone, because if it's a smartphone, then there can be, all the social medias are available there. The apps can be downloaded. You can create new things, and continuous communication in the regional vernacular languages, looking into the people's minds, that what will work for them. That's I think the quality of communication is the next bit. What we have, the time is right. What we have in our hands is only the TVs and the phones. And TVs are very expensive when you would like to communicate, advertise, or say. So we have to use government in this a lot, because government to the rural sector will be easier for us to use. I think and we have to tell the government, do this. We have to advise the government that I do communicate to government a lot. even though I'm working in a private sector. I've been 30 years, I've been communicating. I keep writing to them. I keep, writing the right, you have to be the right language. You don't need to really, look at your own interests. It is all about creating communities, reaching out to people. So reaching out to communities and in rural areas. So you have to keep doing those kind of communication too, so that they put it across to the TV and use the phones which we have. And then the quality of communication is the third thing I think is very vital, because you have to reach to the mindset. So many a times we do create communications which doesn't make sense to people. You need to understand, you have to be sensitive to understand the people, and then create the communication which is will be read by and understood by the community where we are talking. So all these things I think are important. We have to keep communicating. We know that awareness generation and using technology has to be mindset change. And I think overall, when the country becomes digital, the way the government talks about digital India, and they also have, I think government has a lot of digital focus in their programs. The more the whole country rises in healthcare, the community also will rise. So there will be taking a little bit of time, because it just can't, we can't just be very smart in one area and the other parts are not even looked up to. The food, the general health, the way we live, in the houses, the roads, everything is important. So everything improves. Connectivity improves, the roads are important, the bandwidth is important. Both improves, I think we will also reach to everyone. The dream, we should not miss out on our dreams, that we have to do quality care for every Indian. So the more if we are focused on our dreams, things will happen.
Thank you. So that's very very good insight, especially the regular quality sensitive information or communication passed on to the mass. Yes, that is definitely going to make a change. Now, my next query or question is to Dr. Karanjekar again. So, we know after COVID has come in, there is a huge focus on telehealth. And that's one vertical of the digital health which has got very high momentum in terms of the implementation. But in rural settings, we also know that, but there are a lot of other factors to the entire digital health in terms of remote monitoring devices, or the IoTs that we talk about, or the data analytics, the predictive analysis, AIs. So a lot of things have come in. But what do you think, other than telehealth, is there any other digital health tool which can really fit into a rural health setting that we as a country or as entrepreneurs, are they trying to develop something which can really fit into the rural setting other than telehealth?
Thank you. I think in the rural health, I was recalling something for last few days when I last went to the bank. I don't remember. Last 2.5 years, not by Corona, but if I have to transfer money, it is within minutes. If I have to receive money, it is within minutes. I have to do something to the, even I remember I had to go to the workshops or my car servicing. At the end of the day, I have to go there by taxi, pay the money and bring back the car. No, that's not required. The link is there. He says, you pay, I will send the car. The thing is that even the vendor, the vegetable merchant, or even the small vendor says that this is my QR code, snap it, pay it. I don't have to do their money. So the question is of acceptability. People have become aware and accepted that this kind of transaction can happen. Similar acceptability when it comes to the rural area, it will be much better workout for the healthcare. Now, coming back to the, apart from e-health, what is there? See, we are talking of clouds, we are talking of satellites, which will be providing the bigger bandwidth and everything. I remember about 8 days back or 5 days back, there was a news item by Reserve Bank of India saying that they will develop a system whereby the payment will be made even if you don't have 4G or 5G. The payment system without having a proper bandwidth or not having the internet facility, still you can pay, is something remarkably different. If I have similar facility to be used in healthcare, Healthcare has always been follower of science, physics, chemistry, optics, anything, IT. Everybody invents and then we use it. We are the user of everything, not inventing everything. So once it is invented by accounts people or the IT people, maybe we'll follow it in our area. Whether it is gastroscopy or anything, robotics, we follow it little later. So this is one area, that is the your cloud computing and internets with the help of satellites is another area. But if I give an example of Corona again, I had few trustees at Surat Kiran Hospital, and they were quite serious during that time. We treated the largest number probably in Gujarat and Western Maharashtra for Corona. And whenever required, I used to ask my Mumbai doctors or ICU specialists for second opinion. Either I used to airlift them or, but here the WhatsApp messaging and WhatsApp imaging of the ICU came very handy. I may not have a facility to transmit my signals and all numbers which are there on the monitor to Mumbai to recognize it. I can put it on a camera and transmit it where he can see it, enlarge it, see it, and give me an advice. Ultimately, he's going to see, even if he is physically present, he's going to see. And they have treated almost 15 to 20 patients like that. Out of that, 10 to 12 came out of that. So the thing is that even if I didn't have bandwidth, even if I doesn't have anything, on a mobile, I can take the image and transmit the image. So only internet is not the way of transmitting image, I would say. Transmitting the image are multiple ways which you should be using it. And once you use it and show it to that fellow sitting in front of you, now the technology problem like I experienced today, having been in the city like Mumbai, I experienced this problem. So in rural area, if that fellow he fails, it's a failure. So should not happen. You should have a robust system, show it to him, you show the face of the doctor, ask him to talk to him, get a feel that yes, this works. So if that is there, then it will be there. Again coming to the original point, our colleague Dr. Venkat said about the teleradiology and other thing. Yes, it has been a greatest tool. I remember in Bangalore, few years back, I had been there. There was no radiologist in the main hospital, and still they were reporting from their peripheral hospital radiology within minutes, like somebody sitting in that room. Same thing can happen. Today we do it. PET scan, CT, MRI, everything what I have got here. All rural hospitals, they send it there one and we get a report. So this modality, biochemistry modality, they are transmitted and immediately a report comes to you. But yes, these are limited to the diagnostic and consultation. Treatment-wise, very few people have adventured into doing a remote treatment. Because again, there are limitations of diagnostic tools to be available at a remote place and a medical person using them. Both things happen properly, probably we are. But I'm very sure that we are on the way of progress, and either it will take 5 years or 10 years. By the time we will be reaching every nook and corner of big city and also the surrounding area. Gradually, we'll go to the smaller cities also. So multiple tools can be used, multiple probably adaptable instruments can be used for this purpose, which will give us the thing, and then later on even treatment modalities can be also useful to us.
Thank you, sir. Thank you so much. I think very nicely you put it, and I think all this combination of tools in terms of the pharmacy delivery, the diagnostics, the teleradiology can be mixed with the telehealth and probably go deeper into the treatment modalities, what you're saying. I think that definitely is going to come up very soon in our country also. So that is very evident from the fact that, the budget, the recent budget has clearly focused on the adoption of digital healthcare across the country. So that is the next question to the panelist, Mr. Yatish. This is something which the country has brought in, like the United Health Interface. This is something which they have, the NHA has proposed now to bring in the digital health across the country. So what do you think? how the UHI, which is the United Health Interface, is going to help us in getting the digital healthcare ecosystem across the country?
Well, Dave, getting all your data parameters, everything online will be beneficial in the long run. If you see, unlike the West, India still today, there's still, less than 20% penetration of healthcare insurance. Now, with the digitization of records, with a larger base being made available, you would have healthcare costs going down, a larger base getting insured. Ayushman Bharat also has brought in a significant population that's been covered today. But unfortunately, there's still a huge chunk which is in between the private insurers and who are not really BPL or EWS. So with this spectrum getting enhanced, I think there's a scope for a lot of rationalization. And data mining will sort of really assist in the long term. I don't think anyone sort of has as diverse a population as in India, where even the disease pattern changes from district to district and city to city, where you've got a place like the cancer train running between Punjab and Rajasthan, wherein because of a certain topography in Punjab, you have very high cancer incidence rates. Or for Mathura, where we run one of our facilities, Agra Mathura, where because of eating habits, you have or practices, general practices, you have very high cervical and oral cancer rates. So with a unified registry, a UHI of sorts, the data repository coming into force, it will aid the process of decision making. It will aid and take forward the journey of medical technology, the use of IoTs, which has just begun. We've not even seen and hit the tip of the iceberg. There's tremendous scope and opportunity that is available today, Dave. Yeah, Dave.
Yeah. Thank you so much. I think you covered a very valid area with the proper insight. So I think we will look forward for the proper implementation of the UHI in India very soon. So I now take it to Dr. Venkat. Probably we have to close the session. We're almost come to the end of the session. We had a lot of questions because this panel also is very, very very esteemed, and the subject is also so exhaustive. But I think we have a time constraint here. So I go to Dr. Venkat with the last question, which is, how do you think can technology be leveraged to increase the awareness? Behavior is something which Dr. Rupali already mentioned. So I want to understand how can we improve the awareness of the technology among the rural class? Any suggestions from your side, Dr. Venkat?
Okay, awareness of technology, presume it's in relation to the healthcare, right? Because a lot of mobile phone usage has come for digital payments. So in that sense, the healthcare can be extrapolated on the same lines with the usage and the penetration of mobile phones. So again, we are seeing a lot of telehealth being developed on the same platform, using mobile health technology. Doctors sitting in a conference hall, then trying to discuss patients or even surgeries being performed remotely, for example. So all this has been happening. The exciting times are when the insurance people will take this aspect very seriously, because unless our rural populations are insured either privately or with the government, now that Ayushman Bharat is coming up, so unless this happens, and unless that also integrates some technology into that aspect, it's very difficult to really see it going in a proper direction. Because what is happening is, especially in the rural healthcare sector, tertiary care is given a lot of importance. So when a patient has a heart attack or when a patient has cancer, they can get diagnosed. They have limited facilities for treatment, etc., and they may have to come to the big city centers to get their treatment. Essentially, primary care has been non-existent, and this is where technology can actually bridge that gap. Because unless we have a robust primary care, which can be to a large extent taken care of by providing, physicians on telehealth platforms, regular blood checkups, basics, etc. Unless that happens, it's very difficult for
Devananji, can
primary
we
care
just
to go into
I think
tertiary
Dr.
center.
Venkat Chandan is giving us a red flag. I think we are, the time is up. Sorry, we would be very eager to hear you, but then I'm sorry to interrupt, and
No worries.
apologies for this intrusion. I think we have a time frame given. I think we have to close it. So, Mr. Chandan, just one thing. I just want to take one question from the audience, which is the PPP model that they were talking about in lowering the urban-rural divide. Just one example I want to give in my place where I used to work in Wayanad. We used to work with the government to take up the rural population, especially the tribal population pregnancies. That's where the government and our hospital partnered together, where we used to provide a free treatment for all the tribal women at our hospital, but all the support till they come for the pregnancy to the hospital is covered by the government at their home, using the Anganwadi workers or the healthcare workers that Ms. Ekta was also mentioning. They will also drop the patient at our place through their ambulance, while treatment is given free from our side. They take back the patient to their home and follow up with them. So it has worked wonderfully well. We could reduce the mortality that used to be present in that district, especially it came in big news and all before we took over that challenge. Tribal women had given birth on the way and unfortunately succumbed. That was a big news, national news. And with our intervention, we could, bring it to a zero level. That's something which we could do. So PPP has an effective role in bridging that gap, urban-rural divide. So thanks to all panelists for a wonderful session. I feel that, we still have a lot of questions to answer and a lot more things to come back from your side. But I think there are, the next panel is already ready. So I think we should hear it from them. I think Mr. Chandan, thanks for once again for organizing this wonderful panel.
Thank you.
Thank you, Chandan. Thank you, Devanand,
Please,
Rupali, and other team.
Thanks,
Thank you very much.
Thanks,
Bye.
everyone.
Please stay tuned with us, sir. Thank you so much. Lovely moderation, Devananji. In fact, see the kind of topics which we have suggested, we have taken has given a lot of effort in research, and then we have finalized this topic, and then bringing the right stakeholders for the right panel, including. So we want to make this entire healthcare and wellness segment. We want to give every bit part in equal importance. Let it be Ayush, let it be pharma, let it be maybe a wellness community. So with this, without wasting much time, dear all viewers, attendees, please join me to welcome a well-known and a successful actor, model, film producer, writer, and entrepreneur, Kunal Kapoor. We are really excited and glad to host you at the Inspiring Leadership Dialogue, a fireside chat round, sir, at India's first and biggest New Normal Healthcare Leadership Summit and Awards, hosted by Adacom Media. I welcome you, Kunal, at this forum.
Thank you. Thank you so much for having me. It's an absolute pleasure being here amongst such esteemed people that are doing such wonderful work.
Great. So, Kunal, before the fireside chat round, please, I would like to have the honors to introduce a bit to the audience who are your fan or who are aware of you, but still I would like to introduce you a bit. So let me start with a small introduction about Kunal. He has been into the film industry for almost 17 years now and has done many films so far. To name few, you made a debut in Bollywood movie with Meenakshi in 2004, which was helmed by artist M.F. Hussain. The next hit movie was Rang De Basanti, for which you received a nomination of the Filmfare Best Supporting Actor Award category. You also appeared in the film like Laga Chunari Mein Daag, Aaja Nachle, and Bachna E Hasino. Kunal has voiced the Indian god Rama in Mahayuddha Rama, an animation film. He is also best known for for playing Sam in Shah Rukh Khan's Dawn 2. You won the Asia Vision Awards for Indian epic action historic drama film Veeram. In 2017, you starred in Gold, based on a first Indian hockey team to win the gold at Olympics. The film saw you pairing up with Akshay Kumar for the first time. In 2021, Kunal has 3 releases. The first one was in the T-series production Koi Jaane Na, followed by Disney Hotstar's web series The Empire, in which he played the role of Mughal Emperor Babur. The show, which is the most expensive series to come out in India with a huge success, and Kunal received a lot of applaud and praises for it. He received an award as the best actor on the OTT for his performance. He was followed by, this was followed by the Netflix anthology Unkahi Kahaniyan, for which he once again received a lot of critical acclaims. This is, most of a Bollywood part of his story. He's also known for his style, and he has been voted amongst the most stylish men of the country. And so, apart from his Bollywood and the actor journey, he's equally a successful entrepreneur, and he's the co-founder of the brand Keto, and an online crowdfunding platform and a website in India for fundraising of for medical emergency, education, for pet and animals, and various other social causes. I hope, Kunal, I did a mistake. I was right in, actually.
No, you are absolutely. Thank you for the very, very kind introduction. Thank you.
Yes, so Kunal, without wasting much ado, I would like to, put a first question for this fireside chat round. Tell us about how you thought of Keto and what motivated you.
So, I was working in the social space with a lot of NGOs, and I found that there were a lot of challenges that these NGOs were facing. Firstly, the cost of fundraising was very high, sometimes as high as 50-60%, which I thought was criminal. I felt like a lot more money needed to go to the people that actually would utilize that money. Secondly, I found that a lot of these NGOs, once they had reached out to a donor, it was very difficult to reach out to the donor again and ask them for another sort of contribution. And it was becoming very difficult for these NGOs to reach out to new donors. It was very expensive. It required a lot of effort. And that got me thinking that, there are so many people that I know personally that wanted to help but didn't know where to give the money. And there's so many people that need helping. And, somehow these people weren't coming together. And I felt like if we could use technology to build a bridge between people that can help and people that need helping, it would be very powerful. And that bridge was Keto. Keto is an abbreviation for Key to Tomorrow, which means we believe that if we can democratize capital, which means that anyone that needs money can reach out to thousands of people across the world, then that would be something that's really powerful. And that's how Keto came to be.
Okay, great. So we are aware that in India, asking for donation for oneself is still looked down upon, especially when it comes to medical expenses or education or things people hold close to their hearts. How much have we changed culturally?
Well, I think there's been a big shift. When we started off, you're right, there was a little resistance in going onto a platform and asking for money. Because like you said, in India, there is a certain amount of maybe shame attached to asking outsiders for money. But what we've seen over the last couple of years, and which is why a platform like Keto has grown so exponentially, is that a lot of people that donate on Keto eventually start a fundraiser for them, for their families or their friends when they're in need. So these are people that have donated, and they know that if they can donate, then there's no reason that they can't ask for money when they need it. A couple of years, and which is why a platform like Keto has grown so exponentially, is that a lot of people that donate on Keto eventually start a fundraiser for them, for their families or their friends when they're. My voice is playing back. So these are okay. This is fine now. They know that it's fine. If they can donate, then there's no reason that they can't ask for money when they need it. Can you hear me?
Yeah. I can hear you. I guess somebody was playing at the background.
Yeah. So lots of people who have donated on the platform eventually go and start a campaign on the platform as well. And I think what we've seen often now is that, people see people just like themselves being on a platform like Keto, asking for help and getting that help. So I think, when you see somebody that is very close to who you are and how you are, asking for help and receiving that help, then when you find yourself in trouble, you feel like, why should I not ask for that help, right? And in India, unfortunately, what often happens is that for your medical expenses, you first turn to insurance, but India is an underinsured country. Then if that doesn't work, you dip into your savings. If that doesn't work, you take a loan. If that doesn't work, you start selling your property and jewelry. And often people can't repay loans or, can't get their property and jewelry back. So how we pitch Keto is that, we want to be the platform that comes in after you've used your insurance. And once that insurance is done with and you still need money, then there's people across the world that are willing to help you. So I think there's been a huge shift in the mindset of people. And now I don't think the shame that I'm talking about, which used to be attached earlier, I don't see any of that anymore.
Great. So what were the initial changes that you have faced while, popularizing Keto? Did being a public figure help in doing this?
Well, I think the biggest challenge was that we were trying to do something which nobody had done, which is that there were no crowdfunding platforms, and it was a very sort of nascent concept. So for us, it was about creating awareness, not only for people that to come and donate, but also for people to use the platform. So I remember we used to have to go to NGOs and explain to them that there is a far more powerful way for them to raise money as opposed to offline. So we had to create a lot of education, lots of awareness. I think that was something that was very challenging. But fortunately for us, all our early growth was very organic. Somebody used the platform, told somebody else. And, so all that growth was very organic, which is great because then you build a very solid foundation. And I think for us, that was the biggest challenge. I think, of course, it helps when you have somebody who's a public figure involved in the platform. You can reach out to people for partnerships. You can get on a phone call with investors. You can get on a phone call with NGOs and say, look, I'm Kunal Kapoor, I'm starting something and I'd like to meet up with you. So that definitely helps. A friend of mine who's an investor put it very nicely. He said that building a startup is like bodybuilding. It's a lot of hard work and consistency. But when you have a founder who is a public face, then it becomes like bodybuilding with steroids. It's still hard work and it still requires consistency, but the results are faster.
Absolutely, you right said, Kunal, because see, being a public figure or being an actor doesn't mean that you will be equally successful in being in entrepreneurship. Sure. It is a different, a game altogether. Here you are playing a role of somebody else, and there you are acting live, in front of the society which you are. But great, I'm sure that you have done a pretty good job in both of the delivers. As of now, what have been the achievement of Keto in Kunal in fundraising, and which sectors is responding better? Is it health? Is it education, or something else?
I think our biggest achievement really has been making crowdfunding something that everyone from anywhere in the country can use now. You know what I mean? It's become a really powerful tool, and we have people from every part of the country and every section of society using the platform. And the other thing is that you have people from across the world that come together to support somebody that they don't know. And I think, we often talk about, when you watch social media or you watch the news, you feel like the world is a very bad place. But actually, on a platform like Keto, you realize there's so much goodness because so many people that don't know each other just coming together to help someone that is a stranger and just from the goodness of their heart, right? So I think for us has been our biggest achievement is creating an industry where it didn't exist before and getting people from all sections of society involved in this industry, right? I think for me, that I think has been the most sort of important achievement. And as far as the second question goes, I think obviously we've seen the biggest results in medical because I think, like I said earlier, India is a very sort of underfunded country when it comes to medical needs, right? There's so many people that don't have access there's so many people that don't have access to capital or don't have access to, facilities. And we are obviously trying to fulfill that gap and, make sure that people have access to capital. So medical has been one of the biggest areas where we've seen humongous amount of campaigns started. And I think for us, what is very interesting about medical is that a lot of the recommendations for patients now come from hospitals. So, we've tied up with multiple hospitals across the country. And whenever a hospital comes across a patient that can't fund themselves, they reach out to us and they say, why don't you help these people? And I think that's great because these people otherwise wouldn't have been treated, right? Wouldn't have had access to these hospitals because they wouldn't have had the funds to do this. And even for the hospital, I think it's great because, you have patients and you have people that you want to help and, you can't because, they don't have. I think we are filling the gap for both patients and hospitals. And I think that is something that we're very proud of.
So what are your thoughts on the Indian crowdfunding industry and how do you see it growing in the next, say, 5 to 10 years?
I think it's going to grow exponentially. What we'd really like, I think, as an industry is for the government to come up with more sort of clear regulation. I think that would be good for the industry as a whole. But I think, besides everything, I see it growing exponentially. It's already in the last couple of years, we are raising as much in one day as we were raising in a year, 5 years back, 6 years back. So that's the sort of volumes you've seen now. And I think what we're going to see, and which is very important for all of us involved in the industry and at Keto, is that we're going to see more and more people from smaller towns raising money and using the platform. I think, right now, most of our crowdfunding and most of the donations come from larger cities, urban centers. We've already started moving into smaller towns and smaller centers. We've started speaking to NGOs there. We've started tying up with hospitals. We've started getting healthcare. And I think those are the places that have the maximum need. So I think for us, just being in the urban centers and urban cities is not enough. We really want to sort of reach out to people where people are most underserved, which is the small towns and the smaller cities. And I think we're going to see a huge shift, in, like I said, people from smaller towns and cities using these platforms.
Right. Well, so when you say this, let me try to understand, is it through the Keto volunteers or are you going to tie up with the NGOs, all the already working small organizations in these 3-tier cities or villages?
So we are hiring volunteers, we're tying up with volunteers, and we are also hiring people in these cities. These people are responsible for making sure that we have enough partnerships and awareness created. And like I said, the best way to sort of create partnerships is to reach out to these hospitals, tell them that there is a tool like this that exists, that the hospital can use and their patients can use. So that we're building partnerships with hospitals, doctors, healthcare workers. We're also working with NGOs in the smaller towns and cities now, because these NGOs, like I said, there are a lot of NGOs doing great work, but don't have access to capital, because of which their work gets hindered. And we are reaching out to them to show them that there is another way that exists. So I think awareness and partnerships is what we're focusing on now.
Great. So somewhere like this kind of initiative would lower even the gap of the urban-rural divide, which we were just talking one panel before you joined. Yeah, correct. So now Keto also demonstrated a significant role in COVID relief program. Please share some of your interesting learnings, stories, or any campaigns around the pandemic period.
No, I think what was very, very powerful was that so many people that have never contributed in their lives wanted to start fundraisers on the platform, right? I have friends of mine that have never been involved in the social space, and they started fundraisers to help animals, to help migrant workers, to help people that needed medical help. And what I heard from them, which was a sort of common thread, was that Keto made it very easy for them. Because earlier, if they wanted to help, they wouldn't have known how to go about it. But we just sort of have created a platform which gives them access and makes it very easy for them to reach out to people, fundraise, start campaigns, help others. So I think that was something that we saw throughout the pandemic. And what was amazing for me was, when we started Keto, what I found was that there were a lot of young people that wanted to help, but didn't know how to help. And they felt like this is not a space for me. This is This is a space for a certain kind of people. And whereas when I looked out west, I saw a lot of young people involved, because fundraising and helping people was a far more inclusive and engaging sort of process. And I felt like that was something that needed to come to this country. And during the pandemic, I had a friend of mine who called me, and he said his daughter's 11 years old, and she was watching the news with him, the migrant crisis that was happening. And she turned to him and said, I don't want to just watch the news. I want to do something. And so he called me and he said, my daughter wants to start a campaign. Can you help her? So I said, yeah, sure. And she actually raised 12 lakh rupees to help these migrant workers. So for me, that was a really great insight, is that there's somebody that's as young as 11 years old that wants to help. And earlier would have not had the avenue or the access to do that. And I think that's what we are doing, is to provide avenue and access and make it easy for anyone that wants to start a campaign anywhere.
There is a question in the chat, Kunal. I would like to take that. He's asking, could you please ask Kunal the major challenge that he has faced while he went for crowdfunding?
The major challenge that I faced?
Yeah. A major challenge maybe the Keto faced while went into the crowdfunding, what he wants to ask.
I think, like I said, one was obviously awareness and education between, for people that were raising and contributing. The other was that, honestly, we had no investor interest when we started off. How investments work and investors work is when there's an industry that's doing really well, everyone wants to sort of get into that industry. And crowd, like I said, was not something that anybody was doing, right? And I remember we went to this one investor who's a very big investor. And he said, look, I don't think this is going to work in this country because I don't think Indians are charitable. And we disagreed with him because we felt like Indians are charitable, but it's in a very sort of, it's in a offline way, and it's not, it's not seamless. So we wanted to bring it online and make it seamless and easy. But he said something very interesting. He said, look, it doesn't matter whether I believe in your idea or not. What's important is that you believe in your idea. And if you believe in your idea, then 5 years later, I'll look back and I'll say, I should have believed in the idea then. And sure enough, 5 years later, he invested in the company. So for us, that was a very big learning, which is that, when you believe in something, you have to give it your best. It may work out, may not work out. But what is important is your belief in the idea. And I think over time, our belief in the idea is translated into hundreds and thousands of people believing in the idea.
Yeah, absolutely. I truly, bet on that. And so see, in what we have seen generally in the actors or the Bollywood players, it's easy to go into merchandising, to open a hotel, and open a restaurant, or maybe the chains, many of the organizations. But this kind of association of a fundraising idea, it itself, thinking of it is a very challenging. Actually going into it. And maybe the COVID has accelerated the kind of business of yours was, but forget about when there was no COVID, when you said that you started a couple of years back. So you definitely have gone through a rise of demand of crowdfunding during this 2 COVID years.
Sure, absolutely. And I always say that, as an actor, if I can market a T-shirt, or I can market a car, or apartment block, there's no reason, or it's my responsibility really to market a good cause and use the reach that I have to create awareness about that. And what's very heartening is I see more and more actors and more people that are public figures, getting involved and, creating awareness about things that they believe in. Even on Keto, we've had so many actors during the pandemic, during earthquakes, during floods, call us and say that, we'd like to start a fundraiser and reach out to our fans and followers and ask them to contribute. And how do we go about this? So I think that's very heartening to see.
Lovely. So maybe you are playing a role model and you are inspiring many of the youngsters like us. If anything is possible, if you just dreamt of it and you are continuously working hard to achieve that. So
Thank you.
Many of the questions, Kunal, have asked about your entrepreneurial role and about Keto, but I think people would be interested to know more about your, Bollywood part of stories also. One question I would like to ask you: we saw your phenomenal work in the Empire and in Ankahi Kahaniya OTT platforms in the Netflix film. We are, keen to know that what are your new upcoming projects which are lined up, and are we going to see you soon on big screens as well?
So I've just I've been writing for a long time. 7-8 years I've been writing scripts, and now I'm sort of finalizing those scripts and turning producer and actor. So this is a whole new sort of journey for me. It's a chance to sort of develop work that I believe in and back that work as a producer. And there was a time in between where I was not getting work that I had my heart in and I was finding interesting. And instead of sitting back and waiting, I decided that I would create work that I had my heart in, instead of waiting for the work that I was finding interesting. So that's how the writing started. And now this year, I start a new journey, which is a journey as a producer and an actor.
Wow. So, Kunal, for you, what is more important and what emphasis you give more? Is it the content or is it the role?
Sorry, is it
the content or is it the role?
It's a combination of both. You obviously want to be part of interesting content, but at the same time, you want to also, I think the great thing about being an actor is it gives you a chance to live multiple lives. Yeah. One day you're a boy from Chandni Chowk. The other day you're an emperor from like some 600 years ago. Then you're a hockey player from the 40s. It gives you a chance to live multiple lives. And I think that is what makes acting so exciting. The chance to look at the world from a whole new point of view. So obviously, always looking for roles that challenge you and show you a new point of view of the world.
Okay. So Kunal, out of all the films which you have been doing since almost 1.5 decades or more, which one you, say recommend your favorite and why is it?
I mean, there's a bunch of them. I had a lot of fun, obviously, and it was a very iconic film, Rang De Basanti. It was a film that was very close to my heart. There's a film called Love Shabd Chicken Khurana, which was a film that I co-wrote and co-developed. That again is a film that is very close to my heart. There's a film which you mentioned also called Veeram, which really sort of gave me a chance to push my limits because I was doing Macbeth and I was doing it in 3 languages, Malayalam, Hindi, and English. So it's a very complex role, and doing it in 3 languages was challenging. So there's been so many. There's so many things that I find interesting about the work that I've done.
And voicing over of law drama, when that kind of opportunity came to you, what was your reaction?
It was great because it was done in a very different way. The director had a whole new sort of take on the Ramayana. And the idea was, how do we sort of get more young people interested in the Ramayana, right? How do we make it in a way that is more appealing to everyone? And that is what I found very interesting about that project.
Great, thank you. Thank you, Kunal. So with this, we would also like to tell our viewers and that you are blessed with a baby boy. We wish you, Naina, and the newborn baby a very healthy life filled with lots of joy and happiness. Enjoy your new journey of parenthood, Kunal.
Thank you. That's very kind of you. Thank you.
Yes. Well, we have now come towards an end of this session now. I wish we would have extended this session for some more interesting talk with you. Thank you for joining us, Kunal, and taking out your precious time to give to this forum. A big thanks to your team for making this possible. And we wish you that we could have arranged some more such engaging and interactive session with our other communities, which we are into education, we are into health and wellness, media, entertainment, and art. So let's see when we'll catch up again. So by the time, please take care and bye-bye.
Thank you. Thank you so much. Lovely talking to you. And I hope to see you soon.
Thank you. Thank you. Bye-bye.
Bye. Thank you.
Yes, Itisha, may I please invite you again to now introduce the next panel. I hope this session was quite engaging and people would have loved to know more about this actor, the way he's transforming from an actorship to. So back to the work again, the new normal. Yeah, Itisha, can we please introduce the next speakers and the panel topic?
Yes, sir. Thank you very much. So let's moving ahead. Let me invite the panel 3. So how can wellness practices be associated with the right clinical results of widespread adoption, effectiveness of wellness programs on mental health? And let us invite our eminent panelists for this panel, Ms. Manjri Chanda, owner and founder of Manjri Wellness, Mr. Sahil Pruthi, founder Keto India and Levofy, Mr. Rohit Dhingra, founder and CEO Infinite Health Studio, Ms. Farzana Siraj, founder Orange Ray Holistic Private Limited, Mr. Arvind Savargonkar, CEO Shriban Healthcare, and Mr. Akshara Damle, founder Mano Samveda. So Mr. Akshara Damle is kind enough to accept our request to moderate this session. We welcome you all. It's over to you, Mr. Akshara Damle. Oh my God. Oh. Oh, I'm so sorry. I'll just repeat it. This is the topic of the panel is healthcare technology trends and digital innovation in 2022 and beyond. And the panelists are Dr. Madhuka Gaikwad, Head of Medicine Unit, GGMC and JJ Group of Hospitals, Ms. Bitali Biswas, CIO, CK Birla Hospital, Mr. Nilesh Sinde, CTO of Jupiter Hospital, Mr. Shuanka Pramnik, Deputy CIO, Manipal Health Enterprises, Dr. Paramhans Mishra, CEO, IQ City Medical College and Hospital, and Mr. Naresh YV, CIO of Rainbow Hospitals. Mr. Naresh is the session moderator of this session. So it's hand over to you, Mr. Naresh.
Thank you, teacher. Thanks, everyone. Good afternoon. It's been a great session till now. We have heard, stalwarts from the industry speak about their thoughts. Now is a session where we talk about technology, right? And I'm sure the panel has a distinguished panel members who have spent years and years in the industry, both in operations as well as in a technology. And thanks to Adarcom Media Group from Pune and Mr. Chandan Anand and his entire team for having this session today. I would say, this panel is of great importance because it has a combination of both technology leaders as well as leaders from the business in the healthcare industry, which gives a diverse perspective of us of what their thought processes are and what we should do as an industry in this space. So as the title is Healthcare Technology Trends and Digital Innovations in 2022 and Beyond, I feel it's a very apt session in these troubled times. We have seen a lot over the past 3 years, and healthcare is one of the industries who's got the push to adopt technology because of the pandemic, be it positive or negative, but at least we technology folks in the healthcare industry have seen significant investments going up to enable patients get their care, and as well as doctors to take care of the patients through technology. As I said, we've got very distinguished panel members. All of them have been introduced. I'll just give you a brief background in the way I want to conduct this panel. First is the introduction is the team is helping us with the introductions as we speak. We will start off with some of the intros, or I will request each of the panel members to, for a minute or two, just give us a thought process of what technology is, where technology is heading, especially in the healthcare industry, as we have both leaders in both the technology front as well as in the operations front. And then we'll take it subsequently. To start off with, maybe I would request Dr. Madhukar Gaikwad, who's a medical director of GGMC and JJ Group of Hospitals, just to share for a couple of moments on where technology is in healthcare and what we should do as an industry to adopt it more. Dr. Madhukar Gaikwad, can you hear us? Dr. Madhukar, you're on mute, I guess.
Okay.
Yeah.
Anushaji, please
Yeah.
switch your video
Yeah.
on.
We can
Good
hear.
afternoon.
Yeah. Good afternoon, sir. Please go ahead. Have you heard the question, sir? I just wanted your thoughts for a couple of moments on where technology is in healthcare and what we should do going forward.
Definitely, I am Dr. Madhukar Akkad. First, I'll give my introduction. Already have displayed my brief introductions. So, I think nowadays we have seen so many new technologies are very important in the post-COVID era. Even before COVID era, also so many technologies which are now you also like telemedicines in futures, like in surgeries, like surgeries, if you know all these things, and also in like a surgical side, if you see, or medicine sides, if you see, is like endoscopies, like capsule endoscopies, or so many new trends are coming, and which are very important now, like in radiology departments, also like virtual interventional radiology things, or any reportings, if you see in like radiology or any other things. So or in COVID's things we have seen or observed, because not possible medicines or virtual telecommunications, or which people are not visits also at hospitals. We have seen like on telecommunications or telemedicines advices we have given. So these things I think are very important in new medical trends, or in futures. I think all other eminent doctors also are there. So which things can be highlights on these things, I think I think on these subjects.
Thanks, Dr. Madhukar. That's been a great insight. Let me move on. Dr. Paramhans Mishra, CEO of IQ City Medical College and Hospital. Sir, your thoughts for a couple of moments on the technology, where we are and what we are doing right.
Thank you very much. I'm not sure why my camera has been put off. Can somebody start it?
Can you switch it on your laptop, sir, if you're joining from your laptop?
Yeah.
Can you help him?
Now,
yeah, now we can see you, sir. Yeah.
Thank you. Well, I'm Dr. P.H. Mishra, CEO of IQ City Medical College Hospital, and I have got around 30 years of national and international experience in healthcare, and postgraduate from AIMS, graduate from Delhi University. With that little introduction, I will say that healthcare technology has gone leaps and bounds in recent years, especially during and post-COVID era, because the human touch, which was the essential part of medical care, had lost to this COVID pandemic. And now forget about the doctors and nurses, even the relatives and friends were scared to meet and touch the patients of COVID. So technology has really helped in treating and saving many lives. Like previously, it used to be only telemedicine, but now we have Zoom meetings, we have WhatsApp video calls, we have Skype, we have so many things which can help in connecting people from faraway places. And even patients who are in isolation, they can be advised, they can be guided how to take care of themselves. That has been really very helpful. Besides that, other areas, technology has really grown up. Like we have got in cancer treatment, we have got latest cyber knives, gamma knives, PACS, Cloud9, and latest technology in robotics surgeries. All these technologies have come up, which has definitely helped in localizing and doing your work more accurately. It was previously done, everything was done by exposing the patient, or the maybe say some tumors or some small lesions were not approachable. But with the advent of this cyber knife and gamma knife, you can really enter deep-seated tumors, which can be operated even up to the size of maybe 2-3 millimeters. Doctors can approach and operate upon. So this has definitely helped us in better patient care.
Thanks, Dr. Paraman, for the wonderful insight. Then I'm happy that I'm going to my technology friends. Let me start with Ms. Mithali Biswas. Couple of thoughts from you, ma'am. Mithali, can you hear us?
Sorry, I was speaking on mute. First of all, thank you, ADRCOM, for organizing this interesting topic. I am Mithali. I head the technology for the CK Birla Hospitals as a CIO. So when we talk about technology in healthcare, if you see, the technology has always been there, the kind of technology that we are speaking. And if you look at the other industries, for example, manufacturing or even banking, the adoption is, far higher. I mean, we have been used to the banking apps quite a few years back, I would say. But we are talking in the recent 2 years, I think you would see that the technology and healthcare is being spoken about, thanks to COVID for that. So only one good thing it did probably was accelerate the adoption of technology in healthcare. And healthcare was lagging behind. So although the technology was there, I mean, most of the technology that we speak about now has been there for the last few years. It's not that suddenly it has come because of COVID. But it's only that in healthcare, the adoption has started after, the COVID stuck in, because then people were forced to adopt it and then they saw the power of it. So when we talk about healthcare, there are two distinct areas, as I see, where technology is making a difference. So one is the clinical area and also the non-clinical area. I think before COVID, it was mainly the clinical area, which was more focused. But now, with the COVID, people have also seen how it can make the entire hospital more efficient. Even technologies like AI, remote monitoring, the entire hospital can be more efficient. The patient experience part of it, that is more efficient. And of course, the clinical side is there. So I feel, we are at a very interesting point in healthcare, in the intersection of business and technology, and there's more to do. I mean, there's lots of stuff to do. We are lagging behind, but I think the journey has started. That's a good part. So with COVID, I would say the adoption of technology in healthcare has started, but I think there's a long journey to cover before we actually, catch up with what the technology can offer.
Thanks, Mithali. Next, I would request Mr. Nilesh Inder, CTO Jupiter Hospital, to share his thoughts, please.
Good afternoon, and thanks to ADRCOM for this opportunity. Myself Nilesh Shinde. I'm a CTO of Jupiter Hospital Group, and by profession I'm a medical engineer, having experience of CT and MR machines installation. Might have done more than 75 equipments installation through GE as well as through Siemens, and I'm the first member of this Jupiter Hospital Group. Now, my thoughts about basically post-COVID, really we can say that there's a transformation in digital way what we are looking for. Now, whenever we are saying that COVID, everyone has got some lesson here and there, but then the way Mithali has said, adoption, like digital healthcare or digital transformation has really come into picture, or maybe forcefully has come to in picture post-COVID. Okay. Now, earlier also artificial intelligence, machine learning, big data, all this terminology was there, but we never took it seriously. But then COVID has made sure that something we need to do it. And this technology which is there existing has maybe came into Indian healthcare. It is, yes, it is too long way to go. But at the same time, if you see that, now we have done that, or most of the hospital has used during COVID, telehealth, teleradiology. Now, what is important which has come up is a home care, internet or medical things, virtual critical care. Now, there are tele ICUs are there available, softwares are there. Then robotic has come into picture, which has given a accurate surgery outcome. Then along with the clinical side, the non-clinical side also has really helped certain things like for the supply chain management, HR. There are a lot of software which was maybe not available, or maybe everyone wants to go on a web-based enable, so that with less manpower we can have a good outcome, and whether we at the same time we can able to gather a lot of information. Like during this thing, one more thing which has come up is the digital marketing, as well as training to the all our staff. Like physically now it is not possible because of COVID era, but with the help of all this technology, we can able to do sitting at any location, we can able to give the training to that. So this is really, I can say, a lot of changes has happened. Artificial intelligence is really helping us to give the clinical decision also. So we can say that last couple of years, because of COVID pandemic, adaptation has increased, and I'm sure with National Digital Health Mission, the gap between the whatever healthcare services what we offer to the tier 2, tier 1 cities, and there was always a gap between tier 2 and tier 3. But now with this, all these softwares which are coming up, and with the technology, we should able to bridge that gap.
Thank you.
That is what I feel, that these are changes, or maybe this is the new trend which are coming up.
Thanks, Mr. Nilesh. I'll move on to Mr. Shwankar Pramanik from Manipal to share his thoughts, please.
Good afternoon, and thanks, Adorcom, to invite me such eminent panel. Okay. You can hear me, right?
Yes, please go ahead.
Yeah. So, rightly, Mitali already said, technology was there, and specifically in healthcare industry, if I see the history, because I am in the industry last 20 years, so I have seen that technology was there for a long time. It's not a couple of years is there. So like robotic surgery and other technology was there practice in maybe outside of India, and Indian government, Indian healthcare business was not adopting seriously. Although now in COVID, business generates that kind of needs that they have to adopt this kind of technology rapidly, because now it became a kind of business vertical in every organization. So technology came as a helping hand to the business. Now, like my fellow panelists already told, that there is a digital marketing wing came up, and they are focusing on purely technology-based healthcare ecosystem. So this is the need of the ecosystem. So adaptability obviously came, and other sides from the payer side, like patients are also kind of having fear to reach hospitals due to COVID pandemic. And now they are also make it a habit to adopt this kind of technology. Like you are already habituated with kind of currency-less ecosystem, right? So now your peer providers also now kind of looking for that kind of ecosystem. So technology is always there, and the kind of still some of the big organizations who have their cash-rich organizations, they are in advance of adopting those technology, but in mid-sized hospitals, mid-sized healthcare companies are now gradually moving towards to adopt those technologies, I must say.
Thank you, Mr. Shwankar. So as a follow-up questions, I would request some of the panels to answer these. One is maybe Dr. Madhukar, I just wanted your thoughts on how well India is adapting to artificial intelligence as a discipline in both healthcare and in drug development. Can you please share your insights?
Really, nowadays, this is a need of artificial intelligence in drugs as well as in medical health factors. Because in COVID era, observe so many things like in medical institutes, I mean in as a government institute. So that time we have observed this in treatment wise in in medicine as rural, I observe so many patients treated through the video conferencing, so many programs, so many if any guidelines as per the guidelines of COVID. So have you given through the video conference to all periphery medical colleges or periphery doctors, or also we as if you observe in clinical sites like teaching of MBBS students or MDs, any other faculties, also observe in schools also now in on school. So this thing also I think nowadays there is no need to also to teach MD or MBBS students or anything in offline or same institute. Other institutes, so students we teaches this through the video conference. And as well as you have told asked me about is pharmas. The pharmas also, if any informations regarding any drugs or anything, you also highlight this digital information like video conferencing or others methods of this develop this digital transformation.
Thank you, sir. So moving on, maybe I would request Mitali to just share her thoughts in terms of, are there any regulatory challenges in implementing remote healthcare and telemedicine in the Indian context?
Oh, yes. So first is, I think the regulations are not very clear. So when in my hospital, for example, the doctors were forced to use telemedicine because of the lockdown. Okay, so when there was a lockdown, we got the solution. So they were forced to do it, even if they were not comfortable doing it. And when the lockdown went away, they are back to their normal. Not many of the doctors are using telemedicine anymore. And when I talk to them, what they say is, one, they are very afraid of this medico-legal thing, which is not very clear. So what they say is, in case something goes wrong, who takes the accountability? So that is not very sure. There are restrictions on what kind of diseases that can be, treated, or what kind of drugs you can prescribe. So I see a lot of resistance from the doctors itself in practicing this, especially the senior doctors, I would say. And that's because though there was a telemedicine guideline that was, I think, launched in 2019 or 20, after COVID stuck in. But still, there are a lot of gaps which are not very clear. And I see the major challenge I see is the resistance from the clinicians to kind of go ahead and adopt it. So they do it only when they're forced to. It's a situation patients can't come in or whatever, but given an option or choice, they would like to do the normal consultation. The second part, when you think about it from a technology point of view, our job in the hospitals, we are also not very clear in terms of data privacy issues. So, when architecting the solution, what are the data privacy guidelines that we should follow? So there are no clear guidelines. So there is HIPAA, there is this NDHM, which is in a blueprint stage, but there is no clear guideline that this is a law. So that is also not clear. Now, if I come as a patient also, I don't know my rights, what data I should be sharing, what I should not be sharing, what consent I should give. So I find that there's still a lot of, lack of clarity. So though a telemedicine guideline and all was launched, but that was again because COVID came in and something had to be done. We were forced to do it, and even the clinicians were forced to kind of adopt to it. But I don't see, they're doing it freely on their own. So I think, and that's because they are afraid. The medical legal laws are not very clear. Even the data privacy laws are not very clear. So those are, I think, I would say the high. From technology's front, I don't see any challenges. I mean, whatever infrastructure you need, bandwidth you need, that can be taken care of. The technology is there. But I think it's mainly the regulatory challenges, the awareness, the clarity which is lacking, and that's stopping, I would say, the adoption of it in the scale that we would want it to be.
Thanks, Mitali. I think that makes sense from both technology and operating perspective. Dr. Paramhans Mishra ji, your thoughts on regulations and where we are going right in adopting telemedicine in India?
Yeah, thank you, Naresh, for that question. When I was Deputy MS Sir Gangaram Hospital in 2004-05, I started this project of telemedicine there. But there were lots of questions regarding who will be responsible. Suppose some image which is transmitted from one source to another, and if it gets distorted on the way, who will be responsible? Because doctors make their decision based on the image that they get. Image may be right at the sender's end, but during transmission from one place to another, there may be some artifact, there may be some defect, or there may be some distortion, anything. So who is responsible for that? Because the doctor's decision can be, life-changing, can be life-threatening also. So that there is no clear-cut guidelines, there is no clear-cut rule to regulate that till now, as far as I know. So that is very challenging. Doctors always feel better to see the patient because many diagnoses you can make just by seeing the patient, not by the reports. Sometimes reports give something else and the patient is in some other condition. So that's very important. Even Indian patients still have that habit of seeing doctor, being touched by the doctor, being auscultated by a stethoscope or that. Yes, COVID-19 forced people to take this technology route, but I still feel that touch, human touch is still very, very important. Yes, technology can be supplementary, can be complementary where the patient is at far away. Patient cannot travel to the hospital or to the doctor, and those facilities are not available. We are using that facility in our hospital, IQCT Medical College Hospital. We are advising patients from far away, say northeast or some other places, even Bangladesh also. We can give initial advice, but curative and final advice should be or could be given only when you see the patient actually.
Thank you. Thank you, Mr. Ji. Dr. Madhukar, one question I had was maybe you've implemented chatbots or AI solutions in your hospital. Your experience in using them. I'll go back to Shuankar or Nilesh on the technology piece of having chatbots and AI. But as a consumer of such technology, what is your thought process?
Regarding chatbots, if you already like delimitations, there are certain limit. Any technology has limitations because everything will not be that is can't think or can't expect on these things only or can't take decision this thing because already he thought directly with communications or direct through digital there are certain limitations. So any technology have merits or anything's demerits also. So everything will not helpful regarding patients. So I think any technology or any hint is there are some limitations. Whatever there was given information on that basis only we can advise. Without seeing anything or any patients, we can't give complete any diagnosis or finally any information. So I think everything has limitations. On that information basis only we can only advise. That's I think on this chatbots or any other informations.
Got it. So Shuankar, your thoughts on where chatbots or AI as a technology can really help both taking care of patients from a remote location or people who have some chronic medical conditions?
Chatbots and AI is two different things. Chatbot mainly, it's now using just patient as a patient engagement platform. That's all. It's not capturing any medical indicators from chatbot. Basically, it's very basic medical indicators. Like if someone from patient side is very smart, they can give you kind of medical indicative data, then it's okay. Otherwise, based on their inputs, doctors can't take a risk kind of diagnosis any disease on the basis of chatbot, because maybe that reading is wrong. Whatever devices they are using, it's not calibrated. Something still doctors are kind of apprehensive on using all those chatbots for medical decisions. Right? It is just only using a kind of informative bot. It's kind of static bot. You can take appointment. You can have a kind of take a service. You can ask for a laboratory services. You can ask for some radiology services. This kind of limitations is there still. But chatbot is very much useful for educated someone basically. For recently, like government of India are focusing on mental health, and there are a lot of chatbots which is using machine learning language, and basically this kind of chatbot are generating predictable responses for the mental patients, and this is very effective. And they are using techniques from cognitive behavior therapy. CBT is called in technology, And there is a kind of dialectical behavior therapy also, DBT. So based on those technologies, those chatbots are developed for mental health persons, and how users are providing basically psycho educations and self-guided interventions in multiple areas of mental health. So chatbot are using only for education purpose, right? And obviously, by this education, they are getting some inputs, and based on those inputs, they are building AI and all these algorithms also. So this is the limitations of use of chatbot. What I feel.
Thanks, Shivankar. Nilesh ji, any thoughts? You're on mute, sir. Can you unmute, please?
Chatbots, when we say that when we use artificial intelligence in chatbots, like artificial intelligence is maybe a branch of computer science or segment of computer science, which normally involves designing some computer application to perform tasks which normal typical human being, like their intelligence can be used, like in case of speech recognition or maybe decision making or virtual perception of that person or a human being. Now AI-based chatbots which are there, okay, what advantage I can say that in mental illness or something, patient can chat with, have a discussion with that chat box. They will not hesitate to disclose their identity also. Maybe the response which we will get from chat box is like empathy towards that concern of the patient. But at the same time, these chatbots are not like something like a diagnosis tool, or it cannot deal the more serious issues also. Because if you think, if you see that like human touch is very, very important. All the speakers said that human touch is very important. And even if you are saying teleconsultation also or telehealth, still maybe patients who are into depression in mental health, their relative also would like to have an interaction with doctor 1:1, rather than doing on chatbots where is okay, there is an intelligence has been used, artificial intelligence has been used, but it is still like a one-way traffic only. Because till the time we connect to each other, I don't think so, at least in Indian environment or healthcare, this is going to work out as such. Chatbots is my personal opinion.
Thank you, Nilesh. Mitali, one thought, if you look at the latest, update from Facebook and having, metaverse, right? So that's where, your augmented reality, virtual reality, all that will come into picture. Where do you think such technologies can really benefit healthcare, both from a provider perspective and from a patient perspective?
I think it's more going to use on the clinical side, I would say, as of now, based on whatever use cases are there. So it definitely because you can, view a 3D image of the entire patient or the entire anatomy of the patient, which definitely helps in the complex surgeries. There's a use of a lot of robotics now, especially in orthopedics, which I see in our hospital. So that really helps in finding out the exact space, correct precision. That definitely helps the surgery and helps the patient to recover faster. The other major area I see is in the education side of the clinical side. So, these technologies can definitely help in educating the new doctors or the new residents, because of course, anything visual helps rather than just theoretical. So that's one thing. Another thing, I think there can be a lot of collaboration that can happen between the doctors here or, anywhere else, be it outside India, in our other cities in India, which is otherwise very difficult to have unless you have a full image of what you're trying to do. It becomes very difficult just on based of the report or something. So that collaboration I also see, I think, increasing between the doctors or clinicians across the world with the help of these technologies. From a patient point of view, I think as we advance, this clinical technology is advanced, it's going to have a direct effect on having a much better surgeries, which is again going to reduce the cost and probably a faster recovery. So that's, I think, what will be the impact on the patient side.
Thank you, Tali. Dr. Madhukar, being from the medical background and you've been practicing it, where do you think augmented reality and virtual reality can help you as a doctor in providing better care?
In digital, most of times, these things, medical technologies really definitely in our medical fraternities, they're helpful. So many projects, governments or state also, they are to help these medical teachers, medical doctors, or remote areas also. Now I'm giving example. If it is like projects, like if patient has any chest pain in a remote area, periphery, so that time there so many doctors will not, expert doctors will not that time, so we can't read ECGs also. So like projects, we feel that ECG, if we are any augmenting any technologies, if we send to that ECG to expert doctors, or are mobilizing that patient. So this like projects in governments or state or center governments, they are implementing. Definitely, I think these things, technology or these projects will helpful to remote as well as in advanced institutes.
Thank you, Madhkarji. We'll request another doctor in the panel, Dr. Paramhans Mishra ji. Where do you think these new technologies, as artificial intelligence, augmented reality, virtual reality, where do you think as a doctor it will really help you?
Well, these newer technologies are definitely very helpful. Artificial intelligence and other things gives you a platform to think beyond what you actually see. And they give you access to latest things which you might not have read in your books or which you might not have experienced in your clinical practice. They help you in definitely seeing beyond what your eyes see and practicing beyond what you can actually do by hands. But the problem with our medical curriculum is that our doctors are least taught about technology like Consumer Protection Act, infection control, biomedical waste management. These are the basics which they should be taught. And there is too much emphasis on teaching them everything. Like I will say that we have around 37 subjects in medical MBBS graduate, and we have to cover in 4.5 years. And every book is almost more than 1,000 pages. You can't imagine a person to read those books and remember everything. So I would be saying that we should move ahead and make the doctors specialize in some particular fields, give them the basics, teaching like soft skills, technology, medical legal aspects, and give them maximum exposure in one particular field where they want to practice in future. Those who want to do general practice, they should be trained in general family medicine rather than teaching neurosurgery, embryology, anatomy to each and every individual. It's waste. I read medicine 30 years back, and 90% of the things I have forgotten. I have never used. So there is no point in teaching everything to everybody. I feel people should be made specialists, and those who want to do general practice, they should be given training in general medicine.
Thank you, Mishra ji. I think for the panel, I think one new thing which has come up, we keep seeing it on the advertisements, both on on TV and on the internet, is on smart devices, right? Especially wearable technologies, right? So one of the ways in which they market is that they help you take care better of your health, right? How many steps you have walked, how many calories have you burnt, etc. So I just want to spend next 5-6 minutes from each of the panel to understand, where do you think wearable technology, does it have a role in making health better, and what all personal, I'm sure everybody must have dabbled with a wearable device till now. So your thoughts on that. Maybe we can start off with in the reverse order, Mr. Shuankar. Maybe if you can just give your thoughts on where wearable technology and your personal experience on it, please.
Thanks, Doctor. Actually, we just started in our Manipal group IoT devices, and we are monitoring neuro and ortho patients. We started this project 2 months back, and it will be commercialized by 15th of March. So this project is very much successful, and how that thought process basically came. The healthcare industry already used some wearable devices such as pacemaker and blood glucose meters in order to enhance the quality of care, right? And survivability among patients facing diabetics and arrhythmia, what we found. And it is the healthcare industry where recovering patients' outcomes is significant for those sustained success of providers. And certain devices like fit bands can seamlessly function to monitor the heart rate in real time. And they can also measure calorie counts, glucose levels, distance run, blood oxygen levels, and sleep cycles as well. We already used to use those devices. Those patients who wear such devices can have their health stats instantly, and it can be integrated into the EMS systems of the organization. Other than EMR integration, such devices can be interfaced with customized mobile apps to analyze the development of treatment and allow patients to satisfy wellness goals to avoid setback of illness also. So this was the thoughts, and next thoughts came maybe everyone can't afford this kind of devices. So we started a kind of rental model basically for remote monitoring. So we are giving to the patients devices with rental systems. After monitoring, suppose 15 days post-care or 20 days post-care, we get back to it. So we are already using this kind of IoT devices. This is my experience.
Thank you, Shivankar. Nilesh, your thoughts on wearable technology and your personal experience, please.
If you see that before COVID, no one was really worried about SpO2. But last 2 years, everyone was really worried about SpO2. So if you see that now, smartwatches are really coming to picture, because earlier we used to use only to check how many steps we have done, whether how many calories we have burned. But nowadays we are using smartwatches for the heart rate, SpO2, because they have become vital. So these are which are standard in most of the smartwatches. But there are some which is already standard and available there in smartwatches. But there are certain studies are going on, and then there are certain watches, smartwatches has got the FDA approval also to detect abnormalities like atrial fibrillation. So this is very, very important. So this is going to make an impact. Yes, in India, it will take some time to come, but with the COVID, as I said earlier, that a lot of adaptation has happened. Similarly, like smartwatches, there are smart patches also. Earlier, we used to have like a lead of not many cables, used to have it, and then the monitor for 24 hours. Nowadays, with smart patches with specific identity, like if you want to have a diabetes management or patient monitoring or drug delivery, with smart patches you can do it, which has become now easy to wear it also for 24 hours, and then you can able to translate that into real data, which can be easily converted into what are the things or what is to be done for the patient. Everything can be done online nowadays. So these are the advantage I can say wearable is going to make in years to come.
Sure. Thank you. Mitali, your thoughts, please.
So what I feel is, this wearables and the remote devices, in long term, they are going to change the way healthcare is delivered. Traditionally, if you see, healthcare the delivery has always been reactive. I mean, I don't, in my growing up years, I don't remember going to a hospital other than when I was sick. You fall sick, then only you go to a hospital. Even preventive health checkups were not common where, I was younger. Slowly, people became conscious. Preventive health checks are common. At least we go for a checkup at least once a year. With COVID, people have become more aware, more conscious about their health. And now, I don't even need to go to the hospital. There are a few basic parameters I can monitor myself and be aware of, where I am. They also have, good features of alerting you or notifying you. So if there is something wrong, I can go and then consult my doctor. So I think that's the power these devices are bringing in. slowly, you don't just have to be dependent on the healthcare providers or doctors. You can take it in your own hands, at least the basic ones. And then if there is a problem, you go and consult to the hospital. I also feel it might make a difference in elderly home care, especially when I have aging parents at home, and I find it quite difficult sometimes to take them to the hospital, especially with this COVID and all. So monitoring them, that definitely is going to be a big game changer if we are able to adapt well, and the ecosystem around that has to be developed. So just having the variables and you can monitor it, it doesn't help. The ecosystem around it, how do you get alerted? How do you then connect to the hospital? And then how the care is given. So all that ecosystem has to develop. The potential definitely is there, I would say. The consciousness is there. The awareness still has to be built in. The ecosystem around it has to be built in. But I feel in the long term, it has the potential of, making healthcare from more of a traditional reactive to more, preventive and with wellness as a focus.
Thanks, Ravi. Dr. Mishra ji, your thoughts, please, on wearable technology. You are on mute, sir. If you can just please. Yeah.
Wearable technology is definitely helpful, as Mithali has pointed out, that smart watches and all these items are definitely helpful. Pulse oximeter has been really helpful in helping people during this COVID era. But idea is, who will guide and who will help you if you are finding something abnormal in your parameters. It's the decision making still lies with the doctors, because during pandemic we saw that people were advising, if your oxygen saturation goes less than 92-93%, then you have to report to a hospital. Okay, fine. But we have seen many happy hypoxic patients who were just walking normal and they suddenly collapsed. They may not be able to find out what is the actual reason, and sometimes doctors are also not able to find out. But when we did the CT scans of their X-rays, their CT was really bad. These were already infected. During present scenario also, in the third wave of pandemic, what we saw, the many patients did not die of COVID. Their lungs were already so bad that even if they become COVID negative, many of them died because of the pre-existing conditions or pre-existing their lungs, etc. were bad. So preventive health checkup is very, very important. As Mithali and Nilesh pointed out, that preventive health checkup is important. You cannot do these preventive health checkups sitting at home. Suppose I say that I do my thyroid test, TSH, T3 and T4. I don't think a common person will be able to interpret what is TSH, why it is raised or why it is low. So you need to see all conditions in totality. Plus, the laboratories, they have different parameters. The smart watches, etc., may have different parameters. They may beep even with the slightest change in your parameters. Suppose your heart rate goes to above 80, they will start beeping. They may say that you are having tachycardia, but that may be because of some anxiety. Maybe you had done some little exercise or something like that. So we need to understand what is the difference between pathological and normal changes in parameters. So that is very, very important. But yes, these technologies are very helpful in monitoring day to day your parameters. Suppose a patient is diabetic, you cannot go to hospital every day. You cannot get your blood sugar check every now and then. You can monitor at home. You can regulate your insulin. You can regulate your medicines according to that, but with doctor's advice. The watches are also good. How much exercise you can do, how much your body can tolerate. All these things are good, but they are only supplementary and they are only complementary. They cannot replace the actual medical care.
Thank you. Dr. Madhukarji, your final thoughts, please.
Definitely, advanced technology is helpful to diagnose exact diagnosis of the patients. Helpful. And like devices, like if you think like simple things like digital thermometers or digital BP apparatus or self-monitoring of blood glucose with the glucometers at home. So these simple technologies are there, like I think the monitoring of the temperature. So now people also can monitor at home also, okay, how much temperatures it is there, or how much sugar levels morning or evening fasting or postprandial is there, or there can like blood pressure with digital BP apparatus. Some apparatus or technology is not reliable, but they can give some guidance or to inform regarding patients monitoring of these parameters to patients. But ultimately I think these only helpful to monitoring, but ultimately they should be required to take the advice of the doctors. Lastly they need. Definitely I think for the monitoring of these devices and in for the patients diseases, advanced technology definitely helpful, as well as monitoring of the patients, I think helpful in the routine life of the patients.
Thank you. I think we have come to the end of the session. I think I would like to thank profusely all the panel members. We have great discussions. You have shared great thoughts. Thank you to the Ottercom Media Group for the opportunity. Thank you very much and take care and be safe. Thank you.
Thank you very much, Ottercom Media.
Thank you. Thank you.
Thank you, Naresh, and thank you, everybody.
Thank you, everybody.
So thank you, everyone. This was a nice session to look forward. So may I request Shubham, can we have now we'll have a felicitation ceremony of all our eminent panelists. Shubham, can we start? So Dr. Madhukar Gaikwad.
Thank you.
Next certificate goes to Ms. Mitali Biswas, CIO, PK Billa Hospitals.
Thank you.
Mr. Nilesh Sinde, CTO, Jupiter Hospitals. Mr. Shwankar Pramnik, Deputy CIO, Manipal Hospitals. Thank you, sir. Dr. Paramhans Mishra, CEO, IQ City Medical College and Hospitals. Thank you, sir. Thank you so much.
Thank you.
Mr. Naresh Yellapragada, CIO, Rainbow Hospital. Thank you, sir. It was a wonderful session. Thank you for moderating this session. Now we would like to welcome Mr. Naresh Duble, Head Continuous Improvement and Marketing of Kanoff Ceiling Solutions. So over to you, sir. Sir, your mic is on mute.
Yeah, thank you so much. Thank you all for the gift of your time and attention. I have a great pleasure in sharing with you something which is very fundamental when we're talking about new era starting in healthcare. Making Indian healthcare system best in the world, something need to really shift, and a greater degree of awareness, greater degree of sharing will open up this avenue. And the topic of my presentation today is silent healer, how healthcare
Please unmute. Please unmute.
So because I'm sharing with the audio, I think my screen is going on mute. Okay, give me a minute. I will log in from the other laptop. I'll share this without sharing audio right now. Now you can hear me, right? Yeah. So hospitals are for the patient. So patient well-being and fast recovery is the core essence why hospital exists as such. So this is the primary aim of all the hospitals, and the future of hospital is no hospitals, right? None of us want to be in a hospital ever for our lifetime. And currently we are talking about designing a building which take care of Panchamabhuta. We studied Ayush, we saw technology. At the end of the day, it is sound, touch, sight, taste, and smell, which has cognitive, psychological, physical effect on our health and well-being to enhance quality of life. So Kanav Group, which is 150 acoustical solutions, hygiene solutions, safety solutions for healthcare. And I'm very sure next 15 minutes will be valuable for you to understand what we are sharing about this. So serene atmosphere and indoor air quality are essence of what we really experience in a healthcare space. And yesterday, my colleague has presented UVC loop vinegar, or innovation in a UVC retrofit solutions in a ready-made hospitals without affecting AHU designing, without over maintenance, without anything, just retrofitting UVC solution to enhance indoor air quality. And there are many other ways you can do that, and many of our products I will touch upon will enhance hygiene factor. But this is something which every hospital should try and have it. And if you're interested us to get in touch with you for a UVC solution, I would request you to put your name and number in the chat or just say yes. I will personally will get in touch with you. Next important thing for a hospital is comfortable working condition. And can you hear the audio?
આવવાનું બોસ આવવાનું હોય ચાલુ કરતો હતો મોબાઈલમાં દેખાય છે આમાં ઓછું દેખાય કરો કામ.
So number one complaint in any hospital is not the design, not the lighting, not the air conditioning, but the sound which is coming into any hospital, which is uncontrolled, annoying, enhancing errors, and reducing satisfaction of the patient who are staying in there. And so this kind of environment doesn't help anyone to really experience hospitals' quality of service at the highest level. So errors are bad in any facility, but imagine those doctors and staffs and patients who are under such tremendous noise in our hospitals. We expect them to perform well. We expect them to deliver wow experience for our patients. We expect them to be best in the industry, but the reality is not like that, because sound affects us cognitively, behaviorally, psychologically. Wherever you are, sound is keep on affecting us. So this is an era which we need to design our buildings, design our hospital facility where we can really impact the quality of sound which we have there. So these are the products which Kanav Armstrong gets to healthcare facility. BioGuard acoustics, BioGuard plane are the world-renowned product used over 40 years across the globe for the best of the best hospital. We have launched that in a metal variety in India, which is antimicrobial, antifungal. So the next important thing when you talk about a hospital is safety and ease of maintenance. Like this, you have water leakage happening, when you have a trap door being a trap, how do you really maintain a hospital? Because leakage is a big problem for any building, but most important, the building like hospitals, where once humidity level goes up, the rate at which bacteria and fungus growth happen is enormous. So people are using a cement sheet, people are using calcium silicate tile, people are using metal tiles to just block the leakage. Without solving the problem of leakage, if you block the leakage, you are making your very dangerous. And this is something which is like a blind spot in our healthcare facility. So why we require a modular acoustical ceiling is a question which I put on the slide, because it gives you an accessibility. It tells you the leakage has happened at the point where the leakage has happened. In this particular building, you never know where the leakage is happening. The blood is flowing from 1 feet to 10 feet distance, and you can't solve something which you don't know, right? So we need to know the leakage. We need to stop the leakage at the source early as possible. So people go for metal ceiling, and they make a mistake of using metal perforated ceiling, and you have a perforation which collects dust, breed bacteria. Completely no for selection of such materials. And why I'm building this awareness, because there are many hospitals, government hospitals, private hospitals, believes in using, and they are using such kind of material, should be immediately stopped. What we should be using a right material for right application, and stay with me to see those things. I would also touch upon Griha and making your hospital more economical. Now, so human-centric design is the way we are going to have our facilities. We spend more awakened, alive time of our life, not at our home, but in the place where we work. So health and well-being and productivity is at the center of what all we do. So indoor environmental quality designing is something which is at the source of most of the great rating systems for your building. So IGBC rating system, I was part of this, and they have adopted a lot of parameters, a lot of things which you should study and have it for your hospital running, or a new hospital. But when you implement, let's say, one parameter like sound and acoustics designing, and what to design we'll see shortly. But what happens is your healing environment enhances, your patient recovery is fast, your staff effectiveness goes up, your hospital becomes safe. And these are the all parameters which can really make your hospital deliver 1.5x instead of 1x delivery right now. And it's a magic where people really enjoy being part of the team. So physical environment enhancement happens, and the sound parameters for different spaces are different. So there are parameters like background noise and reverberation time. And very shortly, I will share the case studies from Indian context. Over the last 5 to 7 years, I've collected a sound bites and done the study across India, both for the hospital facility as well as the facilities which are for studying education, college block next to the hospital. But these are the parameters which are physically can be measured. You have instruments on your mobile phone can help you to understand this. I will share this with sound because it doesn't make to show you without the sound bite. So when I share this, my sound will go, but you will hear the noise level in the corridor. We will see a couple of examples, and I will come back and talk to you.
25 decibel. Ground floor main building. Sound level 75 decibel.
Or even talk at this place. We are standing at GH Hospital entry foyer. So you experience two buildings right now, one which is occupied with excessive background noise, which is how most of the hospitals' lobbies are today in India. It's like worse than a fish market if you see in terms of noise levels. And other building, which was under construction, ready to get occupied, almost occupied, has a double height lobby, like a hotel lobby. And everything being on a hard surface, sound is reverberating. And that makes emotions and feeling transfer in that waiting lobby area, and actually enhance whatever the background noise you have to 2x or 3x. It doesn't help the facility to really work like that. So we have a code with us in terms of how we need to have our building designed for. The next one, which I said, is education block. Education block next to the building. I need to share with the sound bite again. Sorry for this from my side. This is an example.
RT study, IISCR, first floor, 110 classroom. Ceilings are gypsum fitted, doesn't give acoustics. We have best speaker on the wall, but if room is dysfunctional for reverberation, it doesn't help what speaker you and sound system you have. For such a small room of 80-seater, you don't need speaker. What you need is classroom design for reverberation time of 0.6 seconds.
Room are coming as 4. Sounds unbelievable. I do not know whether it is correct or not. 1.58 actually, which is after the treatment that we are getting this.
So these are the examples of how 3 seconds room sound, how 1.5 seconds room sound. And when the same room is treated appropriately, it sounds like you are speaking with me face to face. And this is a very critical time where students are coming back after 2 years of having virtual education for a medical college. At times they have attended a Zoom classes, at times they have done physical thing. But now the importance of sound and acoustics is known to the teachers and student alike. So in a hybrid education model going forward, we need to enhance the quality of sound in a physical environment than ever before. In a developed nation, you cannot start a medical school or a college unless you meet 0.4 seconds as a norm. In India, we adopted 0.6 seconds, which is fairly good enough to start with 35 dB background noise. And our team will be very much willing to come to your facilities, help you measuring this, and implement a model classrooms. If you're interested to have a model classroom done in your medical education facility, please give your name and number. We will be very happy to work with you to develop this and change the way education happen in most of the buildings and facilities. So I would share quickly last few slides. So these are the case studies. People have used Apollo Mumbai, which is 40,000 meter square facility. They have used wall-to-wall our solutions. Even a government and a philanthropic organization like Believer Hospital in Kerala has done modular ceiling everywhere. And as I said before, every area has a different volume and different purpose. We cannot have the same material on the floor, same material on the wall, and same material on the ceiling. We need to treat it as per the functionality. I will give you a couple of examples. Like corridor is the most important area in any healthcare facility or a lab facility where you require complete accessibility. There are hundreds of services literally running, require frequent maintenance. And if you really go for a material which is, like I showed you, is very difficult. So we have a solution in metal which can be swing down. There is no need of a trap door. You can access everything very easily. This is like application in the city of like Ahmednagar. There are many hospitals getting newly constructed and renovated using these services. Even in a patient room, you can have certain areas which require frequent maintenance can be done very quickly and maintained regularly as you go forward. So this is a must solutions for all the hospital, mainly because there is no service entrance. The walls are supporting the ceiling, and maintenance and everything get very easily done. This is a must to have solutions in retrofit and new facilities. This is another case study, Amri Bhubaneswar. Like I said, it has a glass on the one side, the gypsum other side, eco chamber, as I said. So the lobby area has been treated with beautiful wooden ceiling solution, which is acoustical in nature. And that has transformed this particular place. I am not going to show audio. It is take a lot of time here. But patient room in most of the hospital require antifungal, antibacterial BioGuard ceiling, which is allow patient recovery to be faster, and it can be wall to wall. You don't need a gypsum kind of a thing or drywall kind of a thing coming up there. You can also have design and pattern created onto the ceiling tiles. We have a solution called Ultima. You can have a hybrid solution, multiple product can come in. There is a special solutions for clean room application, aluminum grid, other things. So leave my email ID number also. You can get in touch with me personally for working with your facility in coming time. Thank you, Chandan. Thanks for this opportunity to have this event and partner with.
Okay, you just finished. Naresh, I was so much involved into it. I thought you would be summarizing in 1 or 2 more minutes. But it is always a pleasure listening you, Naresh. You give me a surprise factor whenever you come. So in education event, you have a solution. In health event, you have a solution. And believe me, though I'm not that technically sound, nor I'm an engineer background person, but in a very simple language and the kind of way you try to understand some of the important elements which maybe an hospital entrepreneur may not understand while he was constructing that hospital or clinic. But definitely in the constructed hospital also, you do have a service and solution to transform their present services without disturbing much of their, cost and construction. That is something we look for such kind of, technology partners and solution providers. And small elements which you presented, the corridors, halls, OT area, the ICU or MRI area, we are not that equipped to understand, or nobody tells that. Matlab, hum log, generally we go to an architecture or maybe a mason who is designing your construction. He is not sound enough to understand. Let us understand ki bhai, why this voice is echoing, or maybe any serious operation which is going under an operation theater, and where you need to just whisper to your co-doctor. So what is the decibel of sound we need to speak? What sound it should, come back? So very interesting facts and figures, Naresh, you always put. And so this gives an answer to the people who would be understanding why, Kinoff solution is helping and partnering with Adacom for this event. So, and your partner also yesterday, he explained it pretty well. So this is how we are looking for a better engagement and collaboration opportunities. Naresh, any opportunities or any interest area which comes to Ardacom, definitely will be passing those queries to your end and your team.
Thank you so much.
Before you leave, we would like to felicitate you and honor you for the kind of work which you are doing. A small token of appreciation to Mr. Naresh Duble. He is the head of continuous improvement and marketing from Kenoff Sealing Solution. And thank you for also supporting us and helping us in being the co-powered and powered by partner for the new normal healthcare leadership summit and awards. Thank you so much, Naresh.
Yeah, I want to say only one line. Thanks for this appreciation. Is our aim is to transform the way patient healing in our hospitals and way our healthcare is provided, and human collaboratively with all the healthcare facility owners, making a solution which works from them to making their staff more productive and healing their patient faster. The reducing length of stay for every patient is our aim to transform the healthcare infrastructure. So we work with government, we work with private equally on this initiative. Just share your name and number if you want me to get in touch with you in the chat.
Lovely, Naresh.
Thank you so much.
Thank you so much. Yeah, please invite Itisha to kindly introduce the next eminent panel speakers and the topic.
Thank you, sir. Thank you so much. Let's move forward. Let me invite our fourth panel. So the topic of this panel is how can wellness practices be associated with the right clinical result for widespread adoption, effectiveness of wellness programs on mental health. And our eminent panelists for this panel are Ms. Manjri Chanda, owner and founder of Manjri Wellness, Mr. Sahil Pruthi, founder Keto India and Liverfy, Mr. Rohit Dhingra, founder and CEO Infinite Health Studio, Ms. Fazana Siraj, founder of Orange Ray Holistic Private Limited. Mr. Arvind Savargonkar, CEO of Striban Healthcare, and Mr. Akshara Damle, founder of Mano Samveda. So Mr. Akshara is kind enough to accept our request to moderate this session. We welcome you, sir. So it's over to you, Mr. Akshara.
Thank you so much, and welcome to all the panelists today. We had discussions on various issues, right from rural-urban divide in the space of medical or health services and so on. And now we are gearing up for another very energetic and enriching session on wellness. So wellness is a state of being which is beyond absence of illness. Wellness is understood from multiple perspectives such as physical, mental, social, emotional, environmental, and spiritual wellness. In the modern world, where people are busy achieving their individual aspirations, most people have forgotten to take care of themselves. This has resulted in various health and wellness issues. While communicable diseases are still bothering the world, non-communicable diseases like cancer, diabetes, hypertension, mental health, and so on have been creating issues across all age groups. The cause of concern is they are causing early deaths of people. Even when the situation is grim, a lot of people are still ignorant about their self-care. When it comes to issues like mental health, people are still carrying stigma around it and are not open to speaking, including professors, doctors, bureaucrats, policymakers, celebrities, CEOs, and so on. COVID pandemic not only threw light on physical health, but also on mental health. So many people have suffered from issues like fear, anxiety, stress, sleeplessness, anger, frustration, irritability, and so on. So let's look at some of the statistics about lifestyle diseases. Indian Council of Medical Research conducted studies on lifestyle diseases, and estimated proportion of all deaths due to non-communicable diseases has increased from 37.09% in 1990 to 61.8% in 2016. Cardiovascular diseases affect Indians a decade earlier than their Western counterparts, and nearly 3 million people die of stroke and heart attack. 40% of those who suffer a heart attack are below the age of 55. So in today's panel discussion, let's explore what are the major concerns in the wellness sector, what are the challenges in bringing awareness, how organizations can contribute to employee wellness, and also see how digital technology can help in bringing about a change in the present and the future. So going towards the panelists, I request Sahil to pitch on first on I would like you to see how much the youth are aware at the conscious level about wellness and lifestyle related problems.
Sure, Akshara. First of all, thank you so much for having me on the panel, and excited to kind of share my learnings with the panel. We've been working with people in India and across the globe with regards to, a lot of chronic ailments that you mentioned about in the introduction with regards to whether it's type 2 diabetes, PCOS, hypertension, fatty liver, or even cancer for that matter, right? So, I think on the awareness front, even amongst the youth, the awareness is fairly low, and it's not just, I generally say this to people that in schools and colleges, there is very little awareness about, what nutrition or food does to our body and what impact it has on the hormones, which eventually cause various chronic ailments, right? And I've seen that extensively, more so with people, especially women in their early ages, becoming prey to PCOS massively, which is becoming a huge problem, where women start facing irregular period cycles, facial hair, acne, and that is largely because the course curriculum does not just talk about the hormonal impact that nutrition supplementation can have on our bodies, right? And how it is not just the right kind of nutrition supplementation can have an impact in a curative manner, but also a preventive manner, both basically, right? And that I see as a major void in with regards to awareness, not just in youth, but people who are elder ages as well, right? Where which I see that is a definite point of concern, and a place where we see a void to kind of create impact in as a company.
Absolutely, I totally agree with you. Going forward, wellness industry is one of the rapidly growing industries today. Farzana, can you share some challenges faced by you as you are a wellness consultant and founder of Orange Ray?
Thank you, Akshara.
Before I talk about my challenges, I'd like to thank Adacom Media for having us here and creating this wonderful panel. And good afternoon to Mr. Chandan, Akshara, and my fellow panelists and all the viewers who are watching this program today. I have been in this wellness industry now for over a decade. And this is a very rapidly growing industry. Currently, it's estimated to be at $4.5 trillion worldwide. And thanks to COVID, because now the focus is on immunity, it's on health and what you eat, how your mental space is, your thoughts are. This industry is expected to grow in the next 2 years by another $1,300 billion. So we are sitting on a huge, huge pie. But the problem in India, what I especially feel, because that's where I am from, is that, though we are going to be relying future on AI intelligence, on apps, on softwares, but the crux of this whole thing is skilled labor. And our labor skill, because it's a human touch, which makes wellness so result oriented, right? Because we are not dealing with, people are not dealing with machines. But the problem is the skill part. Now, where skill comes, there comes education also. So in India, I feel that there is no standardization of education yet. Because today you can see a yoga therapist who has done a master's and a PhD, and you get a yoga teacher, so-called yoga teacher, who does 1 month of 1 hour training every day. So how does the end user differentiate between the two? So 2 things can happen over this, Either somebody goes to a so-called quack and doesn't get results, and the name yoga and all the allied sciences get a bad name, or you go to actually a really good person and you keep doubting, and think they are a quack. So I think we really need to appeal to the change makers, whoever makes the law, that we need some standardization, some proper education where yoga and allied sciences are concerned. This could be in naturopathy, it could be in Ayurveda as well. Another thing, what I feel is the sector is so unorganized that there is no pricing over here. Okay, so people quote whatever they want. So that is what happens, the end consumer doesn't know what he or she should be getting at what price, and whether the services are authentic, are they going to somebody who is, reputed or not. So this is another one thing where the sector needs to get organized. And the third thing which I feel is there is no accreditation for, of course, now we have NABH, we do have QCI, but it's very, very random. It's there are a lot of things which, a lot of people where they are not able to pick out the so-called things and accredit them. And this is again directly impacting our insurance, because today we have very, very few companies who are giving insurance to alternative medicine or wellness industries. And I think that's where we are losing out big time. Of course, there are a lot of new rules come, but I believe they are not enough, because they are also, because I deal with insurance companies, they come to me because they say, ma'am, we don't know whom to insure and whose insurance to pass, because there are no guidelines, So I think there has to be some sort of some proper looking into by the government into all these aspects, because corporates rely heavily on insurance. And if alternate medicine or wellness is not insured, they will just bypass it and go to only mainstream medicine, what it is today, for lack of insurance. And I think that is one area we really need to look at. So these are the challenges I face. I wish the power makers are hearing me now and can make some, genuine changes. So thank you so much for asking this question.
Thank you, Farzana. I think you have covered multiple issues, right from skilled labor to governance issues to regulation and accreditation and so many other challenges. Moving forward, I would like to continue the discussion with Rohit. As you would agree with me, many wellness modalities are qualitative in nature than quantitative. For some people, results may come quickly, but for some, it may take a while. So in this context, yoga being one of the ancient wisdoms of our nation, how do you put forward the idea of wellness to the present generation? Taking forward, as Farzana actually said, that there are 1 month trained yoga teachers and PhD level yoga therapists. So, yeah.
First of all, thank you so much, Akshara, for the introduction. Thank you, Chandan, and complete team of Ardor to have all of us here. It's really a great unite to be here in terms to our fellow associates as well. And I feel, and I think I
I would really understand that looking at this industry, it's been about 9 years with this journey now. And if I talk about in terms to the yoga centric concern, which Farzana had just spoken about, so we were very I would say just from about a 500 square yard, I would say a small setup. We started training people on ground in terms to yoga. We were very new at that point of time. We used to see a lot of contingencies when people used to call trainers at their home, and we were looking at a studio model being evolved around the country. So that is wherein we had actually started, and over the 9 years, we have become a complete healthcare aggregator pan India and also serving a lot of nations abroad. So primarily, if I talk about the concern, wherein we discuss the piece of the yoga trainers inculcation at different levels, we have been training numerous individuals at home, at studios, and we also send out humongous number of trainers to corporate pan India, wherein we have versatile requirements. The standardization and the organization of the sector is still really missing. That definitely is the concern right now, because when we move up to corporates, right? Because being from a corporate background myself, when I left the corporate industry back in 2012, I was looking at these ground problems wherein we are like stinged to the chair for about 9 hours, 10 hours. The KPO, BPO industries are working for 12, 13 hours as a shift, right? Sometimes they're working complete night, sometimes early morning, Australian shift. There's so many kind of concerns in the corporate space, right? Now, if I really talk about the genuine problem on ground, we are still to tailor make a lot of exercises and practices that can help an individual be fit, that we can consider under the wellness segment altogether, right? So if I talk about issues like cervical spondylitis, or neck issues, I would say muscular dystrophy, these are nothing. These are just, something which are, I would say, irrelevant in terms to our lifestyle. It is just about a lifestyle that we, need in our 8 to 9 hours tenure or 10 hours tenure of our life. If you can just take out about 30 to 45 minutes and practice these inculcations, I think it can make a very big difference. So the organization of the segment, of course, is a problem, but it has drastically, I would say, improvised over the years. Because I still remember that time in 2018 when we had been awarded the Limca Book of Records, for doing 2,200 workshops in one day, and we touched 6 people. The only organization in India who has done that, that was really a game changer for us. Because we did not even know that, yes, we could touch 6 lakh lives. But when we actually evaluated it, we really saw we made just a 20% impact or difference in people's lives with yoga. There was so much to do as a journey, because yoga has got a half an hour, 1 hour revenue model. It is actually supposed to be a game changer, life changer, or actually an in-person changer. So I would say that wellness is a very big industry. We need to obviously inculcate it with preventive health, as well as the fitness, as well as the therapies of other allied sciences. And I think there is a lot that we can look at in the near future.
That's fantastic to look at it. And I think the discussion is going really serious, but at the same time exciting. And once we have understood the idea of yoga, I would like to move towards eating. Eating right is a major problem in the modern world, and food is a major determinant of one's health and wellness. So, Manjari, what is missing in today's meal?
Yeah, hi, Akshara. Good evening, Mr. Chandan. Good evening, everybody who's here. What is missing in today's meal? Everything that should be there. So essentially what has happened is that, when we started practicing nutrition, my first hospital job, was with Manipal Hospitals, Bangalore. And when we started practicing nutrition as a part of the therapeutic bit that we were doing in hospitals, it was a very, pushed back sort of thing, that there is a nutritionist who comes and she's just a part of the mainstream therapy. And nutrition never got its due at that point of time, 25 years back. Over the years, things changed. And cut to today, we are in a space where there's a lot more that has happened. The bit is that at some point of time, Hippocrates said that food is medicine, but it wasn't really, that sense of the whole thing was not really understood. And people thought that nutrition is just one thing that needs to be done for people to be healthy. Today, we're able to use nutrition in a functional space where we're able to reverse cardiometabolic diseases. Sahil was mentioning in the beginning that that's what they do. But in a clinical settings with cancer, with diabetes, with hypertension, with all forms of autoimmune conditions, neurological conditions, we're able to reverse many of them using food as the main modality. So that becomes your major modality. And then, of course, there are other things that you do parallelly, which include some supplements, some botanicals, some herbals. We also do a lot of alternate, like Farhana was mentioning, alternate therapies, which include stuff like, colon cleanses and enemas and IVs and antioxidants and a lot more. But the mainstay of the therapy seems to be nutrition. And because it is so powerful and because it is so capable of treating and reversing modern diseases, therefore the potential is huge. The problem is that there is it's still a sort of a, if I could use the word mumbo jumbo sort of a science, where everybody has their own interpretation of it. And it's not really as protocol driven as modern medicine is, So like, antibiotic use in an ICU is extremely protocol driven. There's an entire way to do it. However, the use of food in reversing a disease is not so clearly outlined. And so it's up to people who practice it to adapt it basis their understanding, their learning, their experience, And so there is a huge way to go. But the fact is that people are choosing, reversing diseases than living with diseases. And people will also start choosing not getting cancer than treating cancer, So I have a lot of people coming in when a patient has cancer. A lot of family members, please ask you, how do I not get it? If I have breast cancer, my mother had it, my grandmother had it, I don't want to get it. Can you tell me how not to get it? So that is where the power of wellness is, because we're not just talking about generic wellness. We're talking about serious implications of wellness, where we're talking of treating and managing modern lifestyle diseases. It's huge. The potential is huge. The market is warming up to it. The industry is warming up to it in a big way. I think it just needs to get more organized, more supported. As Farzana said, that accreditation, insurance. All these are important parts of the whole system. So these also need to fall in place eventually.
Yes, that's very precise. And I think food is also dependent on geography as well. So yeah, there will be, it's very difficult to come out with a uniform set of a diet. Moving forward, as we have already been speaking a lot about non-communicable diseases, Arvind, it's already known that communicable diseases are still bothering the world, but non-communicable diseases have been silent killers and primarily arising out of lifestyle issues. So what needs to be done in this regard? How do you look at this whole space?
Yeah, thanks, Akshara. And at the outset, good afternoon to all the participants, and thanks to Chandan as well as the OrderCom team for having me here on the panel. Akshara, before answering directly to your question about the communicable and non-communicable diseases, I would probably take one step back. Mainly because you all will agree with me that the recent pandemic just not stirred us, it has shaken us. And that probably triggers me to go about 35,000 feet and try to take a comprehensive view about the whole health and wellness as an area. And you all also will agree with me that probably the solutions will be far more difficult than what we could anticipate. Because this, I think Farzana, Rohit, both of them have touched that this is a pretty multifaceted area. And then it's at the same time fragmented as well. So how do we approach this? So probably my approach to this would be by asking few questions. So let me start that way. And then I think as the discussion progresses, I think I'll definitely touch upon the communicable, non-communicable diseases. So my question would be, can we get people to do health or wellness planning at an individual level? Let me explain this. I think all of us are aware that we all do our career planning. I think that has now come down even because that provides a livelihood. So it has come down even at the bottom of the pyramid. We all do our lifestyle planning. We know what we aspire to follow certain lifestyle, what kind of house, what kind of area, locality that I will live, what kind of utilities and amenities those could be there at my house. And we plan all of that, right? I think going further, all of us also do financial planning. Because in the midlife, what are those financial resources that I need? At a later life, what are those resources that I need? And we start planning accordingly. We start managing our lives around that. So my question here is, can we do something about our wellness planning? And let me further explain this, is because how this planning happens. I think it all starts with aspirations. We aspire for something. We also look at what are the kind of resources those are available to us. And then we kind of see what abilities that I have to have these kind of aspirations fulfilled. And we use this approach to healthcare planning, because I'm sure, I think nobody will disagree with me when I say health is and wellness is one of the very, very important aspects of our life, right? So looking at that, can I set my own wellness goals? Can I look at what kind of means that I have? And probably set a process in achieving that, because that's something today financial planning has become very, very process driven. And what has happened is we all see that I think as we are aging older and older, I think we are not getting much into the trouble because we have done our financial planning much earlier, right? So probably in my opinion, can we take this approach to health and wellness? And why I am saying this is, through this approach, can we bring all these fragmented and multiple facets together? And probably like Rohit probably was just saying that there has to be a standardization and mechanism, right? So I think probably at this point, I leave this topic here and probably would like to get Akshara, your views, others' views. And I think when I get a next opportunity, I think I'll touch upon, because I think that would be the continuation of going to the non-communicable diseases.
Sure. I think that's a very interesting idea that you're putting forward in terms of wellness planning. Coming back to Sahil, do you think that we need better researchers or research which can convince people to move towards being mindful about their wellness? And also, how did you make it happen in Keto India?
Yeah, Akshara. So I think, really good discussions and really good pointers from everyone with regards to yoga, nutrition and wellness planning. First of all, I think I legit made notes from a lot of pointers that everybody said. The answer is yes. And, with regards to research, especially, I would probably want to talk a bit more about, the journey in terms of how I started the company, Keto India and Liverify in the first place, right? So my mom actually had a brain surgery in September 2017, right? And immediately after the surgery, when I noticed, as Manhari was pointing out, in the hospitals, the kind of food that was being fed, I started reading up about nutrition and healthcare, coming from an engineering background, right day zero, immediately after the surgery happened, to make sure that she gets the right kind of food, and I realized that a major chunk of the food that was being served in the first place was very contradictory to what the research said about why the surgery was needed in the first place and how do you prevent it from happening in the first place, right? And nothing made sense, right? And day zero was the surgery, and day one I was just fighting with the doctors, discussing with the doctors in terms of how contradictory the food is, and this has inflammatory impact on my mom's health, this will cause insulin resistance, and this might cause the surgery to happen again or cause the recurrence of the disease. And when I was off my job for a good 9 months and spent all my time researching on PubMed and read all sort of clinical trials that there were, right? And coming from an engineering mindset, what I realized was that there was a huge contradiction from doctors in terms of acceptance of wellness and nutrition as a space. And understandably so, because there is not a lot of statistically significant data for it to become a standard of care in the first place, basically, right? And that's how, you know, any drug becomes a standard of care, is when you actually run phase 1, phase 2, phase 3, phase 4 of clinical trials. And when you say that, you know, I have, you know, statistically significantly been able to prove that if I divide my audience from 1,000 to 500 people to doing the protocol to 500 not doing the protocol, 500 saw an improvement, right? That's where you actually say, this is being a curative kind of protocol than just being a good to have, right? I realized, and as you know, very well pointed out by Manhari in the discussion, was that nutrition and wellness, even in the clients that we've worked with, have had curative impacts without being on the standard of care in the first place also. And I realized that it is extremely important and imperative for wellness to be a place where extensive research goes, where we are able to provide statistically significant data for it to become a part of, you know, curative care, or being a good adjuvant even, for that matter, basically, right? So just to give you some context, like when I started reading about nutrition, my mom went through radiotherapy, and I got to know that the steroid that is used actually reduces the efficacy of the radiotherapy, because it acts as a poor radiosensitizer, right? And she was one of the few patients to do radiotherapy without steroids, in the need for steroids in the first place, purely through naturopathy, right? Extended that to a lot of, you know, supplementation that could be good adjuvant treatments. And my mom has, you know, still very healthy, and has constantly got clean scans for 4.5 years, right? So I kind of realized that, you know, data research and good literature is for not just nutrition being a good adjuvant, could be a good starting point to standard of care, and then being a good standalone treatment in the first place, or curative part of it needs a lot more data, right? And that is something that I definitely feel, right? The second point is that nutrition is very varied, right? So the kind of impact that an apple or wheat might have on my body will be very different from what it has on Akshara's body, or Farzana's body, for that matter, right? And the personalized nature of it makes it even more complicated as well, right? It's a field in itself where personalization is a very major lever of nutrition, wellness, or healthcare in general, or yoga for that matter, right? So what kind of impact does an integrative or a wellness piece have on one's body needs even more detail to understand, like how does it's not a plain drug which is acting similarly on everybody. So both personalized and integrative pieces of healthcare need a fairly high amount of research to get data for us to be able to have more data driven concrete discussions as we kind of proceed. So yeah.
Very well said. I think, yes, statistics definitely give some impact on acceptance. Farzana, you have already raised this issue, and going forward, yoga has been restricted mostly to asanas, and that too, I feel, getting wrongly practiced in the form of power yoga, whereas yoga has to be practiced with patience. So whether such modifications of the original ideas have spoiled the core or brought a disbelief about the science in itself?
Thanks. I think that this whole discussion is going very well, and a lot of aspects of holistic health is coming out from all the varied speakers, esteemed speakers. I'd like to just share a little bit of the work I do for me to answer this question. So at Orange Ray, we are a complementary system, holistic system. We don't use any allopathic sciences, but we have all the alternative sciences like Ayurveda, homeopathy, acupuncture, yoga therapy, naturopathy, and even psychotherapy. Now, why do we need to do this? Because yoga, if we actually go by the authentic term of yoga, the way Patanjali spoke, it's an 8-step process. Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi. Now, what we are talking about when we talk about asana itself is only one part of the 8. So if you talk, it's 0.125%. Okay, right. That also is being done wrongly. Okay, so you can imagine we are not even scratching the surface of yoga. But having said that, I have nothing against people who want to, hold beer bottles and do some exercise. I would just request them to not call it yoga. That's all. They could call it whatever they want it, But today, like we have beer yoga, we have something called tandoori chicken yoga. I mean, the list is endless, right? And yes, it is being used very lightly, frivolously, and flippantly. Having said that, what would I say? Social media, we have pros and cons, right? So today, if anything good also is being done, it goes all over the place, and the bad goes faster than that as well. So today, what generally people think of, yoga, so what they forget is actually there are three different things which I have classified in yoga. One is a yoga instructor who teaches you how to do a yoga asana. One is a yoga teacher who teaches you yoga in the entire philosophy of yoga. And the third is a yoga therapist who treats you through yoga. Okay. Now, the average, public doesn't know this. The average man doesn't know this, that they just think everything is a yoga instructor. But I think these are the classifications which are very necessary to explore, And because when my patients ask me that, ma'am, I'm already doing yoga, then why am I having back pain? So I explain to them saying that yoga to me would be equal to a chemist shop. Every medicine in a chemist shop is very useful, but that same person doesn't have to have all those medicines. Similarly, every yoga asana, we started out with 84 lakh asanas 5,000 years back. Today, we are practicing 84 mainly, but a patient can't even do 84. Why a patient? A normal person also should not be doing, because that's where, again, as Sahil said, customization comes in. You can't give everything to everybody, and that's what a therapist does. So if you are just practicing yoga, general yoga, doing with another 30 people, that also online, please be ready to get injured. Please be ready to have problems. It's not the instructor's fault. It is you cannot, one size fits all cannot be done. So we have to use what has been given to us wisely. The discretion is at our side. So I would say that the end user must understand what they're going for. So it's no point in blaming the science. It's us who are taking faulty decisions.
Right. Thanks for that. I think that distinction between instructor, teacher, and therapist is really useful. And in India, people turn to a lot of alternative medicine and therapy options for treatment. How can we collect data and determine the success ratio of the patients turning out to wellness practices? Rohit, would you like to share some thoughts on this?
Yeah, absolutely. So, Akshara, I think I would just pick up from where Arvind had left. So he had placed in a very important point that, there needs to be a plan, like we have a financial plan, we need a complete kind of a planning. So wellness is also something in the field which we need to plan, be it preventive health or be it a wellness activation, a simple activity as well. So coming from this understanding wherein, sourcing so many activations under wellness to corporates, we have tried to make a wellness calendar for them, So when I talk about a calendar, we have two kinds of prominent dates, or I would say events, which are actually classified month on month for the entire calendar year, right? So just not yoga day. So like say 21st June was declared as a yoga day, right? We have 14 November as a diabetic day. We have a cancer awareness week, So every month there is something, very prominent, which not only the general, I would say the corporates in general, functionally follow, even the retail customers, manufacturing units, and on ground, any kind of the employment workforce do take up these practices with their entire year's wellness budget. But that again is not organized. Why? Because it is very random from an HR perspective, right? Or from a cost perspective, they want to engage their employees. Like we say wellness, and then we, compare it to an engagement activity, right? We want something to be done as a exciting, as a team building, or as a togetherness. But that should be different to what we pertain to, or something related to health should be different from engagement. But here the problem in the general, I would say day-to-day functionality is both of them are being clubbed together. That's because of time, that could be because of cost, that could be because of the illustration practice, whatever X reason, right? So data gatheration is very important because now tools have come up over the last 4-5 years wherein we are seeing RAG analysis. Now, what is RAG? It is red, amber, green. Very simple analysis, right? So if somebody is in red, it means his lifestyle condition is not good. So there are predominant factors that are there done, like for example, a simple RBS or BP, BMI check, or a BMD check, bone mineral density check, or just a simple, I would say, fitness parameter. How much is your endurance? How many steps can you walk in it? Probably 5 minutes. So these are very small practices that are there, which can, commonly be done rather than getting too much into the IT solution. So there are certain drag analysis wherein we try to tell a consumer, employee, or an aspirant that what exactly post a psychometric analysis, where does he actually stand? So if he's in a red category, the effort should be to bring it to amber. Somebody in amber should come down to green. So the goal is to come down to green and make him healthy. That is what the entire episode of our wellness activations do. And very rightly said, like Farzana was talking about the differentiation in terms to a trainer, teacher, and the on-ground practices that we, adapt to. So it is very important that the experience of an industry specialist, like even if I talk about an ergonomist who's telling you the range of motion of exercises, right? He has to be very well equipped to understand that aspirant. Hello? Am I audible?
Yes, yes.
So basically, when I talk about an ergonomist also, which we inculcate for different range of motion exercises, so it could be that very simple exercises could also hamper an individual, right? For example, I move my hand this way. For example, this is an exercise for me, but maybe your joint is not strong here, and for you this could be damaging as well. It's a very simple exercise, but for you it might not be, maybe because your wrist is not right now very strong or inculcated to take it up. Yeah. So data is prominently very important, and when we go down to teams on ground, when we go down to individuals, when we go to a group of people, we definitely try to gather as much data that we could, and we try to submit it to institutions, to schools, to different kind of industry segments, because this is a realistic figure. When we talk about, when we have done an analysis of a cabin crew, say for an airline industry, right? That person might be very differently enabled when it comes to an individual who's working at a ground staff. A person who's at the ticketing desk. Just talking about one segment right now, the airline industry. A pilot differentiates from a cabin crew, and a cabin crew also differentiates from a ground staff worker, right? And all these three individuals have actually got a different kind of lifestyle disorder and management. So I'm talking about just one segment to actually organize that sector. It would take a humongous number of, I would say, attacks to get this in place. Absolutely. So I think, yes, forward from this, I will take it in my next discussion.
Sure. Thank you for that analogy with the airline industry. Manjari, I would like to take it forward from where you left earlier, because you talked about reversing the non-communicable diseases, even the chronic illnesses like cancer. So I would like you to throw a little bit light on how food can help in rectifying or reversing these issues, and what are the simplest things that one must take care of in terms of their meals.
Yeah, thank you for the question, Akshara. So while Sahil was talking about, the standard care of treatment, in pharmacology, when they are researching a drug and when there are trials done on and clinical trials done on drugs, if, let's say, for example, there is a drug that can reduce the HbA1c by 0.5% in 6 months, I mean, it's called a revolutionary drug, and there is research papers and papers written on that, and it becomes the newest molecule. With food, in 3 months, you could bring down a person's HbA1c from 10 to absolutely normal, 5.5, which is a normal HbA1c. And that is, I mean, we're not even talking about a 0.5 or a margin. We're talking about correcting a completely, odd HbA1c back to normal. But sadly, it has not been documented, nor there has been so much of push about this whole concept, because unlike pharmacology, it does not make a lot of business sense in the real world. It becomes for a person who's practicing nutrition or wellness, it becomes a very major modality, even for people who are receiving it, because it may help them reduce their dependence on drugs. It may help them, correct a lot of conditions. But for the industry per se, but for business per se, it's still not become a very, very, revenue generating or, business thing. So what I would say is that there are a few things that people have to primarily understand about food, which is that unlike what people do which is, just bracket food into proteins, fats, carbohydrates, vitamins, and minerals, if we try and tell our people to look at food at a very basic level, just look at food in two categories. One category of food which helps and sort of works in harmony with the human biochemistry, and the other category of food which causes inflammation, which causes the biochemistry to get disrupted. And so you could clearly pick up any food and put it in one of those categories. It's either healing for the body or it's inflammatory. And that is a simple thing, so we know that simple sugars, processed carbs, refined things, anything which is processed, packaged, tinned, canned by category, anything which is high on a pesticide, insecticide load, anything which is animal product, most of the time, very few animal products can claim to be anti-inflammatory, anything which is, quickly broken down into sugar in the body, anything which is not very native or natural or ethnic to where you were growing up, which does not really resonate with your genetic composition. All these things are inflammatory, So everything, just giving you an example, if you look at fats, there's a lot of talk about, Sahil is from Keto India, where they're saying fat is good for you, which is actually the truth. The point is, if you look at fat, in the last 50 years, we've eaten the type of fat that we never ate for thousands of years. The type of refined processed oils that we eat now, the type of mayonnaise and industrial butter and industrial spreads that we eat now was something that nobody even consumed 100 years back or 50 years back. White sugar didn't exist 150 years back. There were no sugar mills. Do you know that the first time they made white sugar, you had to buy it on a pharmaceutical prescription. It was sold in pharmacies, white sugar. Cut to today, it's every food that you eat, So the thing is that if we can easily identify food which is good for our bodies and food which is not good for our bodies, and if we could just work on those basic principles, we could at least look at wellness. But when we're looking at the clinical bit of nutrition, where we're looking at using food to reverse a condition, then it becomes a little more protocol driven. Then it becomes a little more specific. For example, another very, very, very potent concept of food is fasting. Do you know that just fasting is almost 50% of your job done when you're looking at reversing a cardiometabolic condition? Because when you fast, you allow the body to do much more than digest, assimilate, and process food. You're allowing the body to heal itself. Insulin resistance, increase in somatotropic hormone, increase in stem cells, reduction in all forms of dead, decaying, misbehaving, precancerous, pre-tumor cells. This is all what happens when you're fasting. So simple concepts of fasting, not eating too much, that 80-20 rule of eating 60 to 80% of your appetite, never overeating, following the sun cycle, trying to eat and sleep with the sun, and trying only to eat real food, things that you have complete control. Just because the industry says that this is high in iron or low in saturated fat or high in fiber, do not use that. Get back to real food. So these are simple concepts, but they are extremely powerful. Another example is, in cancer, for example, we know that fasting the cancer cells are weak cells and they require a lot of quick supply of energy to multiply. For the tumor to multiply effectively, you need to feed it sugar, literally. And sugar could be sugar, it could be sweet fruits, it could be processed food, it could be white rice, white flour, all of it is sugar, or dairy. So when you're not giving sugar to a person with cancer at all, the cells don't have the quick energy to multiply. So you can literally kill cancer by fasting, by oxygenating the tissue, and by reducing the intake of carbs or stopping the intake of carbs. And this is so effective. We use something called the fasting mimicking diet for our cancer patients. Also, cancer patients are sometimes very, very cachexic, so they have a lot of muscle loss, they have a lot of, they are very frail because of the trauma of chemo radiotherapy, so we can't fast them completely, so we mimic fasting. So we use something called the fasting mimicking diet, where you're giving the benefit of fasting without actually fasting the patient. So to sum this up, essentially simple concepts in nutrition that are extremely potent are: 1, fasting; 2, not eating many times or eating too much; 3, eating from that group of foods which is more real, does not come out from the industry, does not have simple carbs or sugar, is not processed or packaged, is more ethnic to where you come from, because it also, speaks to your genes more well. Also, it's real in every sense of the word. So it's real food, it grows on plants, And so we tell our patients, a very simple line: do not eat less. Eat less often, mostly plants. If you could do that, eat less often and mostly plants, you're doing quite well. So yeah, and of course then, but when we come to disease management or disease reversal, then it becomes a little more. And then we also combine other things with it, So you have to look at the gut, you have to look at, correcting the gut microbiome, you have to look at what sort of, people who have acidity, constipation, reflux, people who are not digesting, have malabsorption. So all that also has to be addressed at the same time.
Beautifully said. I think a lot of takeaways for everyone who is listening to this. Moving forward, I would like to touch upon another major issue that is becoming a turmoil in the society, that is mental health. Stress is impacting nearly 50% of the employees working in the organizations. So what do you think could be game changer in bringing a paradigm shift in this space? Arvind, since you are working something in this space.
Sure, Akshay. I think earlier you did talk of lifestyle diseases, and now I think probably I'll also touch upon the mental health. If you look at it from a more comprehensive view, I think they are very closely interrelated, because we all know stress and the stress-related maladies are the primary cause for most of our diabetes, hypertension, and things like that. So what that actually takes us to, something that is an emerging field today, is the mind-body medicine. So I think what probably we need to do is to look at both the mental health as well as our hypertension, diabetic, and all other cardiac and lifestyle diseases on a mind-body continuum, and something that is a mind-body interface. There is another suggestion at this point of time that I have, where I would like to continue or take it forward where Manjari left, is that I think when we talk of mental health and say cardiac diseases, from the outside it might appear that they are those independent diseases, maladies, but we'll have to understand that the mind-body interface, they are somehow interrelated. And what we need to do for that is to probably have an integration of our traditional medical system versus the modern medical system. And can we look at, and if you look at it that way, is to bringing in modern medical system tools back into the traditional systems. Can we use, because we all today understand, okay, half of my career I have worked in building technologies for critical care applications. So I spent years and years around ICUs and inside ICUs. For the last 1 decade or so, I'm very closely looking at stress and stress-related disorders. So probably I have benefit of looking at both sides of the coin. And with that confidence, I can say that they are definitely interrelated. And unless we look at that interface, unless we look at that integration, I think these solutions would not be all that easy to come by. Because we all know that today, anxiety disorders, mental disorders show up certain biomarkers at the physiological level, at the endocrine or the hormonal level. They also show up at the neurological level. And a lot of such tools are available today at the modern medicine. Can we take them back into the classical, traditional medicine when we look at psychology, when we look at psychometric tests and things like that? The other way around is because traditional science has been always in preventive measures, whereas the modern science is very much focused on the curative science. I think today we need a combination of all of those two systems together. We need to break those silos and set aside our mindsets and start digging or start looking at this interchange and each other side and start picking up the right things together. So in my opinion, to address the mental health issues, if we start using the modern medicine tools, we have today physiological diagnostic tools which can give us much early indications of somebody is prone or somebody is passing through the anxiety disorders or stress disorders. We have tools on the hormonal markers, pathological tests are available. Can we make them mainstream? Now, I also quickly want to touch upon one more topic because there had been certain objections or the concerns raised around it that come from the modern side that you use the test very often just for the commercial purposes. Okay. But on the other side, I think we use as complex a technology as AI and stuff like that for our social communication. In my opinion, what's wrong using this technology for health? Because at the end of the day, the health is so important than our social communication, right? And what would happen is today, many of these technologies could appear to be pricey, but I think as the mass base increases and the application increases, I think that objection to the cost and resource consumption hopefully will come down in the time to come. So I think my probably proposition is this integration at the mind-body interface as a tool to address both the lifestyle diseases as well as the mental health diseases.
Very, very nicely intertwined non-communicable diseases, mental health, stress, and so on. Going to the next round of discussions, I request all the panelists to restrict the responses for 2 minutes in the interest of time. Sahil, what is the underlying reason why this chronic issues like diabetes, PCOS, thyroid, obesity happens in the first place? Can you throw on the causative factors and how can we leverage nutrition wellness as Manjari has already spoken a little bit about it? What are your take on that?
Yeah, so I think thanks for the question, Akshara. I think there are multiple reasons around why we've seen these chronic ailments happening in the first place. But one of the major reasons which Manhari pointed out is actually underlying insulin resistance. That is being one of the major reasons or contributing factors to type 2 diabetes in case of people suffering from diabetes or women with PCOS who have excess male hormone levels like androgen or testosterone levels. That is one of the major contributors that we've seen. A lot of micronutrient deficiencies, which we've seen in people with hypothyroidism, for example, zinc, selenium, iodine being major contributing factors in hypothyroidism, right? Again, insulin resistance being a major contributor even in high cholesterol, or people calling cholesterol as bad, but cholesterol actually becomes bad when it's inflamed, right? It gets inflamed when you actually have underlying insulin resistance in the body, right? So, underlying insulin resistance is one of the major contributors that we've seen. The second contributor that we've seen is underlying inflammation in the body. That is a huge contributor to not just these chronic ailments, but people with cancer care issues also, right? And answering your second part of the question is that, how do you kind of prevent it or how do you make sure that it does not happen going forward? The first step for us is to actually know that, these are the underlying issues that underlying hormonal issues that are triggering the chronic ailments in the first place, which is what a drug like a metformin or a contraceptive pill in terms of regularizing period cycles would do. So we need to first, empathize with the fact that these issues are mostly hormonal. And the second is that you can't improve what you can't measure, right? So the second and most important thing is to actually start measuring all the hormonal markers that could be, contributing factors to these chronic ailments in the first place, right? And the problem is that most of this knowledge is actually in silos, which is like a doctor knowing the fact that a chronic ailment happens because of a certain reason, and a nutritionist giving a second line of thought, basically, right? So there has to be one contact point through which this information flows to the patient, so they understand the fact that there are certain underlying hormonal issues that are causing this issue in the first place. Measuring that first, and then figuring out the right kind of nutrition, supplementation, or medication if needed, right, which becomes a more, a very integrative kind of a care protocol, is what I feel on the curative side. On the preventive side, regularly measuring what your underlying hormones are and what could kind of cause a bigger issue going forward, right? I think Manhari mentioned about cancer care, right? So if you don't measure your HSCRP or CRP markers, for example, which is a C-reactive or inflammatory marker, you will not know that you're at risk for cancer, right? There could be other markers as well, but I'm just giving an example, right? So I think measuring is a great start, and then consuming the right kind of nutrition or supplementation, and not being very averse to the idea that supplementation is medication, right? So naturopathic supplementation can be highly anti-inflammatory. So not being very averse to the idea of consuming supplements would be a great way to kind of, prevent these chronic ailments from happening in the first place. So yeah.
Okay. That's an interesting thought, that we have to measure right from hormones to everything, so that we are aware where we are and where we stand. Farzana, as you have involved yourself in research as well as a practitioner, my question to you is, how can eminent healthcare professionals back up healthcare and wellness programs for patients, students, and employees?
Okay, thanks, Akshara. The answer, as Mr. Arvind also said, and Sahil said, and all my fellow panelists have been talking about, is the answer lies in integrative healthcare. Now, I will just tell you what are the integrative healthcare. Basically, we all know is combining traditional care with the complementary therapies. Now, how does it help the end consumer? It betters the outcome, number one. It reduces health costs drastically. It looks at the person as a whole, body, mind, and emotions. And so there is no reductionist attitude over here at all. So these are the benefits, and not only it benefits the end patient, it benefits the family, it benefits the caregivers, it benefits the society and the nation as a whole. Now, I'll tell you, in my practice, I see now how can doctors help in this? Now, if we are using integrative healthcare, I would say that whether it is an oncologist or a cardiologist or an endocrinologist or a gynecologist, everybody can use complementary therapies. I would go as to say complementary therapy is like a zero. You add it to anything and you make the effect 10x. Okay, though it has no substance of its own, but that's what we can do. So now, like for example, I see a lot of musculoskeletal pain. So low back pain, cervical disorders, frozen shoulders. It's very common in corporate people. The main reason is a combination of posture, repetitive muscle injury, and stress. So the three things. Now, when they just go to an ortho, I'm using this as an example. When they go to an ortho, they're only dealing with the repetitive stress injury. Okay, so they put them on to the physiotherapist. They just give them some, IFT and stuff like that. But it doesn't solve the problem because the posture has not been corrected, their ergonomics has not been corrected, and the stress part has not been dealt with. So it keeps recurring again and again. So that is why we need integrative healthcare. So it would be just imagine this whole picture where you have orthopedics having not only physiotherapists, but having yoga therapists, and maybe even having nutritionists because they may be low on protein levels, they may be low on vitamin D, so many things, right? So just imagine that scenario. Wouldn't that be so holistic? So that is where doctors and super specialists can help us. So suddenly we've seen that in healthcare compared to 50 years back when I used to be a kid, we used to go to our GP for small problems. Today, when we have a small indigestion, you straight away go to the surgical gastroenterologist, not even the medical one, right? So what does he do? He is going to cut you, right? So where is that GP gone? Why don't we get more of GPs? And why don't we get, people who will refer to, we don't need to straight away go to step 5, right? We can always address these issues at step 1 itself. So let's look at that. And I think that's where all the doctors can help this. It's a win-win situation. It'll give more access to healthcare, and we can save a lot of heartache and save a lot of money as well.
Wonderful. I think you brought it in a very holistic way that integrative health is the solution for all these problems. And coming to Rohit, you keep conducting various wellness programs for individuals and organizations. So can wellness programs help in modifying behavior and help patients withstand or resist or insulate themselves from other mental illnesses as well?
So yes, Akshara, I think definitely it can bring in a lot of different, in fact, I would say as a differentiation aspect. Why? Because giving you a very prominent example, one of our major clients, you must have heard about these groups. I mean, all of us have heard about these groups like Lifestyle, Shoppers Stop, the guys who work at the store. So if you see the ratio for last 2.5, 3 years, and if you see the kind of data analysis coming in from these people, from the group head HRs as well, it has been very sad to actually, categorize this, that people are committing suicide. There are suicidal cases to a very great extent, and in fact, the entire organization is very worried that, executives, sales people, or, people who are just managing storekeepers who are between the age of 18, 19, 20, or maybe latest of 24, 25, if they're like a mid managerial aspect, the kind of sensitivity to this entire, I would say, complete phenomenal changes that we are actually seeing, not only COVID being an impact to the society and, obviously addressing our concerns in a very great way. But this era had started somewhat in 2018 end, November, December, almost that is wherein we had got a lot of queries, wherein people were having major concerns in terms to competitiveness, in terms to the stress levels increasing, and people were not in a condition to talk about it as well, So I would say we also implemented concepts like DAS. DAS is like depression, anxiety, stress scale, So there is a 40 to 42 questionnaire, which is just asked, which a normal psychologist, you don't even need a clinical expert in that. Just a coach, a lifestyle coach, or a psychologist can just have a small interaction with you and understand how, your entire journey of a day or maybe just a week, and how you exactly feel, balancing your personal and professional life, how you feel, so that 10 minutes of conversation and evaluation through that 42 questionnaires actually reduced in 12 to 13% of the ratio in 6 months. So that is the kind of impact we have seen as a change in the corporate era, especially in the manufacturing, retail, and I would say these multiplexes. So even if I name PVR, the guy behind the camera, who's trying to actually shoot the entire movie, he's also under immense stress. So look, these are the ground challenges. We are not even aware of these. We are just, so as a whole, if I see the wellness industry definitely is talking about the overall, concerns, and we're trying to put in a lot of, I would say, concentration of focus on the bigger chunk of the concerns. But when you go down to the grassroots level, there is a difference, I would say a very differentiated approach of standardization seen there. Absolutely. So with this, I think as at Infinite, we are trying to, obviously bring in infinite changes in the wellness and healthcare space. So I think we can all be infinite and look forward to make this a brilliant journey ahead. Thank you.
Right. And yeah, in fact, I also see that mental health issues are there right from slums to celebrities. So correct. It's there absolutely across the social segments, class, caste, race, gender, everywhere.
Very true. Very true.
And being a psychologist, I am very much interested in the aspect of mental health, and I would like to look at it in a different perspective with Manjari. How do you see food can contribute for mental wellness?
So the entire body is like this big orchestra, and your gut is the guy who's playing the orchestra, and the gut is connected to the brain by the second biggest nerve in our body, the vagus nerve. So the gut and the brain talk to each other. There is a gut-brain axis. If you're not doing great in your stomach, if you're not absorbing nutrients, not eating the right food, the right type of neurotransmitters are not created. There is a reduction in the production of serotonins, dopamines, the happy hormones that we need. Yes? So it's a very direct correlationship. I mean, like we talk of the immune system and the gut, so is our neurotransmitter system and the gut. I mean, there's enough and more said about how foods can be sources of even things like choline, you know, which is the acetylcholine, which is a neurotransmitter. So you can eat food rich in alpha lipoic acid and choline. If you're short on biotin, there'll be a lot of neurotransmitter reduction in the body. So what we are eating is not just fueling our physiological health, but is also fueling our mental health in many, many ways. And, you know, I'd like to say a small example here. So in today's world, as people become more and more individual and, you know, where they're moving out of their homes, going to different cities. I mean, I have a friend whose 19-year-old daughter moved to London to study. You know, when you do that, that little girl comes back to a small room, eats her own food alone. There is a huge impact of that on the body physiologically, which eventually also affects the mental health. So it's not just being lonely that they feel depressed. There is a reduction there is a deterioration in the quality of food that they eat, because that's what they have access to. And with that takeaway food, you know, food on the go sort of a thing that people live with when they're studying or in dorms or, you know, doing such work, they're highly malnourished with the right nutrients. They're not eating the right fats. And obviously that contributes to mental health conditions. One of the things, for example, now, of course, people talk about so many things, including ashwagandha, shilajit, bacopa. We know there are some things called the nootropics, a category of food ingredients that can work on your psychosomatic brain health, mental health. That also needs to be, that was a part of our systems. By the way, Sahil, I think Farzana, somebody was mentioning about, you know, the little bit of the supplements, herbals, botanicals that people, you know, look at it at drugs and get a little perturbed if you ask them to take it. But even if you look at a basic Ayurveda, naturopathy sciences, there is an element of herbs that is built into those sciences. Yes, so therefore a lot of relationship between food and mental health. There is a very, very clear relationship, and there are certain foods, though people mostly think that caffeine and chocolate are feel good foods, there are many more. A nice good salad with some nuts and fats can also make you feel really good. Of course, the last bit I'd say, Akshana, is that, you know, the bonhomie of eating a meal with your friends and family is always better than sitting in a corner and eating some salad, you know. So
Brilliantly.
How we eat and with whom we eat is also very important.
Yes, it's brilliantly said. Thank you for that. And coming to the last question of the panel discussion today, Arvind, what is your opinion about technological intervention in transforming the idea of wellness in the modern world?
Yeah, Akshara, talking about the technology, I think this session would not be complete unless we talk about digitization. And I'm not saying that just for the sake of fashion or just because it's a flavor of the day. I think we have recent certain examples. Let's look at the case of our corona pandemic. I think the kind of numbers, real-time numbers, those were available about the cases and deaths and being published on a daily basis has definitely largely influenced the people's behavior. And I believe that is one cause for controlling this pandemic in a shorter time span. The other side, looking at it, whenever we missed the data, I think we had catastrophe. Something similar happened during the second wave. I know for sure because I was tracking the data that the early signs emerged of the second wave somewhere in the second week of January. And the bigger wave hit us in the last week of March. If somebody would have been, or the policymakers would have detected that early rise in the second week of March, I think the further trouble could have been much, much reduced. So I think my proposition here is if we can bring in this digitization and data, even in the wellness domain, and then the policymakers are aware of the actual number of cases which are being treated of stress, anxiety, mental disorders, and overall the wellness issues, And then along with that, if we have the real-time data, all the therapists, all the people working in this area, if we can get the data together in real life as to what therapies are giving what kind of results, and we make the whole paradigm as a data centric, I think it will help us change this scenario much faster than doing it without the data.
Completely agree. I think, yeah, that is where we lacked to even while addressing the pandemic. So I completely agree. And I think it was a very enriching panel discussion. Right from we started from, we all agreed that there is a lack of awareness among the people towards wellness. We got the pointers like wellness planning, just like financial planning or career planning, to the differentiation between yoga instructor, teacher, therapist, to another new thing that white sugar was something that was sold in the pharmacy and not in the regular shop. So it was a very enriching session, and I think we all need to be mindful and measuring what we eat, what is happening in our body, and be aware of where we are in terms of wellness, so that we can take care of ourselves and lead a good life. Quality of life can be ensured with that. Chandan, there are 2 questions. Do you suggest to ask? Do we have time, or?
I think we already have the next panel with us, Akshara. So let us.
That can be answered on a text.
Sure.
Yes. Thank you so much for Aldercom Media Group for conducting this panel discussion. It was really enriching experience for all of us. Thank you so much.
Thank you very much. Thank you.
Thank you for having us. Thank you for having us, Akshara.
Thank you so much. Thank you so much for making this making justice to the panel topic which we had decided. And believe me, getting speakers for a certain panel, it's not a random work. We do a lot of research work through LinkedIn, through Facebook, through contacts, and whatever sources. We try to bring the variety of the experience and expertise. You can see over here the kind of experience Arvindji is having. So under his guidance and the vision which he had of driving the wellness sectors, and the young entrepreneurs who like us, who are witnessing and seeing him as an idol, and we are moving ahead. Believe me, all the panel topics which we decided for this entire 2 day was not a mix of different segments. We had a separate session on CIO, CTOs. We had a separate session on Ayush. We had a separate session on pharmacy, separate session on hospital and clinics, and a separate session on wellness, which you just did a right justice to this. I was so much involved in every speak, and I can see the enthusiasm and energy of everybody, of Rohit, of Manjari ji, of Farzana, of Akshara. Akshara, you did a wonderful moderation. The next moderator for my event will be you. For whatever topic I will be deciding.
Sure.
Thank you. See, they have so much of expertise in their own domain. Getting the best, outcome, until unless you throw a right question to the right person, it is very difficult. So this is a good job which you've done. Sahil, I really salute for the kind of work which you're doing in such a young age. Keto, our celebrity guest, was just there. I was confusing, do I have another celebrity guest of Keto in India? Oh yes, so Keto and Keto were just matching to my senses. I just confirmed with the team. Thank you so much, Sahil, for making this session a very lively and wonderful session. If the session ends with a smiling face, what best I can expect from this? So let us do one small honors. Let us recognize your contribution by felicitating you all on this panel. Certificate of appreciation to Manjari Chandraji, the owner and founder of Manjari Wellness. Thank you, ma'am. Next. Thanks to Mr. Sahil Pruthi, the founder of Keto India. Present this certificate to Mr. Rohit Dhingra, the founder and CEO of Infinite Health Studios. Congratulations, Rohit.
Thank you.
Special appreciation to Ms. Farjana Siraj, the founder of Orange Day Holistic Private Limited. Congratulations, Farjana.
Thank you so much. Thank you.
Special appreciation to our senior eminent panel speaker, Mr. Arvind Savagaonkarji, the CEO of Streben Healthcare. Congratulations, sir.
Thank you, Chandan, and it's been my pleasure.
And we present this token of thanks to Mr. Akshara Damle, is the founder of Mano Samvad, for participating as a distinguished speaker. Thank you, Akshara.
Thank you so much.
So with this, may I please invite my colleague Itisha to kindly introduce our next panel speakers.
Thank you, sir. Thank you so much. You have rightly said कि Akshara sir has, one of the best moderation we have in last 2 days. So the way आपने day 1 से अपने panel को engage रखा, whether it's a group or session start होने से पहले आप हमसे ज़्यादा active थे. So wow, it was really wonderful, sir, to have you on board. So let's move forward. We'll be having our panel 5. So this will be the last panel of day and even of the event. So the topic of this panel is role of medical institute in promoting e-learning, research and development, and clinic trials during and post-pandemic. And I would like to invite our eminent panel speakers for this panel, Professor Mrs. Rajita Kulkarni, President Shri Shri University, Cuttack, Colonel Dr. Sunil Rao, Chief Executive Officer, Gujarat Cancer Society, Dr. Saili Gankar, Vice Chancellor, D.Y. Patil University, MB, Dr. B. Sendil, Dean and Director, Health Sciences Vinayaka Mission Research Foundation, deemed to be University Salem, and he is also the Head Transformation, VIMS Hospital Private Limited, Vinayaka Mission Research Foundation. Dr. Vijay Pandya, CEO, CU Shah Medical College, Surendranagar, Gujarat, and Chandan Anand sir, CEO and founder editor, Adacom Media, who will be the session moderator. We welcome you also. Thank you.
Thank you, Itisha, for that wonderful introduction. I'm in fact very blessed and honored to be a moderator of such an eminent speakers of this panel. I've been moderating them in 1 or 2 events many a times. The interaction has been quite well, and happy to see them again. So I start with a small saying that every human being is the author of his own health or disease. Disease is the result of disobedience to the immutable laws of health that governs life. In this passage, Gautam Buddha is talking about the role of karma in health. And to do the justice and to bring the blend of education and the healthcare, this is a wonderful session where we have the eminent speakers representing the academia section of the healthcare, wellness, and pharma industry. So the topic says that the role of medical and healthcare and wellness institutions in promoting e-learning, research and development and trials during the post-pandemic. Let me first of all introduce the panel speakers with their, a very strong portfolio or the profile which they have. I would like to introduce Ms. Rajita Kulkarni ji first, who is the president of Shri Shri University, ma'am. Can you please flash the profile? You have been doing some wonderful tasks, ma'am, under your leadership. And the way I see you and follow you, you have been sharing so much of important information at the Art of Living, and your volunteers who have been working tirelessly for the past many weeks, sheltering refugees and shuttling them down to the safety, providing shelters, medicine, food is really commendable, ma'am. And this kind of work definitely needs a lot of effort, lot of energy, and a leader like you. So apart from being an academician, ma'am, you are a successful banker. You are turned into educator, a best-selling author. Thank you for for sending that book to me, ma'am. I have read that book. That is wonderful, and definitely it is a life-changing book. One should definitely go through the book which you have authored. A global thought leader and transformational leadership coach. She's currently holding various prestigious positions, like she is the president of World Forum of Ethics and Business, president of Sri Sri Ravi, University, member of Court of AI Institute of Science, and a trustee of Sri Sri Ravi Shankar Vidya Mandir Trust, global board members of TLEX Institute, board member of AOL Health and Education Trust, FICCI, and so many institutions, ma'am. You have trained over 1 lakh people in last 3 decades and over 1 million hours of training and development expertise. She's trained and coached leaders from more than 50 countries. She has addressed over 5,000 public events, including at prestigious forums like United Nations, World Bank, European Parliament, FIFA, and many more. The largest audience she has addressed was over 3.75 million people. So under her leadership, Sri Sri University has emerged as a global center of learning and ranked number 6 in the top 25 private universities in India. Congratulations for that achievement, ma'am. So, so with this, we are, and so many allocates and award you have received, Kitty, ma'am. It is a pleasure, and we are honored to have you in this forum. Thank you, ma'am. With this, now I would like to introduce our next speaker. Is the Colonel Dr. Sunil Kumar Rao. He's the Chief Executive Officer from Gujarat Cancer Society. He's a highly experienced hospital administrator, adept at managing P&L, doctor engagement, new hospital commissioning, expert in hospital construction, as per NABH and JCI, operations management, quality and accreditations, NABH and JCI. You have a rich 25 years of experience as hospital administrator in hospitals of Armed Force India, sir, and now you are a proud retired colonel, sir. I welcome you in this forum. It is honor to have you over here, sir.
Thank you very much.
I would now like to introduce our next speaker, Dr. Saili Gankarji. She is the Vice Chancellor of one of the prestigious universities of Pune from Ambi campus. She has worked as a Dean Academics, Dean Management at MIT World Peace University, has worked as a director for 2 flagship institutes of Mayer's MIT Group of Institutions and MIT School of Management and MIT College of Management. And you have a rich 14 years of experience into this institution. She is a national president and National Council for Higher Education of India at Women Chambers of Commerce and Industry, New Delhi. Dr. Gankar is honorary member of National Advisory Council of SME Chambers of India, Mumbai. She also has worked as a chairman and member of various committees namely Board of Studies and Advisory Board of National University and industry levels such as National Institute of Banking and Management, Savitri Bai Phule Pune University, Symbiosis International University, J.K. Lakshmipat University. She has worked with MCCIA as the chairperson for Women Entrepreneur Committee. She has received many scholarships and awards. So it is an honor, and we are so happy to have you, Sally ma'am, in this forum. Thank you so much.
Thank you. Thank you so much.
Our next speaker is Dr. B. Sendil Kumar. It is always a pleasure, Sendil sir, of having you many times on our event, and I've introduced you myself. So you are a Dean and Director of School of Allied Health Sciences, Vinayaka Missions Research Foundation, DU. Hails from a beautiful temple city of Kanchipuram in India and has acquired the following qualifications starting from BDS, MBA, MPH, MPhil, PhD, Doctor in Literature, Doctor of Science, administering nearing 20 UG and 11 PG courses in Allied Health Sciences and 3 different campuses in Salem, Puducherry, and Karaikal. With rich 25 years of experience, including academics, he has published 25 research papers and articles. You've been invited as a guest speakers and panelists in around more than 30 plus international and national events. You are been awarded with many recognitions, and you are very dynamic and versatile person having a quest for knowledge and continuously marching towards this success. Happy to have you in today's forum, Sandil sir. The next speaker for the day is Dr. Vijay Pandya ji. He's the CEO of CU Shah Medical College, one of a very nice college and a hospital in Gujarat. He is a healthcare management professional with a rich 17 years of diversified experience in healthcare. Dr. Vijay is a national award winner in healthcare quality, NABH assessor. He has a proven ability to implement new systems and improve existing healthcare and social environment. Dr. Pandya is a decisive leader in excellent ability to interact with different people simultaneously under difficult situations. Some of the core skill area includes hospital administration, healthcare promotion and business development, capacity building and development of healthcare HR, hospital branding, marketing, NABH accreditation support, etc. So we are so glad and honored to have Dr. Vijay Pandya in this panel discussion. Thank you so much for joining us. So with this, now we'll move ahead by an opening remark from our eminent speakers. Rajita ma'am, you are an author, you are an educator, a global thought leader. And first of all, Jai Gurudev to you, ma'am. My daughter Anusha Anand, 10 years old, is again a student of Shri Ravi Shankar School in Pune. After a huge research, we finally decided this is the right school for my kid. And she's doing tremendously well, starting her day with the yoga, meditation. Because of her lifestyle, our lifestyle is also some way improving a lot. So thank you so much for imparting that knowledge, not only to your students, but via your students to the parents as well. For your opening remarks now.
Yes, Chandan Anandji, thank you very much for firstly curating this very important platform in the day and time that we are to talk about health and wellness. I think is the most important thing. The pandemic has shown that to us, if it did not need to be proven anymore. And I was listening to your comments on the earlier panel that how carefully you curate all the panels with a lot of research. So congratulations on that. All your events are always extremely well structured, and it is great to hear some very, very inspiring people, experts of their fields in this in your events. So the discussion that we are supposed to have today, and you had shared with us some questions also for our remarks. I am not a doctor by profession, though I am managing 2 hospitals and therefore stay guided by the medical experts who are leading that. But I will make a few comments about our approach to health and wellness. Puja Gurudev Shri Ravi Shankar ji's vision for health, it is not just a mere absence of disease, but a dynamic expression of life. So when we talk about health, it is not just that we don't have this or that disease, but how dynamically we are able to express our life in a holistic sense. I'm delighted to hear that your daughter is in our school and is practicing meditation and yoga every day. And that has been our approach as well. I can say in Shri Shri University, we recently 2 years ago only started our Ayurveda hospital. And we started our hospital, and within 1 week, the very, very terrible cyclone Fani hit Odisha. And, it is a new hospital. You want to start it with a certain idea in mind. And within a week, it became a disaster relief setup than giving curative and other kind of medical care. And about 50,000 people we treated in a very short span of about a month and a half. That was the massive impact of Fani. And as that was settling down, within a few months, the COVID pandemic hit us. So with that, we became a COVID care center. And in this period, we were a designated COVID care center for the government of Odisha. And what we saw, Chandanji, in this time is because we are an Ayurvedic hospital, so we have basic intensive care facilities like ventilators and the like. But we saw that 100% of the patients who came to us were able to be cured without the need for a additional sort of a, higher assisted medical care, which becomes available from an allopathic hospital. And all of that happened with the help of Ayurvedic medicines, with the help of a proper nutritious attention to the nutrition and the food. Your earlier panel comments were being made about the importance of food. So food was given attention, Ayurvedic medicine, meditation, yoga, pranayam, Surya Namaskar. Chandanji, with all the, with all their COVID situation, our people were guiding and the doctors were guiding, volunteers were guiding, all the patients were doing Surya Namaskar. And the power of chanting, power of meditation and chanting, listening to our traditional chants like Vishnu Sahasranama, Devi Kavacham. So a combination of all of this, and a positive atmosphere of good energy, also being cared for by doctors and nurses and volunteers who themselves are meditators. I think it created such a positive force, both in our hospital in Bangalore, our Ayurveda hospital in Bangalore, and in our campus in the university. We found that this approach was helpful, and we had 100% recovery. One of your earlier speakers was talking about the vagus nerve. The vagus nerve is the longest nerve in our body, and it is the nerve which is the most influential and impactful to create a sense of wellness. And when you meditate, when you do pranayama, you are impacting the, all the alpha, beta, gamma, all nerves in theta, all nerves in the brain, which then also have that impact on the vagus nerve. So by practice, we have realized that this was working. In Sri Sri University, we are attempting to create a one of its kind integrative medical facility. We are the first university in Asia to start a school of osteopathy, which is a very well-known medical stream in the west of the world. All the prominent doctors who are there here now will know it. So osteopathy, yoga, naturopathy, Ayurveda, and then of course allopathy. So common diagnostics with the freedom for the patients, with the freedom for the individuals to choose, what is their preferred choice of medicine and what is necessary for that time. I mean, if you break your hand, you need to fix it by a surgery, but there are certain other things which can be fixed by lifestyle. And a lot of research we are doing. We are a young medical facility wise, we are young in Sri Sri University, as I said, just 2.5 years old, and we have already begun a lot of research on Ayurveda. A lot of clinical trials are being done on Kabasur Kudinir, on our own formulation NOC19. I know my friend and younger brother Arvind Varchasvi spoke in the event today. Our own Ayurveda facility of Sri Sri Tattva is doing a lot of clinical trials. So I think for educational institutions like us, it is important to keep offering to students educational programs which may be niche, which is what we did with osteopathy. It took us 4 years to launch the program because nobody knew who would give us the permission. There was no precedence, but we are committed to bringing education programs which are niche and cutting edge at the same time, and continue to look at holistic health, which has focus on physical, mental, emotional, and spiritual aspects of our health. And we are doing that in Sri Sri University. I would love to welcome all of you. Next time you can do your conference in person in our campus. And I'm happy to share more and take more questions. I will pause here.
Lovely, ma'am. Thank you so much for that opening remark. Now, may I please invite Colonel Dr. Sunil Kumar Rauji for your opening remarks, sir.
Good evening to all of you. Let me start with thanking our communication media group, Itisha ma'am, and also Upasana ma'am, who have given me this opportunity to participate in this panel discussion. Essentially, my background is purely allopathic background, and this is I am the CEO of two big institutes. One is a medical college and a hospital of 1,000 beds, which is located in Ahmedabad, and also another cancer research institute, which is again a state nodal research institute as well as state nodal agency for cancer registry also, and cancer registry for entire Gujarat state. And that is how we collect data from all other institutes who are participating. It's also part of National Cancer Grid also. So that is how we are involved in many of the research activities, which today's topic is also all about. And also the activities of a medical college in which we are engaged in teaching practices. So from that point of view also, I would like to comment that definitely during COVID, all of us are aware that whether it was first wave, second wave, and a smaller third wave, we were all engaged in by force, I would say, through digital activities, and digital technology helped us in conducting our businesses in terms of the education, in terms of the research. So first comment would be on the research aspect, that is the clinical trials, which all of us participate, especially being a cancer institute. We have plenty of research trials, clinical trials going on. And all of us are aware that in the field of skin, in the field of cancer, in the field of respiratory medicine, in the field of all these internal medicine, and all these branches do have some amount of research, active research going on in the field of clinical trials. And many trials, as all of us again are aware that it is our country is the second largest clinical trial country in terms of clinical trials worldwide. And that is how we keep on getting it. But it requires a very conducive environment. And that is what we lost during COVID. And for that, the technology started helping us. In the first wave, let me be very frank, we were totally taken by surprise. Nothing moved. We just kept quiet. No research, nothing, just keep quiet and treat your patients of COVID. We treated around 7,500 patients of COVID during these two waves. In total, helped the municipal corporation to build a massive reserve for COVID. And also with the help of my parent company, that is Zydus, also we could help a lot of patients with the very cheap medicines, especially for COVID. So in that moment, I would like to highlight that we lost tempo onto the clinical trials. We lost tempo on various things, but definitely technology helped us there, started helping us. It was hit and trial in the first wave, but in the second wave, it firmly got adopted to do telemedicine. First of all, teleconsultations. Secondly, all the data was digitized per force, because for clinical trials, whatever data is needed, that definitely needed to be seen by the monitors, by the project in charges, as well as PIs. And all these data was seen through, of course, the digital media only. And also we could communicate with our patients on various forums like this, Zoom or any other panel. We also had very great help from various international universities in terms of research platforms. Like one of the examples which was very popular in Pune also, that is I2B2 platform, which helped us garner a lot of data on COVID, and we could do fair amount of research publications based on that, whether it was in the field of anesthesia, whether it was in the field of skin, whether it was in the field of cancer as such, and its impact, COVID's impact on cancer, etc. So all that was helped through the research platforms, and we are in touch with various international forums also on online research also. Unfortunately, e-consent and all are still not valid, in the sense that though audio video consents are applicable, but the e-consent was still not there. Though 2019 regulations of Ministry of Health and Family Welfare, we changed the way we do research in our country, but still this aspect is still lacking. I would definitely recommend through the panel, through this medium of this panel, that that also should be included like Western countries, so that it is helpful. for the patients, more patients to participate in the trials, especially in terms of epidemics which come and people hesitate to come to the hospitals. So that is one big thing. But definitely the electronic records helped us a lot in terms of putting data onto to the portals, putting data onto the research field, and putting data for day-to-day communication with the patients. So that's where I will hand over to the host. Thank you.
We'll come back to Yusuf for a more detailed and discussion. It is just an opening remarks. I would like to start with all the panelists first. May I please invite again now Dr. Saili Gankarji, the Vice Chancellor of D.Y. Patil University, Ambi campus, ma'am, for your opening remarks.
Yeah, very good evening to all of you. Thank you so much for inviting us here. And this is very important topic, which is talking about healthcare in Indian continent as at large. Very well set the tone by Dr. Rachita Kulkarni, that how and why we really take care of people, especially the patient who are coming in the hospitals. Having said this, let me tell you that I'm not from the background of the medical education, but yes, we are running the hospital. Of course, along with that, we have the medical campus, which is very renowned in Mumbai, right, and doing extremely well. Along with medical education, hospital, nursing, occupational therapy, Ayurveda, dental colleges are the part of our group, which have been led by the father founder, Dr. D.Y. Patil sir, and Honorable Dr. Vijay Patil, who is the Chancellor and President of 2 universities in Pune and Mumbai. So if we look at it, that the topic is really interesting, and I look forward to have interaction with all the experts, those who are daily dealing with all these, especially with the patient services. I would like to share more of my information on the part of technology, that how it is creating an impact on our medical education and even other students. Gone are the days where, because when we look at it, if we are going on online buying as a customer, things have been changed now, and e-learning, data analytics are now becoming the part of our daily life. And of course, medical education is also not far off it, and it is a part of it and doing it extremely well. So when we look at it, that how are we doing it? When we're talking about moving from knowledge acquisition to more towards the developing competencies for our students. So I think we are going to understand how we all are doing it. Not only that, the digital natives, which we are talking about, the next generation of learners. This is what phrase is being used by a thinker. So how medical education or medical the different verticals which are there are utilizing, exploring the best possibilities. I think that is very important. So what is their approaches to this? How we as management experts or management team at top level are taking the decision in terms of changing the completely, because if we look at it, medicine is this field is experiencing that the use of technology is very important, and it's important for delivery of care. So how are we going to do that, right? I think this is very, very important, and that I think I'll be sharing this. And while doing this, how this technology is helping us for knowledge acquisition, improving the decision-making processes when it comes to the data sciences or the various data tools which we are using, how we are enhancing the perceptual variations which are there, improving different skills which are required for the coordination, right? Or practicing for the rare or critical events which are happening. During the COVID, we were the center which was been given to us, COVID center by PMC in Mumbai, and daily we had those kind of experiences, and where the critical issues were being handled by the team, and then how, while doing this, how teams are being trained, how are they learning, so all these part. And of course, one of the very core area which has been talked by earlier the panel members and the Dr. Rajita ma'am also started with that. How are we going to take care of the mental health of our own COVID warriors? Rather than COVID warriors, I think they're daily taking care of many responsibilities and stress which is coming on them. So I think all this is required to be addressed, and how these technologies are going to help us. I think I would like to share more on this, and that will help me also to understand the other my co-panelists, what they are bringing the experiences on the table, and at the same time how I'm going to learn from their experiences. So let's they look forward to have more discussions in this area. Thank you so much.
Lovely, ma'am. Thank you so much. Now I would like to invite Dr. B. Senthil Kumar, Dean and Director, Health Sciences, Vinayaka Mission Research Foundation, deemed to be University, Salim, Tamil Nadu. Over to you, sir.
First of all, let me thank Mrs. Chandanji and Itisha for inviting me for this wonderful forum. I think I have a privilege to speak in this forum because, I know Chandanji very well for the past so many years. I've been associated with them as speakers, and even I met him in Delhi also when the new normal education took place in Radisson. So it's a wonderful conference. I thought soon we'll meet in offline mode rather than in online mode. Let me talk about this e-learning, role of medical institute in e-learning and R&D or clinical trials. Everybody talk about the COVID-19 pandemic and the way the disruption caused in medical education and healthcare systems worldwide. There's no way a unilateral approach to mitigate education disruption is going to address the complex set of issues in multiple dimensions. But the digital education has boomed in and created a positive impact in continuing education. Why I'm talking about this digital education? Because being in a Vinayaka Mission Research Foundation, 23 institutions across South India. We have a medical, dental, nursing, pharmacy, homeopathy, and allied health sciences. So that I would like to speak about digital education. So digital education has boomed in and created a positive impact in continuing education. The penetration of digital technologies in the educational field is bringing radical changes in the way of education is being delivered and received. The outreach of education program is improving day by day with the digitalization of education. Digital learning in India is going to be the key phase of future education in the subcontinent. But it's quite surprising to see how smart technologies are changing the overall educational framework in the country. Maybe another proposed method also there in digital education, maybe to tackle the challenges pertaining to medical education in the use of telemedicine, as said by Kalner, which has been around for several decades. In contrast to in-person clinical visit, telemedicine involves a virtual visit. It can play a major role in teaching medical students and helping them to gain some clinical experience by interacting with the real patients under the supervision of physicians. However, there is a great concern about how e-learning could be applied to provide clinical experience, especially in the final year of medical school, which depends on heavily on bedside teaching. And maybe in forthcoming session, I would like to speak about R&D and clinical trials. Over to you, Chandan.
Thank you for your opening remarks, Senthil sir. May I please invite Dr. Vijay Pandyaji, the CEO of CU Shah Medical College, Surendranagar, Gujarat, sir. Over to you. Please unmute and speak, sir. Kindly unmute, sir. Unmute yourself. Yeah.
Good afternoon. Thank you very much, Anandji, for inviting me. I am being the most junior of this panel, and I will be humbly putting my thoughts and experiences on the various topics given by you. Particularly, the new normal word is now becoming normal, as we are not expecting the fourth wave, and we are getting the same thing in normal way. As far as COVID wave and pandemic was concerned, that was I think, eye opener for whole community, whole human being, whole mankind. Particularly when everything was not working at that time, social, mental, spiritual, and all those words, psychotherapy, psychology, meditation, all words are emerged. So I will be talking something about all these topics. I am very sad to share news from Gujarat with all of you that in last 3 days, only just like in last 2 days, 3 medical students, two medical students from UG, and one was senior resident, who was a senior resident in general medicine. It has committed suicide. Unfortunately, highly unfortunate incident where we are talking about mental and spiritual health, who are our healthcare providers are also not fit for a provision of healthcare. So I will be throwing some light on all those things. Thank you very much.
Absolutely. Thank you so much, sir. Definitely such kind of session helps us to understand, and if they are not able to join live, we'll be having the live recording of this session, sir. You will definitely pass this recording session to them so that they could get the thing which they have missed, and something could be beneficial for them. In fact, we had Yog Guruji. He was a renowned Yog Guru, and he's been having a lot of world followers. He was there as one of the speakers in yesterday's forum. If you can hear to that session as well, many good life lessons he has shared with us. So I was very impressed with that session. You can go and check that.
Sure.
So with this, Rajita ma'am, I would like to ask you a question. Role of healthcare institution in imparting social, mental, and emotional well-being, ma'am.
Yes, this is a very important discussion, Chandanji, and this one question only we can talk for a whole day on what we can do. And so many experienced doctors are there, Dr. Pandya, Dr. Sunil Kumar Rao, and Dr. Sendil Kumar, who are medical professionals. Like Dr. Saili ma'am said, she and I are coming more from the administration side, managing hospitals. But I can tell you this one aspect, this question you asked, I will share our small experience, all have so much more. So in this last 2.5 years, especially since our Ayurveda hospital started in our university, as I said, Fani hit us. And I cannot tell you, Chandanji, I was there physically on the campus. We are just from Bhubaneswar airport, we are about 45 minutes drive. So it's not like we are out in the wilderness in the interiors anywhere, but we are surrounded by a, huge area, which is a rural area, which is still deprived of healthcare is what I thought, but to what level? It was very, very shocking. The kind of people who were coming, they were not only coming because Fani caused a lot of physical damage, physical, kisi ko chot laga, bruise laga, wo sab to tha hi. But when we were treating them for that, we realized how many more problems there were. So what we have now done is we have adopted is a very strong word. I would humbly say identified about 90 villages in our surrounding. And now we have a team. The whole effort of this is to do holistic healthcare for people of these 90 villages. You can say about 4-5 lakh people are there in these 90 villages, and doing regular health camps, doing basic hygiene camps, doing, de-addiction camps, because addiction is such a big problem. And now then with this COVID situation, all other challenges have happened. So to answer your question, what is the role of institutions? It is a very large role because, of course, we have to be financially sustainable as institutions. We need to make sure that we are able to manage our own balance sheets. But, we cannot be prosperous if there is no prosperity and peace in our surrounding. And I think we owe that responsibility to our communities. So we are, in terms of Shishi University and our hospital, and in terms of Art of Living as a whole, playing a large role about the overall role Art of Living is playing in, especially during the pandemic. Almost 7 crore meals we reached out to the midday laborer, the daily wage laborers who were walking thousands of kilometers to reach their homes. And all our institutions, we treat them as the nucleus of the community, and we treat them as a institution who needs to take the responsibility of the community. Again, physical, mental, spiritual, economic responsibility, social responsibility. So we are doing that, and our experience is that it creates so much goodwill. Dr. Pandya will agree with me. He has brought about this very challenging situation, which is mental health care in our medical, students and medical, last 10-12 days, I was personally involved in this entire effort of evacuation of our medical students from Ukraine. I must admit to all this, my senior colleagues here, that I really didn't know we had 20,000 students studying medicine alone in Ukraine. And I was talking to a lot of them who were getting evacuated, and I realized that most of them didn't go there out of choice. They went there because either they didn't get a seat here, 98% marks milke bhi seat nahi mila, or they went because of the very, very exorbitant cost of health, medical education. So when you talk about, Chandanji, the community, I want you to expand that definition to even this. Our own students as our stakeholders are our community first. So what we need to do to expand capacity, because that also is a service. Even if we expand capacity, like we now have started our Ayurveda college, we got a 60 seat permission. My question is, why don't we get 600 or 6,000 seat permission so that we can cater to the needs? Because that is our first responsibility. And secondly, to give, to reach out to the community, to become the, जैसे हिंदी में हम कहते हैं, हम उनकी धरोहर बन जाए, हम उनके लिए एक न्यूक्लियस बन जाए जहां वो आके ले सके हमसे affordable healthcare. So we are doing that, and I think it is each of our responsibility. I know Saili ma'am's efforts. We are closely associated in many platforms. Their institution is doing a lot of work, but I think here government is doing what it is doing, but each of us as institutions, if we reach, it is both ways. It comes top down, and we need to do it bottom up. I think that's the only way to make our country this really $5 trillion economy that our honorable Prime Minister wants, and a healthy economy. This point which sir raised about the suicides, this pandemic has made it terrible. This morning I was speaking in a counseling conference, and in US alone, 83% Chandanji students are reporting depression. In India, the latest Asian Journal of Psychiatry research says 53% of our students have mild to severe symptoms of depression. That means every one of two students. So we need to do a lot for mental health. I would really sincerely urge through this platform to everybody who is listening, make meditation a part of your daily living on campuses. Help students do yoga, create an ecosystem for that. This has helped us, Chandanji, in de-addiction also. इतने addiction के cases हैं, daily laborers हैं, 100 रुपए कमाते, 80 रुपए खा जाते हैं इसी में. So there is no way to tell and say stop it. If they could, they would. The only way to de-addict them is also through some of these practices like, Surya Namaskar, do yoga, pranayam. Andar se itna bhar do ki, you don't feel the need for these artificial, artificial external things. So a combination of this is needed, and we are very thanks to Gurudev's overall emphasis on service to the world. We have a very strong DNA of service, and we have a very strong awareness and recognition of our responsibility to our community. Of course, what we are doing is a drop in the ocean, so much more to be done, but happy to share more in detail, parallelly, bilaterally also with those who want to know.
Lovely, ma'am. Thank you so much. I think somewhat it has answered Dr. Vijaya's concern, but we have to, ma'am, in fact, we being socially responsible, every human being or individual has to bring certain discipline in his daily life, starting from the time he wakes up to the time he goes to bed. So a certain discipline should be there from his daily habits, including the eating habits, which you rightly said. So yeah. So with this, Dr. Colonel Sunil Rao, sir, I would like to have a different stream and different angle for understanding your experience. I would like to know more about how is technology playing an important role in digitalizing clinical or non-clinical trials, sir?
So in the introduction itself, I had covered some of it, some of the things which you are wanting to know about digitization in clinical trials. So it is at a very preliminary stage, I would say, in our country. It has not reached the stage which other Western countries have reached. Notwithstanding that, as I said earlier, that we are the second highest clinical trial we are having in our country vis-a-vis other countries. That is merely because of for various drugs and trials are needed for the population of our size, such a big population which we have. So the reason why digitization has not taken place to that great extent is because of the ethical aspects, which everybody else is discussing about ethical aspects and welfare and of the human beings, etc., because of the poor population and vulnerable population. So most of the digitization is done on trust. So that trust factor to develop in India would take a long time. Notwithstanding that, during the COVID times, we have all done the trials based on many of the digital technologies, whether those are IoT based devices, whether those are based on electronic medical records, whether those are plain simple scanned and digitized records which were uploaded and checked by the monitors and checked by the project in charges, and various other formalities which needed in a particular trial to be checked were checked from home only, because many of them were not able to come. Even the workers were not able to come. So these things have happened through digital medium only. But still, as I said, even in the hospitals, when we treat patients, we need a physical consent. Still, we haven't got over that phenomena of digitizing these consents also. I think only time will be the solution for this aspect. But consent for every single thing, any procedure, as well as any aspect of research, whether those are side effects or those are effects per se of a particular trial, need to be covered through the consent, and all the adverse events need to be covered. In Western countries, even adverse events and many other events are reported online, and those are tackled online, analyzed online. India has already started in the same process. One of the centers is also my medical college all over India. That is a material vigilance program, as well as drugs related all adverse events reporting phenomena, which is again a vigilance required throughout the country. We are part of that. However, it is again, as I said, in very nascent stage. Lot of understanding of the physicians, lot of understanding of clinicians is required to be built up on this aspect. Same is true about the digitization also. So that is my opinion and reply to your question. Thank you.
Thank you, sir. I would now like to ask Dr. Saili Gankarji, understanding your expertise, are Indian institutions well equipped with e-learning equipment and data analytics to ensure knowledge exchange with global healthcare institutions?
Thank you, Chandanji. It was really interesting session. I would like to divide this the sharing in two parts. One, what we are doing at DY Patil universities, because if you know it, we have 6 universities in Maharashtra, and all of them are in medical education. And if you look at it, in the Nehru campus at Mumbai, we have our medical simulation laboratory, This is a first kind of it in South Asia, which has been